Okay, good morning, family. How was your morning? Good. What's different today? What's different today? what what gets you excited tomorrow? Tell me more. Okay, so let's settle down. So, sino ang gustong mag-conduct ng ating family business? Anyone who wants to volunteer? Anyone? Let's have a lady do it this time. Oh, IB, ikaw na nga.
Okay, sige. So, good morning, family. Wait lang, tignan natin ang ating kodigo. Sige, so, um, tignan natin ngayon, family, kung sino-sino sa family members ang may na-violate na house rules kahapon. So, una, yung nagawa ko. Yung hindi ko nagawa. Kasi ito yung question. Grabe ka. Okay, okay. So, sino-sino sa family ang dito tayo sa nag-iwan ng mga gamit-gamit sa kanilang mga lamis table kahapon at hindi nag-ayos ng kanyang upuan.
At the back, please sit down.
Okay, wala siguro kasi sinong okay. Oh. Ay, tama na. Charger, okay. Okay, so merong isa sa ating family. Sino pa? Sino pa sa ating family member ang hindi organize ang kanyang table kahapon after ng sessions? Pati cheer po. Paki-alala lang, baka na-memory loss na dahil siya ang concern ngayon. Wala na? Okay. So, sino ang gustong ah, sino ang gustong magbigay ng kanyang payo sa ating isang family member na hindi organized ang kanyang table kahapon? Volunteer. Kuya G.
Bago ang lahat, baka may nakapulot po ng sa iPhone charger ni Doktora. Sa sobrang makakalimutin na ni Doktora ngayon, pati yung charger po niya na kinalat niya dyan, nakalimutan niya. So, may ibang kumuha. So, pakibalik na lang po kung sakaling naitabi po natin. Baka hindi niyo po charger. Sorry. Pero Doktora, seriously, awareness lang talaga lagi pagdating sa mga gamit natin. Make sure na pagka tumatayo tayo, nailigpit na po natin lahat yung mga gamit.
Okay. highlight what's the underlying attitude. Next.
Okay, thank you po, Kuya G. Thank you, Doc. Pwede na po kayong umupo. Okay, next na concern po natin family is sino-sino sa family ang gumamit ng kanyang cellphone habang si Doc Purpose ay nagle-lecture. Ako, grabe. Grabe kayo.
Okay, address the attitude, okay? In your elaboration.
Okay. So, sino sa family ang gustong mag-address ng ating concern? Ay, okay. Okay, may nag-volunteer po si Doc Robin.
So, maraming gumamit ng cellphone Ngayon, ina natin yung refusal technique naman kung bakit or CBT natin sila. Sila naman ang pagsasalitain ko kung bakit nag-trigger yung nila, yung paggamit ng cellphone. Doktora, bakit ka nga pala gumamit ng cellphone? But ano yung
Doc,
cause ng nag-trigger sa'yo?
Doc, we don't do that. Straight out, pangaral.
Ganun na. Sige.
Sorry
Sorry
ka
po.
mag-create. Pwede ka mag-create ng dissonance.
Sige. Yung mga gumagamit ng cellphone, siyempre, respect naman si Dr. Purpose para sa, habang nagsasalita siya. Disrespect kasi yung mga ganun. Parang hindi ka kasi nakikinig sa mga sa lecture niya kapag at saka hindi rin, siyempre si Doc, hindi niya naman alam kung naintindihan nyo or hindi nyo naintindihan yung lecture niya. Okay po.
Thank you po, Doc Robin. At thank you family sa pagiging honest. No? So malayo ang mararating ninyo dahil sa iyong honesty. Okay, so yan lang po family ang aking iko-concern or i-pull up kasi kailangan nating makarami. So yun lang po, Doc. Maraming salamat po.
Thank you. Amat? Okay, so how about giving an affirmation? Sino may affirmations for anyone or any group? Any affirmations? All right, Gilbert.
I want to affirm the whole group kasi kahapon parang first time na nakita kong maayos po talaga yung mga tables natin at saka mga chairs nung umalis. So sana panatilihin natin kahit nawala na tayo dito sa training. Sana yun yung maiiwang magandang takeaway natin sa ginawa natin. Sana maging regular na practice na natin yun.
Okay, sa affirmation, walang direction, no? You just affirm a person. That's it, no? Okay, walang pangaral. Okay. Any affirmation? Okay. Ladies first, Vincent. Go ahead.
Good morning, family. Gusto ko lang pong i-affirm si Ate Adeline, si Ate Abby, Apo. Ate Joanne, Dr. Ferda, Ruby, Kuya Ivan, mga ate and kuya, thank you po sa pag-share ng food. Thank you.
Okay. Thank you. Vincent.
So, maaari po bang tumayo si Kuya Raymin? Si Doc Franco? And then si Sir Ivan? And Sir Gilbert. So, ayun, gusto ko lang i-affirm yung ginagawa nyo during our sessions na nagtatanong-tanong kayo kay Dr. Faz. Sa pamamagitan nyo, natututo din kami. So, thank you.
Sino pa may affirmation? Anyone?
Kung meron dapat i-affirm dahil sa arami ng tanong, yung valedictorian natin, si Dr. Jilin po. Mas marami ako natutunan sa kakatanong niya. Ayun, mas marami po kang natutunan sa kakatanong niya. Dami yung tinatanong na very relevant sa program.
Okay. Yes, Dr. Jalen, you always pay attention. In all the trainings I did, you always do. You're very consistent. Okay, you always pay attention. I appreciate that. Okay, sino pa po ang mayroong affirmation? Okay, Doc.
Dr. Robin. Gusto ko i-affirm si Dr. Robin and then Sir Toto po. Tsaka yung passengers na nila. Ma'am Sayla, Ma'am Ann. Ayun. Sorry. Bale, gusto ko silang i-affirm, Doc, because dahil sa kanila, Doc, dahil sumasakay po kami sa kanila and then nakakapasok din kami on time dahil sa kanila. Thank you so much, Doc Robin and Sir Toto po. Natipid din po kami. Thank you.
That's a long commute. Okay, sino pa po ang mayroong affirmation? Okay, Dr. M.
Gusto ko lang i-affirm lahat ng nandito ngayon. Kasi kahit na buong araw tayong nagte-training, naisasabay natin yung work natin outside dito sa conference na to. Ayun po.
Okay, very good. Sino pa po? Mayroon pa ba? Okay, Ivan.
Gusto ko pong i-affirm sila Sir Toto at saka si Sir Raymin. Ayun. Ayun, dahil nag-volunteer sila kahapon for the role play even if it's hard to perform in front of the crowd, but they did it, so they were able to conquer their fear. Good job.
Okay, very good. Sino pa po? Wala na?
Good morning, family. Gusto ko pong i-affirm ang buong family. Kayo. Dahil po sa inyo, gusto po namin kayong i-affirm in behalf of Sir Ivan sa pagiging mabuti niyo po sa amin sa mga pagkain sa tabi, sa mga sharings at learnings na dadalhin namin sa SOC Sergeant TRC. And of course, Dr. Ferpa. Thank you, family.
Okay. Meron pa po? Okay. Very good. Thank you. That was a good one. Right? Okay. That's a nice way to start our day. Okay. So let's start our new topic today. We'll talk about different themes of relapse prevention. No? So there are actually, in this model, there are 12 themes. So I try my best to actually cover as many. I may not be able to cover all the 12. Pero kahapon, I covered just very quickly all the 12, no? To sa lecture na yon. So now we'll focus a little bit more on some of them, okay? Sige, simula. Okay, ito ang una. No, in the 12 things, unahin natin to. Erroneous beliefs and perceptions about relapse. Okay. Ano yung mga maling paniniwala about relapse? Okay. Yung client, sa client, ito yung mga maling paniniwala. I'm a failure. There's nothing I can do. Di ba? Naririnig natin yan, no? Sa mga hindi ko talaga maiwasan, no? Ang aking paggamit. Ano pa? I can't tell anyone it's too embarrassing. No? Hindi. Mahirap ipagtapat ano talaga yung buhay ko, yung paggamit ko kasi nakakahiya. Di ba? Alright. Another one is since I sleep, there is no hope. So let me just go all the way. Yan, sa thinking nila ba, pag they had a lapse, right? Pick up sila, tumigil ng paggamit, nag-pick up, yun, nagiging hopeless na. Di ba? So that is also erroneous thinking, no? Na dahil lang sa hopeless na siya, sige na lang, gagamit na lang. No? Okay, so that contributes to continuing drug use. Another one, I'm so ashamed and my counselor will be angry at me. Nag-pick up siya, no? So, sa isip niya, pag nagsabi siya sa counselor niya, magagalit yung counselor. No? So, at nahihiya siya. Ano ibig sabihin nun? Yung relationship niya sa counselor is what? Maybe the counselor is maybe not accepting. Diba? So, probably yung counselor communicates to him na you know, you cannot ever get high again. Para bang ganun? Ang message ba? Kasi pinaghirapan kita, marami akong oras na ginamit sa iyo, lahat ng effort ko sa iyo, you better not use again. Parang yun ba ang message, no? Oh. So ngayon, nag-pick up siya. So, hindi niya alam anong gagawin niya. Takot siya, magagalit yung counselor. Okay, so ano ang noon? Ano ang resulta noon? Di magsisunungaling na lang siya, di ba? O kung magtatapat man siya, ako, konti lang naman po ang ginamit ko. Pero actually, hindi naman konti, di ba? So, hindi dapat ganun ang message, di ba, sa kanila. Kasi totoo yan eh. Kahit na pinaghirapan mo na todo-todo yung isang residente, you'll never know, no? Malamang maggamit uli yan. Malamang. So, expect the worst, di ba? So, kung ikaw mismo ang na-disappoint, ano ibig sabihin noon? No? You're so disappointed, di ba? Doon sa client, na para bang pinersonal mo yung pagtulong sa kanya. Di ba? Pinersonal. Hindi dapat ganoon, no? Although talagang well invested tayo, we should be able to kind of step back. Di ba? Yung tinatawag nating rational detachment. Remember, we learned that? Rational detachment. Kung may rational detachment tayo sa ating mga kliyente, we will not feel personally offended, right? If they make a mistake, like picking up drugs again. Kasi pag ganun ang relasyon mo sa kanya na kahit na hindi ba yung message mo sa kanya na nako, wag ka talaga magagamot, di ba ganun? Masisira ating relasyon. Hindi encouraging to the client to tell you the truth, no? Kasi hindi mo ang communication, ang kino-communicate mo sa kanya, hindi ka bukas sa pagkakamali niya. So sa ating mga residente, kasi yung chances of relapse is very high, we should communicate to them na, okay, we expect you, yun ang expectation, hindi ka gamit, pero pag nagkamali ka, you should be able to come to me and talk about it. Ganun dapat, no? Open ka sa possibility na magkamali siya. Okay? So again, wag mong personalize yung pagtulong mo sa kanya. Keep it professional all the time, no? Okay. If I share my thoughts or feelings of my urges, they'll think I'm a failure and I'm still weak. Right? So, for example, doon sa mga mag-aftercare na, yun eh, maingat sila ng mga sasabihin sa'yo. Kasi ang tingin nila, baka mamaya i-hold back ako ba? No? Sa programa. So, kahit na may mga nararamdaman siya na natetempt siya, may mga urges siya, hindi mo ma-explore kasi hindi niya sinasabi. Okay? Remember what I said yesterday na yung mental reservation na kahit na positibo yung residente, handa na siyang lumabas, may mga mental reservations pa rin yun ng paggamit ng gamot. No? So, kailangan ma-explore sa kanya yon. It gets very tough kasi pag malapit na siyang umalis, ano siya, nag-iingat ba? Baka mamaya ma-hold back siya. So, yung ingat niyang yun, lumalabas sa minimize niya yung problema niya, minimize niya yung urges, minimize niya yung reservation niya, di ba? Kailangan mapalabas natin yun. Okay? Di ba? So, yun, no? Lalabas yun. Depende sa relasyon mo sa kanya. Di ba? Kailangan, it requires really a high level of trust na kahit na ba may consequence na posible siyang i-hold back that he will actually talk about with you. Ganun, dapat katibay yung relasyon niya sa iyo. Di ba? Ano yun very sensitive yun to talk about, honestly, I'm not sure about alcohol. Dapat ganun mga conversation, di ba? Honestly, pag in-offer ako ng marijuana, I don't know. Hindi ko pa naisip yan Di ba? Hindi ko naisip yan. Hindi ko naisip yung alcohol. Okay, inisip ko lang yung shabu kasi yun talaga ang nagpabagsak sa buhay ko. Okay? So yun, klaro sa akin yung shabu. Pero yung alcohol, hindi ako sigurado dyan. Ganun yung takbo ng utak ng ating mga residente. Di ba? Kahit na ano yan, nasa aftercare na. Di ba? Ganun pa rin yan. Okay, so, but do you initiate the conversation about that? Whoever ever did that, explore with your resident what is his position about alcohol and the other soft drugs. Did anyone do that? Wala. Okay. Philip.
Doc, it's included in our CBT session yung topic na alcohol, argumento sa alak. So, nai-elicit namin yun, Doc, and nag-explore kami sa kung ano ang disposition nila towards doon sa kung babalik ba sila sa pag-inom or may chance ba na uminom sila. So, usually, Doc, matigas sila na hindi nila kayang iwanan. Kasi unang-una, the very reason is parang na-enculturate na kasi sa atin na kapag may okasyon sa Filipino setting, dapat may alak. So, yun yung bagay na parang nahihirapan sila.
Okay. So, good. I'm glad that you have that, no? Hindi lang alcohol, kundi yung mga soft drugs. Marijuana, some of them consider marijuana as not a big deal. No? It's not a big deal. So, if it comes their way, I might use it. So, don't stop with alcohol, but other substances other than hard drugs like shabu, heroin. Okay? All right. So, dapat ganun yung discussion. Okay. So, culturally, justification yan, Philip. You understand? Justification. Kasi yung alcohol, kahit saan ka pumunta, present yan. No? Doon lang nga sa aeroplano, sumasakay ako, Anong gusto mo, sir? White wine? Red wine? Okay, di ba? Oh, sa US, ganun din. Thanksgiving, Christmas. Part yan. Alcohol. You go to certain people like the Italians, right? Part of their meals, alcohol, wine. Okay, the fact is, regardless of cultural practice, would you risk your life? Would you risk your sobriety by trying and taking it, right? Yun dapat focus on that. The other thing, ang conversation would be, okay, so the way you handle yung drugs, for example, yung shabu, di ba? Nagka-problema ka dyan, Ibig sabihin noon, ang personality mo, pagdating na sa substances, hindi ka marunong mag-regulate. Hindi mo mare-regulate yan, Kasi tingnan mo, alam mo na nasira na yung buhay mo, di ba? Pero you cannot really handle it. Tuloy-tuloy pa rin, di ba? In some cases, yung tao na, in some cases, sira na yung buhay ko, I have to step back and whatever it takes for me, I have to stop using it. You're not capable of that. And accept that reality, no? Kasi hindi nila matanggap yun na gusto nila, oh, come a time I can actually control. Yan ang thinking yan. I can control. Because nakikita niya, bakit yung mga ibang tao nakokontrol, ako hindi. Di ba? Siguro may diferensya sa akin. Ayaw niya tanggapin niya na posibleng iba siya sa ibang tao. Nakuha mo? Ang tingin niya doon, dahil hindi niya makontrol, may diferensya siya. So, ipuprove niya na, wala akong diferensya, tulad din ako ibang tao. So, I'm gonna try my best to try and see if I can control it. That's a dangerous thinking. So, ikumpara mo yan sa diabetes. Some people are prone to diabetes, and so they cannot actually indulge too much in certain food. Yun ang reality noon. Some people are prone to hypertension. Di ba? Prone to hypertension. Ganun din yun. So, addiction to drugs is no different than some of the medical things. So, ikumpara nyo yun doon. No? Yung mga medical issues ng familiar sila doon kasi marami naman tao na may diabetes, may hypertension, which are actually controllable conditions. Di ba? In the same way, you know, yung thinking mo na pwede mo i-normalize, hindi applicable sa iyo yun kasi may deficit yung sistema mo. So break it down to them in a way that they can really understand. Okay? Kasi hindi ka pagdating sa substances, yung katawan mo ibang response kaysa ibang tao. Hindi kaya niyan maging mag-moderation, no? Okay, pag gumamay ka, pagdating sa drugs, tuloy-tuloy yan. And you have to accept that reality. So once na-accept nila yun na, okay, that's one of the things that that's me, that's part of me. May i-process niya yun hanggang matanggap niya yun talaga. Ganun talaga yun. Madali na yung okay, alcohol. I cannot touch alcohol. Other drugs, I cannot touch other drugs because I have a tendency to overdo it. It's not them, it's their brain. It's just the way their brain works. Right? Okay, so, and yun ang dapat talagang i-explore, no? Bago sila lumabas. Kasi, ang nangyayari yan, pag hindi mo in-explore yun, tapos paglabas nila, tapos they start drinking, right? And then, little by little, kasi hindi na siya pwede gumamit ng shabu, right? Magko-compensate yung mind niya, yung isip niya na, okay, since hindi na ako makagamit ng shabu, ang aking enjoyment na lang is alcohol. Enjoyment is alcohol. Di ba? Yun na lang ang gagamitin ko. But then, it will escalate. Kasi nga, sabi ko sa'yo, they don't know how to really moderate yung substances, di ba? Mag-escalate yung alcohol use na yan. So, once that alcohol use escalates, ano mangyayari? He'll cross over to his favorite drug. Okay? He'll cross over. Una-una, yung judgment niya is faulty pag inom siya ng inom. Di ba? Na-apektuhan na yung judgment niya. So, eventually gagamit. Ganun nangyayari sa yung mga dating nasa recovery and then started drinking alcohol. Many of them ended up doing that. Or, if they stayed with alcohol, they become alcoholics. They use it excessively. I can tell you many stories of people who actually ended up doing that from treatment. But back in the day, yung data, walang policy about alcohol. I'll tell you a crazy story about alcohol and the TC in data. DATAP is one of the oldest TC in the US, in New York, no? So, back in the, I would say, 70s, they realized that, many of the residents in treatment drink after the program. But at the time, heroin ang ang primary drugs nila, no? Heroin. So ang thinking ng mga early people in TC na hindi naman the same category ang alcohol doon sa heroin. Di ba? So, parang may tolerance into alcohol plus yung alcohol is socially acceptable. So, it's hard to actually tell science that, you cannot drink alcohol, right? Because it's legal, right? So, what they did is there is something that called drinking privilege. This is a TC. So they allow residents to earn a drinking privilege. Ginawa nilang pribileyo. Crazy, right? Okay, so what they even do is yung mga residente na malapit ng lumabas, sinasama nila doon sa ibang older nasa re-entry na to actually see how they drink. But they drink. Okay? Tinitingnan nila, kaya ba niyang pigilin, ganon-ganon. Na ito ba, kaya niyang pigilin yung alcohol. That's what they did. And then after that, once they say, okay, hindi man siya uminom ng excessive drinking, so, okay, may pribilehiyo ka na ngayon uminom. So they made it a privilege to drink. Okay? But down the road, they realized that many of these people who were actually ex-heroin addicts, who went through treatment, they end up using alcohol excessively. Some of them ended up having very bad liver. Some of them ended up dying because of alcohol. They realized that they were actually hurting their liver much later on. So many of these people eventually realized that I cannot go back to anything. I cannot drink because I tend to actually use it excessively. Some of them were smart enough to realize na hindi nila pwede ipagpatuloy yun, pero mas masisira ang health nila. Pero yung iba, damaged na yung liver. Because, you know why? Because when they were using heroin, it was already damaged to begin with. Na-apekto na yung liver nila. Many of heroin addicts have a very bad liver. And then they are given privilege to drink. It even made it worse, right? So many of them, they stop drinking, but they have very bad liver. So all their lives, they suffered from liver problems. Okay? But the damage was done. The other people, they were never able to actually stop drinking. They became alcoholics. You know what? You follow what I'm saying? So some of them, later on they realized I cannot really touch any drugs because of my tendency is to use any substances in excess. Okay. So TC went through that process too. And it was terrible actually, the outcome of it. So, we should learn from that lesson, right? That actually we have to train our clients to believe that they cannot touch any substance. It's not safe to touch any substances for them. It's risky, okay? Some people are able to, after treatment, are able to drink. This is what I observed. If they have a long-term sobriety, matagal na silang normalize yung buhay nila, no? Normalize yung buhay nila. Some of them are able to drink but not do it in excess. But very rare. So, since some can and some cannot, you really don't know until you start doing it, until going back to drinking. So, my philosophy there is don't touch it. Be safe. Don't touch it. Accept that you cannot because the possibility of you going back to alcohol is high. The other thing with that is like this. See, life is unpredictable. And moments in your life or history in your life, there will be moments in your life when you are actually high risk to using substances. For us, it's alcohol. Okay? So let's say you lost somebody. You're in recovery, right? You lost somebody. You stop drinking, you stop getting high. Right? And then you start drinking. Just to cope with the loss. You're very vulnerable at that point in time. Right? Psychologically, you're very vulnerable. What are the chances of you using that alcohol excessively to help you cope with the loss? Very high. Right? So before you know it, you're indulging in it excessively again. So life is like that, no? In critical times in our lives when we suffer some setbacks, like emotionally or psychological setback, that's a very vulnerable part of our time, no? Of our life. So if you're a recovering person and you use substances, you are most likely to overdo it. Okay? The other thing is if you are using substances, very likely mataas ang tolerance mo for alcohol. if you're an ex-user. You understand? Some of us, after 3 beers, that's it, right? If I drink more, I'll begin to feel different. No, I don't like the feeling. Some of us, 3 bottles, 4 bottles, we're drunk. Some people can drink forever. I'm telling you, I can drink a whole lot and still do not show, toxicity of alcohol. I'll give you another interesting example. A guy who I work with, he was a bus driver for the New York Transit Authority. He was sent to us because he had an argument with a passenger while he was driving a truck. So he was reported by the passenger that he was, inappropriate in treating him. So he was asked to go down to the office to test alcohol. His alcohol level is so high that if actually that level is with some of us, we would be passed out. That's how much alcohol he had in his system. And yet he was driving the bus. And he did not get into trouble because of traffic. He just had an argument with the passenger. So when he came to us, I asked him, I said, how much alcohol did you have in your system? He said, I don't know. But I had a lot to drink. And he says, I can drink a lot, but I will not be like staggering all over the place. I can handle it. And this guy is just thinner than me, right? Small built. What does that tell you? His body can tolerate alcohol that much. However, he doesn't know, but it's eating up his liver. Right? You know why? Because the liver was overworking, trying to detoxify his body from too much alcohol, but he doesn't know it. So some of us are built like that, right? So this is a danger. That he is a dangerous alcoholic. Okay? My brother is one example of that. He has 1 beer, he is red all over. You have some of those? Yeah, 1 beer. He is so red. I said, wow, he cannot handle more than 1 bottle of beer. Okay? Both of that are signs that the body is not normal in processing alcohol. The excessive one and the one. It means, my brother's body is saying, alcohol is toxic to you. That's why he gets drunk. Well, maybe that's the body's way of preventing him from dying from alcohol. Okay, so he just drink one, and he's it. That's it. Okay, the opposite is true too. Some people can drink excessively and do not show, the adverse effects of alcohol. Okay, so this is a real story about the driver. So you don't know. It's hard to how people's body would process alcohol. But definitely, if you have been a drug dependent and you're dependent on one substance, that dependency can generalize to any substances. Okay? So we have to I guess, educate our clients, but alcohol, sell it to them. Because you're right. It is so accessible. It's not illegal. That it is very easy to actually rationalize the use of alcohol. Right? And then yung comparison. Okay, compare other people and say, hey, other people can drink and do not get into trouble. Why can't I? Big question for them. So break it down for them. Why? And don't ever try to see if you can handle it. Right? There's no need to do that. All right. Got it, guys? That's a tough situation, but I'm glad, in your intervention you have that. That's in many people who work in the field, they don't touch that. They don't talk about that. But that's very true. They are in a ambivalence. They're ambivalent about alcohol even when they are about ready to leave the program. So address the ambivalence about alcohol. Does that make sense? Yeah? Okay. All right. All right. Let's look at the counselor part. He's a hardcore. A common level label that we give our clients. We look at the psychosocial, and it says they all started using drugs at the age of 13, marijuana, and then he has been using shabu for 15, 20 years, been in and out of prison, keeps going back to drugs. Oh, hardcore yan, hardcore. Right? Hardcore. I don't want that guy in my caseload. Hardcore yan. All right. Right? Okay, so, kinahon mo na kaagad yung tao, nakita mo lang yung psychosocial. Di ba? Not a good practice, okay, guys? And, so, imagine, nasa caseload mo yun. Di ba? Ang tingin mo sa kanya, hardcore to. Okay, so ito, nasa programa, he was doing okay, and then, he had a slip. At talagang hardcore ka. Di ba? Avoid those kind of labels. They're not actually helpful at all. They're not helpful at all. Let me tell you this. People will surprise you, right? Sometimes, tingin mo yung tao, mukhang itong taon to, walang ginawa sa buhay niya, kundi maggamit. No? And then, tinignan mo history niya, wow. Broken homes, di ba? Unemployed, in and out of prison, use a lot of drugs, di ba? Magiging pasawayan. Di ba? Magpapasawayan sa loob. And then, all of a sudden, he responded to the program. He's doing okay. He was not a problem, right? Have you had those situations na kinahon mo siya, yung prejudice mo sa kanya, napakataas, tapos nag-respond sa program, nakakagulat, no? Ibang-iba yung expectation mo sa kanya. That's what I'm saying. People will surprise you. Another situation. This guy, wow, comes from a good family, di ba? At least high school graduate, di ba? Only started using drugs in the last 5 years. Okay to, madaling hawakan to. Mala mo, siya ang nangunguna maging pasaway dun sa loob. Have you heard those? In-expect mo na he will respond to the program better than the rest. Pero siya pang matigas ang ulo, ayaw sumunod. Di ba? Siya ang nagbibigay ng mga sakit sa ulo sa inyo. You have those? Na mali yung mo, wow. That's what I'm saying. Do not put people in a box. Okay? Because you'll never know. You will never know. The people whom we least expected that they will do well in the program, yung pamisa na lumalabas na maganda ang response sa programa. Okay, so, stop passing the judgment, right? Okay, wag mong kahunin. So, treat them like the same, because there is always human potential, di ba? Hindi mo alam what will trigger that human potential, what will trigger the resiliency, right? You'll never know. Maybe this guy who is hardcore, quote unquote, finally found a place now. I've been looking for this place to really get my life in order, right? So I'm gonna put this to good use. Maybe those are the people. Those people who are like, mga spoiled brat, di ba? Yun yung bibigay sa'yo ng sakit ng ulo. No? Na pagdating dito, very demanding, very entitled, question lahat. Di ba? You expect them to be more adjusted to the program, but they are the most maladjusted in the program. All right. Next is he's treatment resistant. Again, the same thing. He's treatment resistant. He was just asking questions. And then you already said treatment resistant. He's asking questions. Right? Okay. So, not a good label. No one should relapse. No one should relapse. You'll be surprised. No one should relapse. That's another expectation. Pinagdaanan nyo dito, we treated you very well. Tinuruan ka ng maayos dito. And then, babalik mo pag, gagamit ka ulit. No. You cannot do that. Don't relapse. You disappoint or betrayed me. Oh, okay. So when you feel like somebody gets high and you feel like betrayed, you have to look at your relationship with your client. That is a dysfunctional relationship. If you feel that way. Di ba? Pagkatapos ko siyang gano'n, takbo. Binigyan ko siya ng mahalagang panahon. Okay? Nag-invest ako sa kanya. You had so much expectation. You over-identified with your client. That's what happened. And you over-identified like that. Mas masama pa yung loob mo at ikaw pa nasaktan kaysa sa kanya ng paggamit. Yeah, there is something wrong with that relationship. Okay? Take a look at that. All right, next. You better not relapse. Di ba? You better not relapse. Pag ganun ang ano niya, ang expectation mo, naku, mahirapan niya pag nag-relapse. Mahirapan niya magsabi sa inyo ng totoo. Ano ba talaga nangyari? You want a straight, honest story when they relapse. So you can help them avoid committing the same mistake next time. And you won't be able to do that unless they're totally honest about what happened. No? Don't even think about it. All right? The same thing. Once and you are out of here. Okay, another one. We have zero tolerance for relapse. Same. You are non-compliant to our drug-free rules. Okay, all of that are like, what it does, all of that, communicates to your client, you better lie if you use drugs. All right? And that's what's going to happen. And I'm going to tell you the whole story, which is counterproductive. Okay. Erroneous beliefs, right? Both our clients and ourselves, we have some erroneous thinking with regards to recovery, especially relapse of clients. Okay? All right, cool. Questions before we move to the other thing? Dr. Lydia.
Doctor, with regards to the erroneous belief, no, what if you use that as a strategy to correct the client? Is it okay? Like for example, yung parang ipapa-feel mo sila na disappoint ka for doing that. Although you're not investing, parang iaano mo lang na gagamitin mo lang siya as a strategy.
Doc, you don't have. Okay, Doc, you don't have to say that. They already feel that way. Kung mayroon kang matibay na relasyon dun sa residente, that's the first thing that they feel. I disappoint my counselor. So don't rub that in anymore. Yun na nga nararamdaman niya, di ba? So, okay, disappointed na siya. Kaya, pag minsan kinakastigo natin yung anak natin, nasasabihin niya yan. So, masama na loob ko, ma'am. Bakit mo na idiin? Di ba? Huwag mo na idiin. Ganyan na nararamdaman ko. Okay, hindi nakakatulong sa akin. Di ba? Marinig mo yan minsan. Pag, ikaw kasi ganyan. Di ba? Sinabi ko na sa'yo. Ganon. Di ba? Pag we reprimand our children. And then, they feel like, ma'am, alam ko, sorry. Ganon ta. Okay. Hindi productive, Doc. Pag you dwell on that. No? So, move it. Kasi, ano na siya eh. Bagsak na nga siya eh. So, now, ang tendency natin, let's lift it. No? Okay, Doc.
Doc, is it okay, kasi based from yung lecture niyo yesterday about role-playing, so is it okay if we could, yung latter part ng program, let's say, papunta na siya ng pre-release and matatapos na siya ng aftercare, we should have more of role-playing po. In that way, we are, in a way, nag-i-imprint tayo ng positive, sa kanila. I mean, na-exercise na nila yung sarili nila na this is actually the real scenario that they might be facing once they are outside. So I was thinking along that line po. And then another thing po, siguro Doc, we should practice using proper words. Kasi Doc, may nabasa kasi ako, yung let's say sabihin ko, don't think of a pink elephant. So at the back of your mind, you're thinking of the pink elephant. So if you're using that word na, you should not relapse. So at the back of their mind, they are already thinking of relapse. So why not reward it in such a way that the brain would not perceive it as something na kailangan ko siyang gawin. Parang may mga ganun po kasi ako nabasa, Doc.
Okay, so yeah, you're giving him ideas, in other words. Okay, so we don't use those words. Okay, that's my point. There's no need to use those words. Di ba, yung sa prevention, for example, di ba, before we used to tell them how horrible, dangerous drugs are, it creates the opposite effects. They get more curious. Right? The more dangerous it is, the more inviting for them. Adolescents. Kaya ko yan. Kaya ko yan. Sige, subukan nga natin. Ganon. Di ba? Opposite effect. Kaya sabi mo yung yung dangerous daw yung drugs. So, we changed that. That's a very old approach, by the way, of trying to prevent drug use. So, no. Okay. Yung sabi niyo, Doc, na role play, no? Na, pag nag-role play, we're preparing them to possible actual scenarios sa labas. That's actually the whole idea. No? Kasi they found out that if they practice a behavior, right, when the actual situation arises, they're more likely to actually do it. Kasi na-practice niya na yun eh. As opposed to, you did not practice. That's the whole idea of role play. You role play mga scenario and how to respond to it. How what you say, how long you stay in that situation. Yeah. So if you can come up with a lot of those, you can develop like role play in all of those learning modules. Do it. It's the best tool that you could use. All right. Questions? Comments? Are we good? Yeah? Okay. So we move on to the next theme. Okay, next is helping clients identify high-risk relapse factors and develop strategies to deal with them. Okay, let's take a look at this. Alright, high-risk factors. Na-discuss na natin kahapon to. So, a form of review, no? Sa akin, repetition sometimes is good. So, it sticks to our brain. Okay, so you'll find some of the things familiar. Okay, put in different ways. Alright, high-risk factors are critical situations in which clients use alcohol or drugs prior to treatment. The factors usually involve intrapersonal and interpersonal. So, intra is external, enter is within the person, internal. Okay. The need to recognize the risk of relapse and high risk factors as well as develop appropriate strategies to counter them are essential components of recovery. Okay. All right. There are a variety of assessment strategies to identify high-risk factors or situations. All right, so let's look at those. Intrapersonal factors, internal. May interpersonal. Wait a minute. Mali yan ah. Intrapersonal. Tama ba yan? Intrapersonal. Okay. Negative. Okay. Intrapersonal. Okay. Yes. Yeah. Intra is internal, right? Yeah. Okay. Negative emotional states, high risk factors. Remember we talked about that. Anger, resentments, and our clients have a lot of those. Yung anger na nakatago, no? Na they're still holding onto it, pero matagal na talaga nangyari. And it's common for people who have been emotionally and physically or sexually abused. They hold a lot of anger in them, All right, and those could be trigger. If they ended up using substances, it can be triggering for them. Okay, anxiety, depression, frustration, boredom, they're associated with the highest rate of relapse. So, di ba, negative emotional states, we talked about that yesterday. That's, a common risk factors or high risk factors. Negative physical state. A chronic pain. Chronic pain is another one. Positive emotional states, celebrations, intense excitement. Okay, we spend some time talking about that. Huh? Testing one's personal control. Yan yung sinasabi ko. Using willpower to limit consumption. He wants to test his willpower. Okay, if he can use his willpower to limit use, that never worked. Okay, but they will say, I want to try and see. I've been drug free for 9 months. Okay, 9 months. So I can control this already. Okay, and then I'm gonna go out there, party, and I'm just gonna avoid using shabu. I'll drink very little. I'll be fine. That doesn't work. That is a setup. Urges and temptations. Okay? Those are high risk factors. The thing is, do not expose yourselves to situations that can elicit or illicit urges and you are tempted. Right? It's a setup. Oh, again, clients say, okay, I'm going to go to a party and I'm going to use. I'm just going to test myself and see if I can handle it. Wrong. Okay, don't expose you because you understand cues and triggers. Yeah, those are powerful things. Your classical and operant conditioning will begin to, right? Yeah, cues. You go into a party. There are so many triggers, many cues there that reminds you of the past, right? So the risk of you picking up is very high in that kind of situation. Your mind changes depending on environmental factors. You know that, right? Yeah. They don't realize that. They don't know that. Your mind is gonna change. Your mindset is gonna change. Right now, you are in a safe environment. You are in a TC, right? So you don't think about getting high, right? Because it's a safe environment. There are no cues. There are no triggers in this environment, right? But when you walk into a bar or into a party, that's a different environment. Okay? Different environment. Your mindset also shifts in accordance with that environment. Okay? So now your mind is bombarded with so many cues, okay, and triggers, and then you begin to think, oh, maybe I can try a little bit. That's the beginning. Then, mamaya, okay, I've used already one. Oh, siguro dagdagan ko lang ng konti. Oh, okay pa naman eh. Makokontrol ko pa rin to. Okay. Sige, one more. Alright? And then, oh, wow. Feels good. Okay, siguro, kaya ko pa rin to. Kasi, aware naman ako sa nangyayari. Okay, take another one. That's what's gonna happen. Your mind keeps actually, because it's all bombarded with all of that, cues and conditioning. And then you begin to feel good, and then your mind shifts again and say, wow, this is good. I like this. Okay, then you're into a big surprise. Interpersonal relationship in relation to other people, in relation to things outside of you, right? Situations involving another person or a group, okay? A group of people, such as an argument with a family, yep, or a loved one that results in negative feelings, okay? In fights, common ano yan, it can be a really a high-risk situation, because it elicits a lot of negative emotions. And especially if it elicits a lot of very bad memories in your life, right? Fight with a family member, right? So that really becomes a very triggering situation for you to use. Social pressure, both direct and verbal and non-verbal persuasion and indirect pressure. Being around people who are drinking or using drugs. Okay, you're a recovering person, right? And then nobody knows that. You're working in a company, but you're a recovering person, right? Company and your boss says, "Oh, it's my birthday. I invite everybody to. It's my treat. Okay, it's my treat. We're gonna go to such and such place. We'll have a good time. All the drinks on me." What do? Recovering person. Do you go or not? Okay. Very likely you will go. You know why? It's my boss. I don't want to disappoint my boss. Now you're rationalizing it. Right? Good rationalization. Good excuse. It's my boss and it's his birthday. I want to get along well with my boss. Right? What's wrong with that? Right? Okay, so you go, right? Then you're back to that situation where, okay, I'm just gonna go. I'm just gonna eat. No? And then I'm just gonna order Coke. Not Coke. Addicting din yan. Ano na lang, seltzer na lang. Seltzer na lang ordering ko. Okay, so you go walking in there, right? You're enjoying the food. You're drinking seltzer or lemonade, right? And then your boss gives you a glass. What do you do now? Right? What do you do now? Are you gonna turn down the offer? Okay, and then your rationalization kicks in again. Your rationalization kicks in and it says, "This is my boss offering me a toast, right? Siguro mag-sip lang ako ng once just to satisfy him, right?" And then your boss says, "Oh, what do you call that? Bottoms up." Oh, now you are in trouble. Bottoms up. You know what I'm saying? First of all, you set yourself up by going and you rationalize it. Okay, so right, you rationalize it. It's my boss' birthday. I have to get along with my boss. I'm gonna just eat, and that was a setup, right? Okay, and that happens. Not exactly the same story, but similar. You find easy way to rationalize getting into a situation that could be very triggering. Positive emotional states arising from some type of interaction with others. Positive, no? You're so happy because you're with your friends. You're so happy, you're so excited. These are your tight friends. Okay? Unfortunately, always celebration ends up in drinking. Right? It's kind of good. Alcohol is very much part of parties. Right? Getting together. Tough. Right? It's a tough situation if you're a recovering person. All right. Assessment strategies for identifying a high-risk factors or situation. Okay. Identify high-risk situations and coping problems through interview of clients, past lapse or relapse dreams and fantasies. Is a good way. Like you can find out actually their high-risk situations by just talking to them, by asking them, okay, let's talk about, when you were getting high. What usually precipitates you getting high? In what situation do you usually get high? Or what's your state mind usually are you happy? Are you sad? Or are you overtired when you use? So you can actually find out their high risk situation by just interviewing them. Okay. All right. So you want to find that out, right? One of the initial tasks for us when we are doing counseling or relapse prevention is to identify ano yung mga high risk factors nila. Okay? So remember, anong mga places? No? Even people. Who are the people that are likely to get high with? Usually friends. Particular friends, right? And where? Okay? And what state of mind? Client in outpatient program who are unable to sustain abstinence can self-monitor by observing drinking or drug use situations, emotions, and interpersonal factors associated with urges or substance use. Outpatient program. Okay, so it's outpatient. You will encounter this. Okay, first they will probably the drug because they're mandated. They'll give that up, but the alcohol is the thing because you saw an outpatient focus on alcohol because many of them don't even think about na yung drinking can lead to drug use. They don't think that way. Okay, so you want to explore that with a client, especially those who continually test positive. Ask them, is the drug use related to drinking? Baka mamaya, what actually initiates yung drug use is they are drinking first. Yeah, it's common, Una-una wala silang balak na gumamit. Walang balak gumamit ng shabu or hard drugs. Okay? Pero they were drinking. Okay? So, pero hindi nila ma-connect yun na yung pag-inom-inom nila will lead into that. Hindi nila ma-connect pa yan kasi hindi nga nila alam. So, you wanna explore that. For people who continually test positive sa outpatient, explore alcohol. And very likely, they have been drinking before they actually pick up the drug. Okay, what happens if he's drinking, right? Wala siyang balak na gumamit, no? Kasi nasa outpatient na nga siya, no? Kaya lang, hindi niya ma-connect yung drinking at saka using drugs. So, ito mangyari, iinom siya kasama yung mga kaibigan niya or kahit na mag-isa siya. Pagdating mo ng after mga 3 bottles, impaired na yung judgment mo. Hindi ka na makagawa ng magandang desisyon. Hindi sila aware doon na, your thinking is faulty now because of alcohol. That's what happens a lot of times. So explore that possibility why they keep testing positive in outpatient. Explore alcohol. And that would be a good opening to begin to explore alcohol and substance and their drug use. Diba? Magandang opening yun. Okay. Use of self-report questionnaire to assess higher situation. Maraming yan, mga self-report questionnaire. Sino yun? Someone's phone. Oh, outside? Alright. Ito yung inventories, no? Marami yan eh. Si Anis inventory of drinking situations. If you Google it, you might be able to actually download it. Try. You probably could download it. Okay? So these are actually classic inventories, no? Anis inventory of drug taking situation. Dailies, identifying high-risk situations. Carol substance abuse check. Okay? Yeah. Gorski's high-risk situation list. Okay, Gorski. Yeah, he's well known in the alcohol recovery. He has written a lot of stuff. Gorski. Okay. All right. So try Googling them, and maybe you can download the form. Okay, and take a look at it and see if it's useful for you guys. Okay. Let's see. Okay. Let's do a 5-minute. Okay, 10-minute practice. Okay. Think of things that. Okay, so I know you're not using drugs. I hope so. Yeah, I know you're not using. But pick something, no, not just not just drug. You can choose alcohol. You know, you want to minimize your alcohol, right? It could be cigarettes, and you want to actually work on that. Okay, it could be working on your carbs, sugar, right? And that carbs and sugar. It could be anything, no? Okay, ano yung high risk factor sa ano mo? Oh, okay, ano pang mga bisyo? Besides drugs? Huh? Oh, gaming, right? Okay, ano pa? Shopping. Oh, shopping. Okay. Food. No? Kasi may taas ang cholesterol mo, pero, ala, gusto mo yung bulaklak, sige lang. Okay. Anything, no? Anything that you actually know that you should not indulge, but it's hard for you not to do it, not to indulge. Anything. Okay? And ano usually yung sitwasyon na leads you to actually ended up, ano yung mga factors or situation? Okay? Ano yung difficulty? What are your struggles? Bakit, no? Bakit tuloy-tuloy yung gamit? Okay? So, we'll go in depth on those behavior. So, find a partner. I'm sure anybody will have something that he's struggling with, right? That's the assumption. Okay, get a partner and do that. Do that, okay? All right. So, 5 minutes. No, one. Okay, listen. 5 minutes. Okay, and then after 5 minutes, change role. Okay. All right. Let's do it. All right, you switch already? Switch? Okay, time's up. Time's up. All right. How did that go? How did that go? How did that go? Ang title niyan, Passions and Obsessions. Oh, ano yung mga passions and obsessions? Okay. How did that go? Were you able to identify your high risk factors, yung mga likely times, places that you will actually indulge in your obsession, in your passion. Okay. Example. Sino yung gusto magbigay ng example? Okay. Anyone? Things that you struggle, to contain or get a sense of control. Anyone? Anyone who wants to share? Ikaw, Doc, anong passions and obsession mo? Ganun ba yan?
Doc, siguro po po, yung work ko, Doc. Tsaka coffee, Doc.
Work and coffee?
Apo.
Okay, so why is that?
Sometimes I feel, parang tired. Yes, Doc. Yes, I get exhausted and parang nafe-feel ko na minsan, Doc, yung nababurnout na ako. Si Doc KR pa.
Nilululong yung sarili niya sa trabaho.
Kasi, Doc, yun din yung gustong-gusto niyang gawin. That's why. Yun yung doon din siya nagpapasaya. Yun din nagpapasaya sa kanya po. So, passion niya talaga yun, Doc. Oh my God. Di pwede sabihin. Sa amin na lang. Ni Doc. Ang tinatakasan niya? Wala, Doc. Wala siyang tinatakasan. Wala po siyang tinatakasan. As far as I know. Baka hindi niya sinasabi sa akin. Wala, Doc.
Okay. All right. Work. Work. Okay. Sino naka-identify kay Dr. Joey na nalulung sa trabaho? Anyone na talagang naukol yung panahon mo doon sa trabaho? No? Sino pa yon? Meron pa? Wala na? Malalim yan, Doc. Okay. Sino pa? Sino pa gusto mag-share? Wala na? Naku. Maghanap na lang ako. Tony, meron kang struggle?
Yes, Doc. Bale, yun na rin po, Doc, yung tinanong ko sa inyo nung first week pa yata natin, Doc. So, I struggle with my Doc. Obvious naman sa weight ko. So, bale, pan po, Doc. Pag-uusap po namin ni Ma'am, bale, na-identify namin yung mga high-risk factor situations, Doc. So, nagsimula kasi ito, Doc, last year. So, doon sa internal factors, Doc, na-identify din po namin. Then, parang mula nun, Doc, parang nag-justify ako na, yun nga, kain. To cope with the situation. Tapos, dumating sa point, Doc, na mahirap nang gumalaw, Doc, at bumabalik na naman lahat yung mga negative na tulad ng Doc. Itong mga nakarang araw, Doc, talagang elevated BP ko. So, yun yung mga Doc, kung bakit nagko-contemplate na ulit ako, Doc, na i-reduce ang weight ko. Then, difficulty ko, Doc, is masarap talaga kumain, Doc. Pero, Doc, yung pinakamalaki pa rin, Doc, kasi yes, Doc. Yes, Doc. Saka I try to rationalize, Doc, na parang Ito, parang na-earn ko 'to, parang gano'n. Kain ako ngayon.
Alright, thank you, Tony. Okay, so, sino pa, no? Di ba, kailangan yung awareness mo mas-sharpen. Ano ba yung mga high-risk factors ko? So, Tony, like emotional state, right? How about others? Emotional, situational. Karamihan, ano sa tingin nyo? Is it more emotional state than situational? Okay, situational, no? Yung sitwasyon. Yes. Ano example ng mga situational factors? Anong na-discover mo? Si Romel.
Doc, I don't usually drink alcohol. So, yun nga, situational. Katulad nung sa ano namin, convention ng Philippine College of Addiction Medicine. Paisa-isa pong lumalapit yung mga boss nung PICAM. Lahat sila may dalang alak. Doc, in-shot ka, inom ka. Inom ako. Hindi ko alam, ilan na ba yung nainom ko nun? Hindi. Hindi naman ako nalasing, Doc. Pero, kumbaga, first time ko uminom ng ganun karami na iba-ibang klase ng alak. Parang mga siyam yata na baso yata. Iba-iba may. Pinakahuli yung Hennessy. Pero nag-start sa Black Label, tapos biglang may iba na naman, may iba. Hindi ako makatanggi kasi puro mga bossing ng PICAM, ha? Inuwi mo, di ba? Sabi ko sa'yo, uwi mo eh. Sayang, first time namin nakatikim ng Hennessy. Ang sarap. Anyway. Ayun, Doc. First time ko nakatikim, Doc, kasi I don't spend on alcohol talaga. So, ayun, napakamahal na alcohol nun. Magkano ba yun, Robin? Magkano yung bote ng Hennessy na yun? Ayun, tinakas ni Robin from the convention. So, sabi ko sayang eh. Iniwan sa amin yung bote eh. So, ayun. Hindi ako makatanggi dun sa mga boss. Same with yung carb regulation ko. Minsan, yung sa sugar po. Kasi diabetic ako. So, minsan, tinatanggihan ko, ganyan. Pero pag yung mga boss ang tikman mo to, okay lang yan, Doc. Minsan lang naman. Kunyari, si Doc Cha, bigyan ako ng suman. Siyempre, kahit inaano ko yung sugar, nahiya akong tumanggi. So, parang social situation po. Andyan yata si Doc Cha.
Ginawa pa pang puser si Dr. Cha. I know. I know. Okay. Yes, situational. Yes. Hindi ko alam lakas pala yun. Sa PICAM, malakas yung minuma. I know. Okay. Yes, no, yung situational sometimes example natin na people na mahirap tanggihan ba? 'Di ba? Okay. Especially in our culture, no? Sa ating culture, malaki yung people na mataas sa atin, malaki yung pagtingin natin, no, na ayaw natin ma-disappoint. Okay. Sino pa gusto mag-share? Struggles, mga struggles natin, no? It could be anything. Sino yung may struggle with food because of either diabetes or weight problem or hypertension, cholesterol? Sino yan? Food issues, food. Raise your hands, mga food issues. Food issues. Maraming mga food issues, no? Yes. Okay. There you go. Okay, so all right. So, yun ang no? I hope you learned something from identifying yung high-risk factor. Personal high-risk factors. Okay, so, it's actually 9:35. So, we'll break from here and be back at 5 minutes past 10. Okay? All right, enjoy your break. Thank you. Okay, so how is everyone right now? We're good? Are we good? Okay, tabi na natin ang ating mga laruan. Put away your toys. Okay. You came ready today. Alright, so ituloy natin yung lecture natin, okay? Intervention strategies. Once a person's high-risk situations have been identified, two types of intervention strategies can be used to lessen the risk of relapse. Learning to recognize warning signals. No? So, kailangan aware ka, no? Ano ba yung signs na I'm about to indulge in food? Okay? Okay. So, first is recognition, no? The warning signals. Okay? And next is, okay, example of warning signals. Apparently irrelevant decisions. We talk about that, right? Lack of lifestyle balance. Lack of balance. Lack of life. No, totoo yan. Okay. Lack of lifestyle balance. Strong expectations about drinking. Ayan. Anticipation na, nako. Ano to? It will make me feel good. Yun. No? High expectancies. Okay? Okay, so next, by being able to recognize those warning signals, the client may be able to take evasive action or avoid a high-risk situation. Okay, so mahalaga talaga yung, ano mo na, no? Ito, signal na to. Ako, excited ka na kasi may inuman doon. Okay. That's a signal already, right? Oh, excited ka na kasi, nako, iba-ibang pagkain. Oh, oops. Diba? May anticipation na kaagad. Yung anticipation na yon, di ba? Ganon din ang pag yung mga drug dependent, yung high level of anticipation, sabi nga may nagkwento sa akin na, ano to, gumagamit. Sabi niya, wala pa ako doon sa drug dealer, ano na talaga ako, parang high na ako, ganon. Just because it's the ritual, no? Yung ritual of buying, using, no, that actually get them excited. Can you imagine, once you get into that cycle, how are you gonna break away from that? Mahirap na, ha? You're caught already. Para bang hindi ka pa gumagamit, nahahay ka na kaagad. Just because of your expectation. No? Okay, ang next is evaluating the client's existing motivation and ability to cope with specific high-risk situations and learning more effective coping skills. Yeah, highly motivated ba yung tao to actually prevent using, no? So, pag hindi motivated, he will go along with that, no? Okay, so, those two, right? Coping skill strategies, behavioral and cognitive. Refusing drinks in a social situation. Very simple. Refuse. I mean, it's simple said and done, no? It's hard to refuse. So sa akin, no? Don't put yourself in a situation. That's the best prevention, right? Use your judgment. Okay. Next is assertiveness, communication skills. The ability to assert yourself, no? In a situation, okay? Assertiveness. General strategies that can improve coping with various situations. Medication, you know, some clients might need to be put on medication. Anger management is another one. Excessive anger is actually a risk factor. Behavioral refusal rehearsals, the ability to actually say no. And we practice that, no, sa role play. For our kids, you know, especially adolescent, they really have to learn how to say no. Okay? Okay, so another one, cognitive strategies, cognitive reframing. Okay, is one. Uh, coping imagery. Just imagine yourself getting out of that situation. Positive self-talk is another one. Positive self-talk. I can do this. I can do this. Okay. Uh, I know I can. Countering positive outcome expectancies. So the best way to counter that positive expectancies is to think of what would be the consequences. Okay, so what would be the consequences if I use drugs? So, kasi ang focus niyan yung just the nice feeling that you get when you're using, not thinking of, okay, what's gonna happen? Just like when you do, you use alcohol too much, right? Ano yung hangover, di ba? Hindi mo iniisip yung hangover eh. Inom ka lang yung inom eh. Di ba? But pag inisip mo, what's gonna happen the next day? I have to go to work, I'll be hangover, blah, 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 I have a headache, the whole thing. So begin to think of that, no? Just kind of dampen yung positive expectation mo. Okay? And then, coping with abstinence violation effect. You understood that. We talk about that abstinence violation effect. Lifestyle intervention. Meditation. What it does is we learn how to relax, no? Not only relax, kind of, it gives you kind of a perspective of things. That's what you get, If you practice mindfulness, it really gives you perspective, That's what it is. No, kasi kadalasan, in daily life, masyadong focus tayo, to the exception of other things going on in life, di ba? Masyadong doon ka lang tumututok, Nakalimutan mo na, my home, my family, my friends, or other things you need to do. Sometimes, doon na lang natutok, di ba? But sa meditation is a whole different experience kasi it's more expansive. It's more expansive, right? So you find that if you learn how to do that, maraming mga ideas na mapasok na to solve certain problems na, yun pala yung solution. Kasi all of a sudden ba, na klaro. But, in a normal consciousness like this, iba eh. Pag doon, parang wider ang perspective mo about things. But parang it helps you put things in better perspective. Okay? Exercise is another one. Very effective yan, ang exercise. Walking and running. Okay? What else can you do? Biking, bicycle. Relaxation is another one. Relaxation. Yung lang, technique, breathing techniques, very helpful yan. Breathing techniques. Marami yan eh, marami. Go to YouTube. Ang dami mo makikita doon. How to help you relax and even grounding. Makita mo sa YouTube. May mga grounding exercises sa YouTube. Different ways of mga breathing exercises you can also find that. During the COVID pandemic, actually mga breathing exercises, na makita mo, hanggang ngayon nandun pa yan sa YouTube. The reason for that was actually yung lungs ang talagang nadadali ng virus eh. Okay, so may mga exercises to actually very deep, so that yung lower part ng lungs mo is also get circulated with oxygens and the whole thing. So yung mga breathing exercises, So I remember that, watching this guy and then explaining why breathing is right breathing is essential during COVID. That was before the ventilator and the whole thing, They were just improvising at that time. Okay. Okay, let's do exercise 2. Okay? Dito, a client who has been drug-free for several months, imagine mo, hindi ka na talagang na-implement mo yung project mo sa sarili mo na, okay, I'm gonna avoid high cholesterol or something like that. And then, he came for a counseling, feeling distressed and defeated. Proceed to conduct counseling kasi Okay, nag-lapse siya, no? Bumalik siya doon sa dati niyang gawi, no? He's trying to change a habit, for example, a habit. Okay? A negative habit, for example, no? And then, all of a sudden, nabalik siya doon and then he gets so disappointed na na-break niya ba yung cycle. Sana nga tuloy-tuloy na. Ngayon, nagkamali uli siya. So, how do you address that, no? Di ba? Ano yung abstinence violation effect? Yung abstinence violation effect, nawala na siya ng gana. Kasi isip niya, balik na naman ako sa dati, no? Nakatigil na nga ako dun sa ginagawa ko ng masama sa katawan ko. Bigla akong naputol yun, no? Naputol yun. And then, sa pakiramdam ko, yun nga, nasayang yung panahon ko doon nasayang, no? Ang effort ko. Tapos siguro nga, mahirap gawin ito, no? Siguro, nawala ba siya ng motivasyon to continue doing? Yun, okay? So, kaya ba nating applyan? No? Ano yung bagay na gusto mo talagang baguhin pero keep going back to it? We do an exercise, no? Okay, and then, how will you counsel that person so that that person can keep his motivation, no? To keep trying. And then address yung, it's not total failure or something like that, no? Okay, so you will be counseling the person to prevent yung abstinence violation effect at mawalan siya ng gana, magpatuloy ng effort niya to change the behavior. Okay, so find a partner again. Come on. Okay, partner. Okay. Time's up. Naku, napakasino sa... I wonder what they're talking about. Are you on task or it's something else now? Ha? Ano na pinag-uusapan niyo dyan sa likod? Alright, okay. Did people stay on task or you get like distracted and you ended up talking about something else? Alright. So alam niyo na yung high risk factors, no? Okay. So we stayed quite a bit of time on identifying high risk factors kasi gagamitin niyo to, no? When you're working with your clients. Ito ang first step. Help them identify yung high risk factors. Di ba? Oh, crucial yun, no? Okay, we can move on. All right. You okay, Doc? Okay. Oh, another topic. We finished that one. Okay, we move. Not yet, just one. You're terrible. All right, where is it? Done. I'm gonna go back to my file. Okay. Okay. Oops. Hindi naka-project. All right. So, helping clients develop a plan to manage a lapse or relapse. Okay. Another important tasks, right? In relapse prevention. All right. We're not going to do the group. Or how to manage a lapse or relapse. Okay. So, it says that outcome literatures show that a number of alcoholics, smokers, and drug users lapse or relapse at one time or another. Common ang lapse and relapse, okay, sa recovery. Therefore, it is highly recommended that all clients have an emergency plan to follow should a lapse occur so that a full-blown relapse can be avoided. So, paano natin, what's the plan, no? That when he picks up the first time he picks up, that does not escalate into a full-blown relapse. Okay? However, if a full-blown relapse occurred, the clients must have strategies to stop it. First, strategy to prevent a lapse from becoming a relapse. Okay, so, and then if that fails and he continues to use, how to actually intervene so that he doesn't keep, using. Okay, so two parts. One is what to do when there's a lapse, and what to do when the lapse becomes a relapse. Okay? How to manage a lapse or relapse, self-worth strategies, and self-talk. Anyone who can explain to me what self-talk is? What's a self-talk? Okay. Raymond. Okay, good.
Like you encourage yourself to really overcome it. Like kaya ko to, hindi ko to gagawin kasi kailangan kong magbago or something like that.
Yes, self-talk is talking to yourself, that you can overcome whatever obstacle comes your way. That you can do it. Self-talk. Okay? Whoever finds himself talking, when you encounter some obstacle or challenges? Anyone who does that? Yeah, yeah. Many of us does that, di ba? Okay. Sometimes you're doing a task, right? And then no, you hit a snag. Hindi mo alam pa how to proceed, right? So, nagsasalita ka, you're talking to yourself. Self-talk. Okay, ano ba, paano ba to? Oh, okay. No? And then, kailangan ko siguro gawin itong ganito. Okay. Okay, self-talk is just like that. But more focus on increasing your confidence. Kaya ko to. Nadaanan ko na to dati. Okay, sigurado makakaya ko to. Ganon, self-talk. Very simple, right? In cognitive therapy, that's very effective kasi when you talk, the brain follows, right? Yeah. Okay. Therefore, okay, it's highly recommended that all clients have an emergency plan. Anong emergency plan? Okay? Yun ang explore natin. Anong plano mo? Do you have any plan? Or when you pick up, anong gagawin mo? The first thing you will do when you find yourself using for the first time after you have been drug-free. Okay? So, ano yung mga behavioral procedures to interrupt use? Well, the simple one is get out of the situation where you pick up right away. Get out of that place. Okay? Ano pa? What other behavioral? Anong pwede mong gawin behaviorally? Thought stopping. Okay, thought stopping, no? Okay. Ano pa? Okay, ano pa? Behavioral procedure, no? In a lapse. And anyone? Besides removing yourself in in a situation where you actually picked up, ano pang behavioral thing? How about calling someone? That's a behavioral procedure, right? Call someone. Okay? Call someone right away. Now, it's very easy to do that because we have cell phone. We have cell phone, di ba? Ang dali. Okay. Ask family for help. Your own family. If you have somebody in the family that you can trust, you can call that person or go home and talk to that person, okay? Ask a sponsor is another one, no? And disclose to counselor, therapist, or group. Okay. Yung pinakahirap dito to, no? Sa atin mag-disclose ba? Sa counselor dito sa programa. Kasi iniisip ka agad nila ano kaya mangyari sa akin sa programa, di ba? Baka patatagalin nila ako dito ngayon. Yun. Baka i-report nila ako sa court. So maraming naglalaro sa isip nila, no? So, kung ganoon, kailangan marami siyang options, hindi lang counselor ang tatawagan niya. Kung people outside that he can trust na makakatulong sa kanya. Okay? Help client develop an emergency card with names and phone numbers of people who have agreed to be part of the client support network. Okay? So, sa ating counseling, no, part of relapse prevention, they carry a card. No? Sa card na yun, nandun yung pangalan at sino yung tao na tatawagan nila in case mag-pick up siya ulit. Sino yun? No? And then, so, pwedeng sponsor, no? Somebody you trust, maybe a family member, or a very close friend na hindi gumagamit, no? Na alam niya yung problema mo, na who is always willing to help you out. Okay? Not one person, but several. Kasi mangyayari niyan, paano tinatawagan mo? Kung isa lang nasa listahan mo, tumatawag ka, busy pala, or out of town, paano na yun? No? Or engaged in something na hindi makarespond sa'yo. So you should have a list there, at least 3. No? 3 people. So if you really trust completely yung counselor mo sa programa, it should be in that list also. So list of names and telephone number. Okay? Nasa card niya yun. Emergency people to call. Okay. So madali lang gawin yun, di ba? It's a very practical thing. Na nasa bulsa nila. You'll never know. Yung iba sabihin, hindi ko kailangan niya kasi sigurado hindi na ako gagamit. No. You still have to do that, just in case of emergency. Help client develop a reminder card that gives specific instruction on what to do should a lapse or relapse occur. So nakalagay doon, call immediately in case of lapse or relapse. Now call. Okay? All right. Okay, another one is a relapse contract. Develop a relapse contract between counselor and client that outlines specific steps to take in the event of a relapse. Okay, so you have a little contract. This is what I swear I would do in the event that I pick up. Okay? Or I promise to do this when I pick up. Okay? Yun ang parang contract, no? Promise to call in the event of a lapse. Okay, the aim of a relapse contract is to formalize or reinforce the client's commitment to change or sobriety. Okay? Diba? Para pinormalize natin yung ano niya, yung promise niya, yung commitment niya. So, yung commitment is in a form of contract. Okay? All right.
Pwede rin bang tawagin ni counselor in case na ano, dun sa mga list of names na ano niya is, so sa kasama din yung counselor dun?
Yeah, the counselor will be there, the name of the counselor. All I'm saying basically is, don't expect too much that they will call you. They'll probably call someone else's. Kasi nga, yung takot niya, yung baka i-report siya, baka mamaya extend yung time niya. So, okay lang yan. Pag may tinawagan siya, nasa list, I'm sure that person will process, no? And that person is ultimately would say, you have to tell your people, your person in that program.
Do we need to orient the person na kasama sa list?
Good question. Excellent. You can do that too. That you're in the list of my client in an emergency situation, such as he picks up again. You can do that, and then that's part of our intervention in the program. So you're in the list, and two other people, including myself, I'm the counselor. I'm the caseload counselor. You can do that. Okay. All right. And para alam nila ano yung what that means, no? Hopefully nga, no, they will still counsel the resident to say, hey, you have to talk to your counselor about what happened. Eventually he will. No? Especially, you do drug test anyway. So alam niya yun, lalabas yun. Okay? So, alright. Mahalaga doon talaga meron siyang kausapin, may tawagan. Yun yung pinakamahalaga sa lahat.
Is it okay na ang isa dun sa mga tatawagan niya yung kasama din yung nag-undergo ng rehab?
So, it's not advisable to get somebody na nasa programa pa, no? It's risky to do that. Okay, so get somebody actually not in the program, except the counselor, no? Yung counselor. But other people in outside, not a peer. Okay? Delikado yun, no? Ganun sitwasyon. Okay. A relapse analysis. Relapse analysis. Okay, so analyzing lapses or relapse with client is a valuable process that can aid in ongoing recovery. Who, what, when, where, and why. Diba? So, let's analyze. Anong nangyari? What was going on before? Where were you? What was in your mind? Okay? So, yeah. And what was the situation? Where were you? Saan situation? How did it lead there? And why were you in that place? Okay? So, analyze. And then ask him, what do you think you ended up using? What did you miss? What could you have done differently to prevent that from happening? Yeah? Yun. Very useful yun. No? It becomes a learning experience. We turn that setback into a learning experience. This helps reframe a failure as a learning experience and prepare the client for future high-risk situation. So, i-frame ninyo yung relapse na nagkulang ka ng coping skills. Okay, i-frame it that way. Nagkulang ka lang ng coping skills. Kailangan siguro may, let's look at your coping skills. Mukhang hindi gumana yung trinay mo, no? Okay, so let's find another way so that when this happens, you can cope with the situation better. Ganun yung dapat. So, frame it that way rather than, kasi ang isip niyan talagang mahina ako, siguro talaga wala na akong bagasa. Ganun na tumatakbo sa utak niya, no? Remember the abstinence violation effect? Right? Yun ang kaagad iisip niya. Ako, failure talaga ako. No, magalit pa yun sa sarili niya na, bakit? Paulit-ulit, no? I tried my best. I did not think about getting high or using. Pero nauwi pa rin ako doon. Ganun ang takbo ng utak niya. So you calm him down and say, listen, frame it in a way na kulang ka lang sa learning. But that we can fix, no? At tanggalin mo yung focus sa sarili niya na talagang mahina ako, mga ganun. That's not helpful at all, no? You got it? It's a failure in learning and coping skills. That's the way you should present it, okay? All right. Oh, we finished another one. All right. We go to the next one. Not yet. Okay. Next. All right. We go to the file. Okay, so 9 days. Okay. Wow, we're already there. Okay. Oops. Yeah. So, susunod doon. Yeah. Corporate cognitive client management support. Okay. Helping clients understand deal with alcohol. Okay. Yeah. Okay. Okay, so alcohol or drug use as well as craving. May question ka, Philip?
Before po tayo mag-start ng another topic. Doc, gusto ko lang po ma-enlighten. Doon po sa emergency plan, di ba i-discuss po natin doon kung ano yung gagawin niya once na nag-lapse. So, paano po natin siya i-deal without letting the client internalize na normal lang ang mag-lapse? Oo. It happens. So, paano natin siya i-deal kaya, Doc, na hindi niya parang hindi natin siya i-encourage na dapat So, paano natin siya i-encourage, Doc, na hindi niya iisipin na baka mag-lapse. Yung parang, hindi ko ma-express. Okay lang na mag-lapse, parang ganun.
It's not okay. Don't communicate that it's okay, right? And do not normalize it. Okay? All right. So, first, what we're trying to avoid is for him to get into that abstinence violation mentality. Na pag nag-pick up ako, para bang confirmation yun sa sarili niya na talaga siguro hindi na ako, mahirapan ako magbago. We're trying to get him out of that, right? Okay, kasi yun ang takbo ng isip niya eh. No, I'm a failure. Nasayang yung time na inukol ko para ako maging drug free. balik na. Kasi iniisip niya, balik na naman ako sa dati. Yun ang ika-counter natin yung mentality na yun. Okay? So, kaya nga, ang framing mo dapat, nangyayari talaga yan. Nangyayari, hindi unusual yan. Nangyayari yan sa tao. Yun lang language, no? Na, naku, normal yan. Yun, mali yung language na normal. No? Or, na okay lang, hindi okay. Okay? So, we have to be careful, no? Sabi mo lang, nangyayari talaga to. At saka hindi ka unique. Nangyayari din sa ibang tao. Ganon, no? And then, i-frame mo na, kasi ang nangyari niya, may something failed, no? Yung sa strategy mo. Yung strategy mo did not work. Okay, so, failure more on coping, learning, yun. Kasi yung mga bagay na yun, may, that can be fixed. Pero yung thinking nila na talagang wala akong pag-asa sa buhay, mahirap i-fix yun, di ba? Kasi pag yun pinaniwalaan niya talaga yun, parang end the story. Okay? Wala na akong effort na gagawin kasi talagang failure man ako eh. Talagang ganyan ako, talagang addict ako. Ganun ang takbo ng yan, ika-counter natin yun. So, sa simula, i-process mo lang, ano naramdaman mo? Bakit yung ganun pakaramdam mo, no? And then you try to reframe it. Okay? So, process, try to get as much as yung negative feelings niya as a result of the lapse. Doon na lalabas yung parang absolute thinking nila na black and white lahat eh. Either I am drug-free or I'm using. Parang ganun ba? Walang gray area sa kanila eh. Nakuha niyo yung black and white. Common yan sa ating mga resident na black and white. They frame everything black and white. Either or. Walang gray area. So yun nga, ang ipipresenta natin sa kanya, hindi yun na kasi wala kang pag-asa, hindi yun. Na ikaw ay talagang addict ka. Wala ka ng pag-asa. Hindi yun, no? Technique lang yun. Tapos yung example na riding a bicycle, it's a good one, di ba? Di ba if you're trying to ride a bicycle, di ba? Hindi mo naman kaagad makuha-kuha eh. Hindi ibig sabihin ng bobo ka o hindi ka marunong, wala kang alam. No, kailangan lang practice yun eh. Pero if you keep practicing riding a bicycle, maya marunong ka na Pero sino ba unang nag-bicycle na hindi bumagsak? Okay? Lalo na kung nag-try sa mag-bike, you can relate to that. Nung bang gusto mong matutong mag-bicycle, nagsasimula hindi ka ba bumagsak? Di ba bumagsak ka? Kahit sino, lahat tayo, no? Yung first time na kinuha natin yung bicycle, hindi mo agad na, okay, babagsak ka, di ba? Parang recovery, is also the same thing. Di ba? You have to learn how to first, how to learn to maintain your sobriety. That's not easy, right? It's a challenging situation all the time kasi ma-expose ka sa maraming mga cues, triggers, okay. So ibig sabihin nun, patibayin natin yung ating technique o sistema kung paano natin malalabanan mga sitwasyon na talagang very tempting or triggering for us. So, explore siguro natin yan. Ano yung nangyari? Okay. What was going on in your mind? Saka mo explore, no? What was the situation? Tapos, why did you get there? Yun na lalabas na yung mga natawag nilang seemingly irrelevant decision. Diba? yung ina-away siya dun sa sitwasyon na yun, na akala niya okay lang, hindi niya iniisip na dun pala mauwi yun. Di ba? Or na-meet niya yung kaibigan niya, na sa kanya, akala niya okay lang, no? Hindi niya alam gumagamit ko rin pala. Yung mga ganun ba? Instead of thinking na, gumagamit kaya ito. So, maybe I'm not sure about him. Siguro, iwasan ko muna siya. Diba? Kasi hindi ko alam kung magagamit siya. Okay. So mali yung decision niya. Akala niya okay lang. Diba? Seemingly irrelevant. Diba? Yung pala malaking factor yun kasi yung taong mismo ang nag-lead sa kanya. So, analyze the whole thing. But before you can do that analysis, he has to calm down. He has to calm down and really, really prevent himself from getting into that mood na wala na akong pag-asa. So get him out of that first. Get him out of that first. Calm him down, get him out of that situation so that when he is calmed down, saka mo analyzing ano nangyari. What happened? What was going on in your mind? No? Was there a precipitating factor? No? Ano yung emotional state mo? And then you can even ask, what was going on in your mind in the last several days? Yung pala, marami na siyang fantasy about drugs. Marami na siyang mga dreams about drugs. So, yung pala, nagpe-percolate na sa utak niya. No? Pero hindi niya sinasabi. Yung mga ganung bagay ba? No? Yung isip niya, no, keeps going back there. Yung pala, marami na siyang mga urges, no? Na nasa isip niya. Okay? Yung pala, ganun na yun. So that becomes like a high risk, cognitive high risk factor na pala yung nade-develop sa kanya. Hindi siya aware. Okay? So, ibig sabihin noon, kapag may mga, yung mind mo keeps going back to using, begin to talk to your counselor about it. Bakit kaya paulit-ulit sa thought ko yung paggamit? Bakit kaya? No, what's going on? So, talk to your counselor. Explore that. Okay? But maybe there are some triggering life events na hindi niya makonect na yung life events na yun related dun sa mga urges niya. Di ba? Possibly pressure from the family, pressure from the wife, pressure from work or whoever. Na kumukulo sa utak niya, hindi niya makonect na yun pala, yun na stress na siya masyado. Who is a good judge that we are stressed? Not ourselves, no? We're a very poor judge when it comes to that. Hindi mo alam, stress ka na pala. Hindi mo alam, overwork ka na pala. Di ba? Hindi mo alam, trabaho ka na trabaho. Kaya, sige lang, di ba? Okay. Hindi mo alam, tumataas na pala yung level of stress mo. Kaya we are the poor judge when it comes to that. Kasi, di ba, ang awareness natin, yung parang mga perspective na, wala na tayo ng perspective because, when it comes to ourselves, tayo ang the worst judge of ourselves, right? Okay? Kasi hindi natin talaga nakikita sa real life. It's just like, ang nose natin, nandiyan dyan, di ba? Nandiyan dyan. Pero nakikita mo ba yung tip of your nose? Hindi, di ba? Too close kasi, di ba? So, ganun din yung ating mga clients. Lalo na sila. Kasi, it's an issue of self-awareness, di ba? Ang clients natin, no? Ang self-awareness nila is not really that great. Okay? You understand? But let me tell you a story about self-awareness since I opened that thing. Because this is very important in catching yourself, especially people in recovery, catching yourself before a situation escalates, no? Yung programa namin dati, ang mga residente, mas talas ang awareness. You know why? Kasi mayroon kaming tinatawag na tool na confrontation. Okay? Nakalimutan mo yung silya mo, right? Na i-follow up, kukomprohin ka. Okay, brother, komprohin kita. Okay? Bakit di mo pinalo up yung silya mo? Bakit di mo pinalo up? So, ang ano doon, mag-iisip siya, bakit nga? Kasi distracted ako. Kasi excited ako, gusto ko na kaagad pumunta sa kusina, gutom na ako eh. Okay? Ano siya, doon sagot niya, di ba? Okay. So, but that confrontation helps her or him become more aware about his behavior. So, kasi sabihin pa, okay, next time, maging aware ka, okay? That's the conversation. So, may nakita siyang papel sa sahig. Bro, brother, nakita mo may papel na yun, dinaanan mo lang. Bakit di mo pinikap? Confrontation naman. Bakit hindi ka aware? Confrontation naman. No? Some of those, by the way, those behavior kapag medyo major, nilalagay yun sa pull-up sa morning meeting. So, hindi ka pwede maglagay ng pull-up sa morning meeting unless kinompro mo yung behavior. So, kukomprohin mo, tapos lagay mo sa pull-up. Okay? Alright. So, ganoon ang lifestyle namin sa loob, no? Laging may kompro. So, mabubuka kami sa circuit pag malaki yung, ano mo, no? Yung lapses mo, yung behavior. Every little thing, kinokompro ka. Every little thing. Okay? Late ka, kukompro ka. Bakit ka late? Okay. O, nagkamali ka ng pagsasabi ng bagay na kasi may certain things you cannot say. Like, you curse, mura ka, ganyan. Kukompro ka. Bakit ka nagmumura? Pwede na, during that time, pwede ka lang magmura sa encounter group. We allow them to curse in encounter group. Outside of the counter group, you cannot curse. Kahit nagaling ka sa tao, pag minura mo yun sa labas, malaking bagay yan. Okay? Mag-GM ka yan. Okay? Kasi sa threat na yun eh. Threat. If you curse somebody. Okay, so, ganun katindi yung ganun katindi ang practice namin. Kaya ngayon yung mga residente, ang tatalas ng awareness nila, self-awareness, no? Minsan may bibisita sa amin, no? May bibisita. They look at the person and then later on magbigay ng feedback. Bakit yung bisita natin ganun? O bakit si ganun? Na-pick up. Kaya sinasabi nga namin dun sa mga staff, sa awareness ng ating mga residente, kailangan maingat ka kasi nakikita yan na baba. Ang tawag namin doon, magaling sila magbasa ng tao. Magaling sila magbasa ng tao because of that practice. See, we don't do that anymore. Alright? Hindi na tayo ganun katindi yung programa natin. But I realized na yung keen awareness nila, no? Self-awareness nila, nagde-develop ng programa. Okay? Yun yung kinasabi ko sa inyo, self-awareness. So, ating mga residente, kaya mababaw ang self-awareness nila, maraming mga triggers, cues na namimiss sila. Kaya pag pre-process mo yung lapse o relapse history, doon lalabas yung mga lapses na in awareness. Bakit hindi ka aware doon? Di ba? Di ba obvious yan? Sa kanila hindi obvious, maraming bagay na hindi obvious na pwedeng obvious sa atin. Kasi sa atin, siguro magaling matalas ang ating self-awareness kaysa kumpara sa kanila. Di ba? Oh. How does that comes out in us? We are careful about how we talk, right? We are careful about what we say kasi we are aware that, pag mali yung sinabi natin, it can hurt people, di ba? Sila, may pakialam ba sila? Not pakialam. May awareness ba sila sa bagay na yun? Kung ano lang pumasok sa utak nila, sabihin nila, right? You notice that? Para bang impulsively they will say things. Nasa ka lang nila sila ma-aware na inappropriate yung language mo. Pag kinompro mo na sila, bakit mali yung language mo? But before that, wala eh. Kasi kung ano man pumasok sa gano'n lang sabi. Wala bang trying to analyze na pag sinabi ko to, and this happens very quickly in our brain, pag sinabi ko to, very hurtful to. Masasaktan ang tao. Tayo, capable of that. Kasi meron tayo, ang self-awareness natin is much better than them. Di ba? So, bago natin bitawan ng salita, alam na natin ano ang impact noon. Kaya, nakawa mo, kaya seldom that we say things na hurtful sa tao. Although every now and then, dumudulas tayo, di ba nangyayari na without any intention. But sila wala silang break. Kasi ang self-awareness nila is really not deep yet. Okay, so kung talagang mahasa sila sa programa, that self-awareness will become better. Okay. So you understand why I'm saying that certain intervention, like mga gagawin natin modules, that might not be appropriate, in the beginning of the program when their level of self-awareness is not really well developed. Intindihan mo? Kasi yung minsan yung module na yan does not consider that. It's almost like, to me, it's psychoeducation, Without consideration, sino ang audience mo? Without consideration na may self-awareness na ba itong taon to? Kasi yung self-awareness, it's a process. It's a cognitive process that happens very quickly. Okay? Very fast. Okay, so that's why, we do not say, or seldom we say things na inappropriate, inappropriate. Kasi ang brain natin, yung self-awareness natin is like that. Mabilis na. I cannot use this language because it's gonna be hurtful. Or, I cannot use this language because it's not appropriate to the situation. Diba? Okay. You got it? Yeah, mahalaga yan. So itong yung module na tinuturo natin, it's not really that easy kasi nga yun ang requirement to really learn and benefit from it. Kaya mayroon na develop na ang self-awareness nila. No? To internalize yung experiences na nangyari sa kanila. Okay? Bremen, ano yan?
Doc, suggestion lang doon sa sinabi ni Sir Philip kanina kasi parang naintindihan ko na usually nangyayari kasi yun sa mga outpatient tsaka aftercare na kapag nagkakaroon sila ng mga lapses, Doc, no? So, minsan kahit hindi naman natin minimin na it's normal, they perceive it that way that no, parang kahit hindi we don't mean it that way. So maybe what we can do is to tell them that yeah, we understand that you had this lapse. Now let's do something about it. But then know that the moment you do it again, it's not already a mistake but a choice, and that we might need a more intense intervention about it.
Okay, so but you get the sense of not using certain language to normalize it, no? Okay, because that becomes the rationalization later on. Normal naman pala to eh. It's not normal. Okay lang pala to. No, it's not okay. Right? So, di ba? Okay, so yeah, you get the point, right? That why it's important that you do not, kasi it could be very reinforcing the behavior when you stay normal. Okay. Yeah, you can, there are many ways of presenting it to the client, like I said. We can fix that, no? Kulang ka lang ng lesson. Okay. Question, comments? And then you Gilbert. Ano yan? King. Vincent.
Related po siya sa self-awareness na sinasabi niyo. No? Tatanong lang sana ako kung ano yung magandang strategy. Kasi dito, sa practice namin dito sa rehab na nakikita ko sa pamamalakad ng mga officers, Doc, kapag nagkamali yung mga kasamahan nila, is ini-infractionan nila, ay sinasabihan nila, and then ini-infractionan din nila. So, sa tingin mo, Doc, ano po ang mas maganda? Kausapin na lang nila yung patient kasi yun din naman yung goal is ma-raise po yung awareness ng mga patient.
Alright, so, okay, so bago binubuk yung tao, may confrontation muna. So, halimbawa, no? Mayroon siyang, may silip ako sa kanyang tawag yun. Silip, niya, no? Kukomprohin ko muna yun. Bakit lumabas yung ugali mo? Ganun. Kasi ang point doon is for him to really think. Maging aware ka. Ang last na sasabihin. Sa susunod, maging aware ka. Laging ganun yan. Sa susunod, laging aware ka. So in other words, it's a lapse in awareness. So, bago mo siya i-book o bago mo siya ilagay sa pull-up board, kukomprohin mo muna. Yung confrontation doon, hinuhukay. Ano yung unconscious motivation mo? Ano ang unconscious motivation mo? You understand ba yung unconscious motivation? Yung bang motivasyon na ang dahilan sa ginawa mo, pero hindi ka fully aware, yung pala yung motivasyon mo. Kuha mo? Unconscious motivation. Di ba? Okay. Maraming ganun, di ba? Na hindi obvious until you confront the person. So, ang purpose ng confrontation na yun is to bring out ano yung unconscious motivation niya na hindi siya aware, yung pala yun. Okay. That practice was so helpful for our residents. Okay? Doon tumalas talaga ang mga awareness nila. Okay? So, ang dami naming, pagdating sa morning meeting, ang pull-up namin napakarami. Kasi train namin sila na wala kang palalampasin na behavior. Okay? Wala. Kahit na maliit lang, tatanungin mo bakit ginawa mo yan. Okay? So that's a practice that we lost. We lost that. Okay? That's a very important part ng TC na hindi natin ginagawa. I have not seen really a TC who does that. Okay? Na, excuse me, brother. Usually, pag mga comprang gano'n, sabi mo, okay, brother, punta tayo na. You confront them in private, hindi around people. So, pwede mo sabi, okay, can I confront you? So, punta kayo doon sa isang corner na kayong dalawa lang. Bakit nangyari ito, no? Ganun. Para safe, no? Safe. You're not trying to embarrass the person. Okay, you're freely. So again, those kind of confrontation, you're doing that because you care. Responsible concern ang tawag namin doon. Yung pagmalaki, pag major, alam nila kung ano yung malaki. Kung halimbawa nakalimutan po, that's minor. Okay? Pero kung major talaga yung infraction, okay, yun, kukomprohin mo yung tao and then ibubuk siya. Okay?
Sa amin mo kasi, di ba po yung increasing of awareness yung pinaka-purpose. So, even the tiniest thing, kailangan talagang i-confront yung person. For example, nahulog po yung isang butil ng kanin. So bali, i-confront na si person na ugaling baboy na yata yun, mahuhulog kasi may naaksa ang isang butil. And then after that, so ang suggestion nyo pala, Dok, is hindi na siya ibubuk, ililista, confront na lang. Parang ganun.
Unless it is a major one. Okay. So, a major one. Okay? So, okay. Okay.
Halos pa rin.
Kasi pwede nating para bang sa akin, that's too exaggerated. Okay. Alright. So, it can be too ridiculously exaggerated. Okay? Ang tendency kasi natin is to exaggerate things, no? Okay. So, hindi naman gano'n, no? Okay. Nakalimutan mag-follow up ng Celia. Okay. Okay. Nakalimutan mag-follow up ng anything, no? Plates. Or kadalasan yung ilaw, hindi napatay. Tapos yung nakita mo na marumi. Tapos lakad ka lang ng lakad. Okay. Puno na yung basura. Hindi mo pinalo up. Mga ganun ba? Okay. So, yung mga ganong lapses, yun ang mga kinukontrol. Pero hindi naman yung may nahulog na butil. Ano na yan? Too exaggerated. Okay? Okay.
Doc.
Gilbert.
Ayun. Mukhang nakakagulo na kami ngayon dito kasi para-pareho ata yung practice namin na ini-infract namin. Tapos, binubuk. Tapos, syempre nakakasama na siya sa BST. Na accumulate yun for the BST. Yun nga ang ano namin, Doc. Yun pala, may sinasuggest kang parang sa amin, hindi namin pinapractice yung confrontation kaagad. Infraction yun. Minsan nga, nagkakagulo pa kasi hindi mo alam kung sino nag-infract sa'yo. So, ang tendency is nagrarat-ratan. Pag, siya yung, alam ko siya lang yung nakakita sa akin na ano doon, tapos mamaya gagantihan ko rin to. Babanatan din ng maraming infraction yung suspecha niya yung nagsabi. So, nagkakos talaga siya ng disarray talaga pagdating sa ano. Kaya nag-check namin, usually, ang itong isa, infraction niya 3 sa isa, yung isa din may 4 din para dun sa kabila. So, nakikita namin yung ratratan na nangyayari.
Okay.
Kaya nga, Doc, gusto naming maliwanagan, saan namin i-draw yung line between sa confrontation, kung sino yung ibubuk, at saka sino yung bibigyan namin ng BST.
Okay. So, like I said, somehow it's subjective, right? Pero alam ng mga residente ano yung house rules, no? So, violation of house rules definitely requires a more intensive intervention. Pero yung mga maliliit na bagay, confrontation lang yan. Okay? So, pwedeng 4 na tao, pwede mong confront kasi, halimbawa, 4 na tao, nandun sa isang lugar, pero hindi sila aware, something. It could be anything, no? Na hindi sila aware, pwede mo, okay, brothers, pwede ba comprehend ko kayo? Okay, yung 4 na yun, kukomprehend mo. So, depending on what it is, no? Let's say it's, halimbawa, very common. Sa TC, bawal yung kwentong gera. Alam niyo yung kwentong gera? Okay, talking about drugs, how they used to use drugs, where they buy the drugs, yung mga ganun. Right? Kwentong gera ang tawag namin doon. So, halimbawa, 4 na tao, no, they were indulging in that. So, yung 4 na yung kukomplain yun. No? O, bakit, di ba, alam natin na hindi kailangan pag-usapan yung mga bagay na yun kasi hindi nakakatulong sa atin, nakaka-trigger pa sa atin yan, ganyan-ganyan. No? Yun ang confrontation dyan. Yung 4 na yun, ibubuk yun. Kasi, ano yan eh, major norms yun ng community, hindi acceptable behavior yun. Automatic na yun ibubok. Alam nila kung sinong responsible for that. No? At saka yung confrontation na yun, it's done in the spirit of responsible concern. And they buy that. They all buy that. That, malasakit yun. Ang tawag namin doon, malasakit yan. Okay, so hindi sila gumaganti doon sa nag-book sa kanila. Wala kami, we never had that situation na yung tit for tat, nagantihan. Wala kami noon. Kasi they really believe na yung confrontation is a responsible concern. Ang tawag na doon, masakit na pagmamalasakit, no? And they buy into that. Okay? They know exactly which behavior are bookable and which one are just small things, no? Yeah. Okay? So, klaro sa kanila yan. Wala kaming debate na bakit ako binuk. Walang ganun. Tinatanggap nila yan. Okay? So, okay. Ivan.
Pagpapatungin yung infraction. For example, yun nahulog yung butil ng kanin. For example, setting aside the fact na hindi na pala yun ibubuk, pero let's say binubuk yun. Pagpapatungin yung booking, for example, yung nahulog yung butil ng palay. So, dalawang bookings, walang awareness at saka ugaling baboy. So, pagpapatungin na nila. Hindi yun maganda. Okay. Kaya, sa amin, 4 na layer isang behavior lang eh.
So, let's say, ang issue lang yung butil. Lalabas na yung pagkukulang sa awareness sa na yun, doon na sa when you address the person, right? Okay. At saka nandun na yun sa confrontation. Na, Brad, nagpapakita yun na wala kang awareness. Kulang ka sa awareness. Sa susunod, maging aware ka. Usually, that's how they end the confrontation. Okay. No. It's not. I don't know where that came from. Okay? Let's go.
Doc,
pwede man isabit lahat yun later on.
Kunyari, yung pinakamataas na parusa is reclusion perpetua. Tapos may mga ibang na naging part din doon. Isang parusa lang lahat yun. Yung kung ano yung pinakamahaba or pinakamabigat na parusa, yun na yung covered na lahat.
Pero doon sa intervention, ina-address lahat yun. Doon mo na i-address yung iba. Okay? Alright, go.
Doc, what about those minor infractions? You mentioned a while ago na hindi na namin kailangan i-book yung minor infractions. What if that same infraction is repetitive na po?
Okay, iba na yun. Okay. So some of that infraction can be actually handled in the pull-up, in the morning meeting. No? So, medyo maging matipid kayo doon sa BST. Kasi pag you overuse BST, nawawala ng visa yan eh. Okay? So, as much as possible, try to see if you can correct the behavior by, pull up sa morning meeting. Okay? Or, talking to. Just talk to, right? Okay, so sa akin, ang haircut, mabigat na yan eh. Di ba? So, ganun dapat. Pag medyo minimalist kayo paggamit ng BST, whenever you use it, magbisa talaga. Okay? So, rely on the less intrusive tools. Talk to, spoken to, yan. Di ba? Okay.
Doc, another question. Clarification lang po. Can anyone book another resident?
Say it again.
Can anyone book another resident?
Any resident?
Any resident.
Can book
Yes,
another
ma'am.
resident. Yeah. Why is that a
Not
problem?
just the officers po.
Hmm?
Officers lang po kasi yung
Oo.
Okay.
ang binibigyan namin ng power to book is yung senior or officer levels.
Okay. Wait.
Kaya nagkakagulo tayo.
Okay, listen.
Kaya nga, very very good na nandito ka, Doc, kasi maraming maliliwanagan sa amin.
Okay. Okay. So, any resident, hold on guys, hold on. Any resident can book another resident. However, there is a process of booking, correct? Sinecheck yan doon sa COD. Wala ba kayong screening? Okay. So, I think wala. Okay, so let's say I'm a resident. Gusto kong i-book si Edward, no? Pupunta ako sa COD. Okay? Kinompro ko na si Edward, no? Kinompro ko na siya. Baka ano yung ginawa niya, no? Okay, I did that, no? And then, kasi seryoso yung ginawa niya. Listen. Listen. So, nakompro ko na siya. Alam niya yung pagkakamali niya. Correct? Klaro. So, I go to the COD. Sabi ko, COD, may gusto kong i-book. Sino? Si Edward. Okay, so i-book ko, no? May mga slip ako dyan. Submit ko yun. Titingnan ngayon ng COD kung ano yung infraction. Okay? Sasabihin niya, okay. Kinompro mo na? Oo. Okay, ngayon, sige, valid tong booking na to, valid. Hindi yung titigil doon. COD will call the person who is being booked. Edward, may booking ka dito. Okay, ito yung nangyari, blah, 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 blah. Ginawa mo to. Okay, so Edward say, hindi, halimbawa. O ngayon paghaharapin niyo yung dalawa. Okay? So sabi niya, okay. So, kasi dahil kinompro na siya, no? Kaya mahalaga yung confrontation before the booking. Kasi hindi niya magsisinungaling kasi doon sa kinompro na siya eh. Okay, binatingnan lang ng COD kung valid ko. Kaya checkin niya pa rin si Edward, kinompro ka ba nito? Ginawa mo to. Sabi ni Edward, okay, yes. End of story. That's valid booking. Okay? Chinek ng COD, valid booking, no? May confrontation. Okay, so kung halimbawa tit for tat, ang COD din na magdidetermine noon. Kabubok mo lang yun dati Bakit binubok mo yun? Okay. Di ba? Pag may gantihan na ganon, ibubok yung gagantihan. May consequence doon. Misuse of tools. Awa mo. Kung sino man yung magganon, binubok din yon. Yung tit for tat na yan, misuse of tools yun. And yun, talagang haircut yun. Di ba? Kasi sa amin, yung pag inabuse mo yung tools, major violation yan. You got it. So kulang yung kulang yung sistema. The booking process is missing. The confrontation is not there. Got it? Go ahead.
Doc, may tanong lang ako. Kung pwedeng mag-book ang crew or mag-infract ang crew na i-confirm po ipapa-confirm niya sa COD, papacheck niya sa COD, tama
Yes.
po ba?
Lahat.
Paano po namin maaayos yung parang magkaka-level na sila ng officer kung ganun po?
Okay. Lahat can be booked. Okay, lahat. Kay officer or what? No? Nobody is excused from being booked. As long as it's a valid booking. Kaya nga, because of that system, kahit na officer ka na, hindi ka pwedeng dumulas. Okay? Kasi pwede kang i-book kahit na sino, pwede kang comprehend. In fact, the encounter group is a balancer, no? Okay? Pag ginawa yung encounter group, mababawasan yung abuses, no? Use of or abuse of power, yung mga nasa itaas. Kasi pwede silang encounterin doon sa encounter group. Di ba? Kaya talagang nahahasa yung officer namin na kailangan bago ka umakyat yan, talagang magaling ka na sa programa na hindi ka na nasisilipan. Okay? At okay, na appropriate yung behavior mo. Kasi kaya nga yung what balances everything, what makes the playing field even is the encounter group. Kasi nobody excuse. Do you know even staff can be actually encountered in encounter group? They can drop a slip on you. They will drop a slip on you. You understand? No, that is true. Even the residents can drop an encounter slip or a stop.
Doc, yung sa infractions po, Doc, officers pa rin ang pwedeng mag-infract or pwede pa rin ang crew?
What do you
Hindi,
mean?
ang sinasabi, Doc.
What do you mean infraction?
Ah,
Booking?
Yun, booking
Okay.
din, same yun?
Oo.
Okay.
Kung sino yung nakakita, yun ang magbubook.
Okay po.
Kasi yun din, yun din ang nagko-compro, di ba? Yun din ang nagko-compro, di ba? Okay.
I thought po yung
Hold
encounters
on.
yung sinasabi mo. Sorry.
Okay, iba yung, wag mong i-mix yung encounter group. That's a whole different thing. Okay, so, can a resident confront an officer? Yes. Nobody is excused from confrontation, no? Nobody. Okay? Alright, so, alam mo, officer ako, may lapse ako behavior. Kukumpren ako ng just a regular resident. I have to accept the confrontation. Okay? Alright. And then, listen, if that resident is trying to get back at me because I'm an officer, but when I'm being confronted, I accept the confrontation, right? But come the encounter group, pag alam kong he's misusing the tools, he's just trying to make excuses to actually get back at me, right? Lalabas yun sa encounter group. Nakuha mo? So I'm an officer, I will drop a slip in an encounter group to talk to another person, right? Doon na yun lalabas. Kaya, bibihirang residente, aabusuhin yun kasi ma-encounter siya. Okay? Plus, yung COD will actually screen it. Kung alam ng COD nga ito, yung tawag doon, binubutasan ka. Okay, malalaman naman yun ng COD. Pag binubutasan ka, babalik ka rin yun. Ikaw ngayon ang bububok. Binubutasan mo yung officer, no? Kasi walang basis yung yung booking. Yan. Plus, yung officer na yan, mag-drop ng encounter description, mapubugbog talaga yung residente yan. Okay? So, no, I never encountered somebody abusing the encounter group because of the process that we have. Okay, wala, no? At saka yung bihira, somebody drop a slip on me, I sit there. I listen. Okay? Minsan, hey, Kuya Ferdy, ganito. Hey, maybe I was wrong. If I was wrong, I'll just say, I'm sorry. I was wrong. That's it. That's the story. But no, yeah, it has happened. I just sat there and listened. I was not aware. Okay? No. Nung intake, okay. Sige.
Morning po. Doc, question lang po kanina. Going back to your example po dun kay Sir Edward kanina. Kinonfront niyo po si Edward kanina and then pumunta po kayo sa COD para po sabihin na binook po ninyo siya.
No, binubuk ko siya.
Naibubuk po siya. And then the COD will confirm it to Edward kung ginawa po niya
Una
talaga
sa
yun.
akin, na-clarify, ano yung booking mo?
Opo. Tapos,
And then, kinompro mo?
Opo.
Okay, sasabi ko, yes.
Tapos,
I confronted. Okay, and then
the COD, itatanong niya rin po ba kay Edward
yes,
yung ginawa?
Yes, and then the COD will call Edward.
Okay. Doc, ano po kasi, sa loob po kasi ngayon, dumadami po talaga yung cases na hindi po nila inaamin yung binubuk sa kanila.
Kasi walang confrontation.
Ang tanong ko po doon, Doc, how to properly navigate po yung mga ganun na residents na pagka verify po ni COD or OD po sa term namin, pagka ginawa po ba nila or hindi. Even though it's very obvious na ginawa naman po ni client pero hindi po niya inamin. How to properly navigate in those situations.
You still book the person.
You still book the person.
And then implement what is the recommendation. If the staff approve the recommendation, you implement it.
Should the clients be on an encounter group, Doc, or no need na po?
Okay. Ang encounter group gagawin lang yan if somebody's feelings was hurt in the process. Okay. Yun. So, para klaro, let's focus on that booking, no? Kahit na hindi tinanggap ng isa, para kung alam ng COD na talagang nangyari yan, kinompro siya, ayaw tanggapin, tuloy mo yung booking.
Tuloy pa rin.
Oo. Sa intervention, doon na lalabas yun na, okay, address the behavior na ayaw niya tanggapin, ginawa naman pala. Okay, so that will be part of the dialogue. Pagtuturo sa kanya. Di ba?
Tapos Doc, just to clarify lang, COD po ang gagawa nun, not the case manager of the patient that's being booked.
No. Okay, COD.
Thank you, Doc.
Okay. Alright. Okay. Meron pa? Okay. Okay na? Are we good, guys? Shh. Are we good? Klaro ba? Alright. Vincent.
Nagkakagulo lang po kami, Doc. Sa context po kasi namin, we don't have COD. What we have is OD, Officer of the Day.
No, you have to have a...
Sorry.
Wala ba kayong COD? Wala kayong coordinator?
RDO.
Okay,
okay. So,
there
Doc,
is... Okay, listen. Okay, you have coordinators, right?
Yes po, Doc.
Okay, as coordinators, can we just listen, please? Ang coordinators take turn in becoming a COD. Okay. Okay. So, halimbawa, coordinator of the housekeeping department. Yun nga kailangan balik niya yung mga department. Okay. Let's say, okay, example, in a regular TC, we have kitchen department, maintenance department, maintenance housekeeping department, business office, we have landscaping department. Let's say five departments, right? In each of those department, mayroong coordinator. Okay, and then department head, and then assistant department head. Okay, and then sometimes my expediter assigned to the department, no? Okay, so yun ang pinaka-officer ng department na yun. Yung COD doon, okay, di ba limang department, limang coordinator, di ba? Nag-take turns ang mga coordinator to become coordinator of the day. Okay? So let's say yung housekeeping department ngayong araw na to ang coordinator of the day. Okay? Siya ang magpapatak mo ng programa. Katulong niya ang chief expediter. Okay? Silang dalawa. Chief expediter focuses sa mga behavior on the floor. Coordinator is more like sa opisina siya nag-handle ng mga traffic. Yung booking, schedule for, let's say, interview, whatever intervention. Siya ang for that day, tawag namin dyan siya ang mayor. Siya ang mayor, no? Nung araw. So that's for one day. The next day, let's say coordinator of the housekeeping department. And then the next day, housekeeping of the coordinator of landscaping. Dahil sa yung sistema namin ganoon, talagang yung coordinators na train sila ng todo-todo. Okay, so hindi ka pwedeng maglagay ng coordinator na hilaw. Kasi siya ang magde-decide, siya mag-decide kung ang booking valid. Okay? Katulong ang COD, ang SOD, staff of the day, overseer yan ng ginagawa ng COD. Siya ang nag-supervise na make sure that the system is functioning, that everything is done fairly. Okay, walang favoritism. Yan ang trabaho ng SOD. Siya din ang nag-a-approve ng lahat ng behavior shaping. Hindi pwedeng hindi dumaan sa SOD yung behavior shaping. Learning experience, yun din. Ina-approve lahat yan ng SOD. Nakuha nyo? Okay, but the daily functioning, running, it's done by the coordinators. Talagang self-help. Ang staff, very minimal. We only step in kapag palpak yung sistema. But otherwise, we'll let that system work. That's how we do it, no? Talagang makikita mo na ang laki ng role ng mga residente, lalo na yung mga nasa taas, in running the program. Okay? Alright. So, makokorrect natin lahat yan. So, tingin ko, medyo kailangan we make some adjustment, no? Para may kulang yung sistema nyo. Kaya hindi kayo makabuild ng very strong community. Pag naayos lang natin yung lahat yun, titibay pa yung patakbo ng TC ninyo. Okay? Saka pag na-implement natin yung encounter group na yun, makita mo talaga, mababawasan yung mga gantihan, mababawasan yung mga ganun ba? Okay? Mababawasan yung mga ganun. Or abuse of tools, mababawasan lahat yan. Okay? Maliwanag. Okay ba? Okay, good. Alright, so, awareness. From awareness, ako, marami tayo para bang we took a journey to the moon and back. But that's good, no? Yung awareness, key yan. Kaya, ano yan eh, sa TC, that's a major thing. Awareness. It makes sense, di ba? Kasi sa labas, naku, kailangan mo talaga awareness mo to prevent yourself from getting into situations. Awareness. At saka, yeah. So, malaking bagay yun. Malaking bagay. Sarili observation, malaking bagay din. Okay, so helping clients understand and deal with alcohol or drug cues as well as cravings. What is a cue? As in what? Ang cue is actually parang a sign. Sign. It's a sign. Okay? Cue. Or a signal. I think the appropriate definition is it's a signal. It's a cue. It's a behavioristic terminology, by the way. Okay, cue. Okay, so yun ibig sabihin ng signal. Cue. Okay. Cues are conditioned psychological or environmental stimuli associated with substance abuse experiences that can trigger the desire, cravings, or urges to consume substances. Conditioned, right? Conditioned psychological. So, for example, money. Money is a powerful cue to use drugs because pinair natin yung pera sa drugs. Pag may pera, may drugs. May pera, makabili ka ng drugs. So ngayon, kahit na wala na yung drug, pera lang, it triggers already. Right? It triggers already. Kasi connected yung dalawang yun. Cue at tawag doon. So, maraming cues. There are conditioned psychological or environmental stimuli related to the drug. Right? Okay, so, ano ang mga environmental cues na common sa pag-drug? Environmental. Sorry? Okay, lighter. Okay. Alright. Ano pa? Place. Yes, place. A specific place where you buy the drug or use the drug. Cue. Okay? So, kaya nga, no, sabi ng mga resident, nako, hindi ako pwede pag-uwi sa bahay kasi kailangan sa bahay namin, no? Pag pupunta ka sa bahay namin, hindi mo maiwasan na dumaan doon sa lugar na nandoon ang bilihan ng drugs, nandoon yung mga gumagamit. Kaya dadaan lang ako doon eh, natitrigger na ako. Okay. Okay, common yan, di ba? Okay. So, because of the association of the place to drug use. So, yun ang ibig sabihin ng cues. Okay? Di ba, marami yan. Maraming association ng drugs. Even sometimes, people, no? Whom you used to use drugs, they can be cues. Ano pa? Ano pa pwedeng cues? Kwartong walang hangin. Okay. Your room can be a cue. Di ba? Kasi kakalo kung madalas ka gumagamit sa kwarto mo, no? Tapos pag uwi mo, amoy ganun pa rin. Nako, ano yan? Trigger ka agad yan. Okay. How powerful are cues? It's very powerful, right? I'll give you an example. Okay, so One day you're walking just down the road, and then this music start playing, right? And that music is very much connected to your, let's say, very pleasant experience, no? Very pleasant experience. Di ba? Okay. So, pag narinig mo yung music, no? Narinig mo yung music, doesn't it transport you that time? You can almost like smell the how it was. Okay? You understand? Cues. Yung music was cues to something that was actually very intense experience for you. Memories. Okay, another one. You smell of food, di ba? Oh. Yeah, let's say you were growing up. When you were growing up, your mama used to cook something, no? And then you remember you enjoy that time, no? You enjoy that time. You like the food, and then you smell the food. It like you know, all that memory comes back to you. The whole, like you're transported to a moment in time. The moment in time. Okay? Nandoon ka. Parang ganun, di ba? It's the same thing with this we're talking about in here. That's how powerful those cues are. Kasi ang association yung drug use saka intense experience of drug use, matitrigger yung memory na yon. Imagine that. So, that trigger, that memory, taking you back to the time, right? When you were using, very powerful yan, enough for you to type, miss that time, or want to go back that time. Those are cues. Okay, powerful cues. Okay. People, places, and things. That's true. People, places, and things. People. Cues. People. Drug using friends. Lovers who actually, na gumagamit kayo pareho. Very intense yung experience na yan. Okay? Very intense. So, that is a very strong cue. Family members who are high or getting high. Another one. Some of our clients used to get high with their brothers. You have those? You have those residents na nung gumagamit siya kasama niya ang kapatid niya. And then, siya, nandito sa programa, yung kapatid niya nasa bahay pa rin. May ganun ba? Nako, mahirap yun. Asawa, tatay, that is a very strong right there, no? Cues. So, ang hirap i-overcome noon, no? How are you gonna counsel your residents? When he's gonna go back home and back to the same situation. All right? Places. Bars, drug dens, rave parties, etc. Right? Very, powerful cues. Things. Drug injecting equipment, scales, simbangan, pipes. No? Foil, yes, foil. Lighters. Money. Music. Lalo na kung pag-high siya, tapos, he paired it. Okay. Ibig sabihin noon, nung nagagamit siya, he was listening to those music. Kaya pinir niya doon sa drugs. Okay. Everybody understand those cues? Okay. Its recovering person will be stimulated by cues that are peculiar to him or her. Kasi depende yun sa experience niya. Diba? Kung ano yung experience niya, tied into that drug use. Okay? Yun ang particular experience siya. So pag natitrigger siya, yung mga memory niya ang bumabalik. Alright? Okay. For example, for smokers, a cigarette after lunch. Right? Pinir mo yung smoking and lunch. Okay? Smoking pot in a rock concert is another one. Having a drink in a favorite bar. Hanging out with a certain crowd. Okay? Usually drug using crowd. Okay, now what is urge? Everybody understand what is urge, no? Okay, sudden impulse to engage in an act such as a drug or alcohol consumption. That's an urge. Okay? An impulse to use. All right. Give some strategies how to stop an urge. Okay, so all of a sudden, with no warning, you feel like getting high. Residents will tell you that. No? Basta na lang naramdaman ko gusto gumamit. Di ba? Gusto ko na lang. Okay, how do you actually manage that? Okay. If that is triggered by the place or where you are, where you're at, or people you're around with, get out of that situation. Okay? That's the thing. You want to suppress that urge right away. Okay? And then talking oneself out of the urge. Oh, you know, the most effective one is, this is not going to last. This is not going to last. Passing though, it will pass. It will pass. Okay? Yun. Self-talk. Going to an AA or NA meeting is another. Okay? Or going to a group. Alright? Calling a supportive person, calling your counselor, or calling a sponsor, or calling somebody who is always there for you, helping you out. Okay? Urge surfing. What is urge surfing? What is surfing? Surfing, right? Just go with it. No? Do not do anything. Just let it flow. Because again, that's not gonna stay. It will come to pass. Totoo yun. Totoo yun. Nothing is permanent. You know that, right? Even how you feel right now will pass. Okay? That's how you feel right now. In a little bit, it'll be a different one. Different feeling. So, yeah. But when you are actually suffering like that feeling, it's hard to think that this is gonna last, right? It feels like it's forever. Right? It feels like forever. But in reality, it's gonna pass. Because nothing is permanent in reality, right? Everything passes. Everything changes. Makita mo yan pag nagme-meditate ka. The whole thing, just like a kaleidoscope, keep changing. Keep changing. You know? So observe that. Just observe the changes. Observe the changes. There, just take a look at that. I'm trying to train you how to meditate. Okay. Urge surfing is just going along with it, no, with not acting on it. Just looking at it, looking at the urge, and not acting on it. Okay. Cravings. Oh, naglilihi. Di ba? Yun. Sabi natin, pag naglilihi ka, craving. Hindi ko na-experience. So, sino naka-experience ng craving? When, di ba? Bangtis. They just explained that to me. You know? Sabi, very strong ang craving ko. Very strong ang craving ko for certain. Usually, ang craving is food, right? Food. Oh, very strong ang craving ko for something sour or sweet or something, di ba? Okay. Yun. Craving for Coke. Craving is a subjective desire to experience the effect or consequences of drinking or getting high. Okay, we all understand that. We all know that. What's craving, right? Naisip mo pa lang, no? Kumain ng maasim, naglaway ka na. Or paborito mong pagkain, di ba? Okay. Nandito ka pa lang, naglalaway ka na kasi nabanggit ka yung pagkain. Okay. Right? That is, now you're craving it. Anong craving na to? Urge, oh. Ang urge is just an impulse. An impulse, a sudden impulse to actually use or experience using drugs. Ang craving, okay. Okay, so you wanted to experience the effect. Crave that, like the taste of it, the sensation that comes with it. Okay, yun. They're very close. Usually, kasabay minsan yung craving at urge, tapos craving. No? You have the urge and then mamaya, you're craving it because you're dwelling on it. Ako, masarap siguro pag gumamit ako yan. Craving na yon. Okay? Ang urge yung gusto mong gumamit right now. Okay, pag you stay on it, maya-maya, na-experience mo na, oh, ayan na. No? Parang imagine mo na ano yung tama sa'yo noon. Okay. Alright, some useful strategies to counter exposure to cues. Okay, some strategies to fight off exposure to cues. Behavior. Leave the situation. Very simple. Leave the situation. Okay? Get out of there. Carry memo cards. Ang memo cards is actually, pag, if you get into a certain situation, parang may list ka of things to do. Or get out of the situation, talk, or sing. Sing to distract yourself. Why not? No, if singing can distract yourself, right? Sino gumagawa na, you feel bad, you want to get out of the thought of feeling bad, you start singing. Who does that? Oh, Remen. Okay, si Remen, ginagawa niya. Okay, other people do that too. I'm lonely, I'm sad, I don't feel like being here. I'm gonna get the karaoke, bring it out, and then sing your soul out. Oh, Okay? Kaya lang, yung iba, kumakanta pero lasing. Hindi yun, hindi yun. Hindi ganun. Alright. Cognitive. Practice consequential reframing. Pag ginawa ko ito, right? What's gonna happen? Okay. So, thinking consequences. Or believing that this too shall pass. Temporary lang to. Magbabago din to. Lalabas din to. Okay? Affective. Call a friend or to talk. Okay? Ride a wave. Parang urge surfing, no? Okay? Similar. Ride a wave. Just ride it. Don't do anything. But just go with it. Go with that flow. Learn your people, places, things, cues, and develop strategies to deal with them. Okay? All right. Ooh. Okay. So, nasa na tayo? Next. Pwede ka mag-what? Mag-crave. No. You only crave something that you have experienced. Di ba? Imposible mag-crave ka of something you have not experienced. Okay? Okay. Questions about this? Okay. Hold on.
Morning po, Doc. Ano lang po, curious lang po ako kasi share ko lang yung meron po akong isang patient before, aftercare patient, na ang sinasabi po niya kasi is, di ba yung 15-minute na craving time po, every time na nagki-crave daw po siya is yung sa 15-minute mark na yun, nanonood lang daw po siya ng porn, ng bold, Doc. And nawawala po yung cravings niya. Nakakaiwas po siya but yung pamamaraan po niya ng pag-iwas is parang mali pa rin. Is that a good thing po?
Oh, hello, hold on. That is extreme measure. Okay, but okay, so it was effective for him, but because both actually arouses him, right? Arousal. You understand the word arousal? Okay, so when nagkikrave ka, ang arousal mo is high too. So kinaka-counter niya yung arousal for drugs into arousal for sex. Ay, ang arousal to sex, powerful din yun. Kaya naneutralize yung arousal sa drugs. Nakuha mo kay yun yun. But he can always find other sources that arouses him. Exercise is another. If you feel like, if you feel like using, put on your rubber shoes, no? Change into your running clothes and run. Okay? Okay, so that experience of running will be enough for you to distract you from that thought. Yung urges na yun and desire is temporary lang yun. It's gonna pass, right? Yung kaya lang yung pag yung porn, yung pala 3 oras na nakapako pa rin siya doon sa ano. Di ba? Tapos na yung urge niya. Ngayon iba namang urge ang dumating sa kanya. Ganun ang mangyari doon, di ba? Okay. So, find something na easily, you can do. Right? Exercise is always the best way to me. Some people said, eat some food. Na paborito mo. Whatever. To get you out of that urge. Okay. Comments? Question? Questions? No comments? Is it clear? All right. Okay. So we'll break here. Be back at 1 o'clock. Alauna po. Okay. And have a good lunch. Thank you. Alright. Kumusta? Kumusta po ang ating lunch? Busog at antok now? Too much carbs? Too much carbs. Ang carbs is, ano yan, downer. Sedative yan. Papatulog. Okay, marami pang kulang. Nasaan sila? Okay. Alright. Wala pang, marami pang kulang. No? Ilipat mo doon sa yung slide before, yung relapse as a process. Before that, I think that's it. Yeah. Okay. Alright. So, let's resume our discussion. Nako, Romel, handa ka na. Handa ka na. Okay. So, relapse is a process as well as an event. I'd like to touch on this one, no? I think we discussed that, it is a process as well as an event, no? Okay. Okay. Ayaw mag-move. Okay. So, ano ibig sabihin ng process? Ma'am? Okay na po? You're welcome. Okay, sorry about that. So, what is a process? It's there. Okay. A series of events, right? A normal phenomenon marked by a gradual changes that lead towards a particular result. The growth of plants as in the blossoming of a flower or the maturing process of humans or animals. So it's a series of events, like process. No? Okay, so that is what process means. Okay. Okay, so what is a relapse? A process and an event of resumption of substance use after a period of abstinence, right? Preceded by overt and covert warning signs of impending problem that can span days, weeks, months before an actual substance use occurs. So, yung process can start maybe a week, right? Even months before the person actually picks up the drug. Okay? So, how is the preceding definition of relapse useful in developing relapse prevention program? Now, since it's a process, it just doesn't happen. There are a series of events that takes place before the person picks up the drug. And there are warning signs, right? Okay, so let's see. Process implies time and sequence of events, right? Okay, so how does that help us in developing a relapse prevention program? In other words, we can intervene before the actual event takes place, right? Bago siya nag-pick up ng drugs, if we catch the person, beforehand, we can intervene. So how do we know? By the warning signs. Ano mga signs, no? Can you recall what are some of the things you observe before a client picks up? In hindsight, no? Yung mga nag-pick up. May mga indicators na bago siya mag-pick up, may mga indicators ba? Ano yung napansin nyo sa inyong experience? Ano mga napapansin nyo na ginagawa niya, no? Yung behavior, yung pag-iisip niya, no? Bago siya mag-pick up. Can you give us an example? Okay. Reconnecting with friends. Tama? Reconnecting, no? Yung dating yung barkada. Yun, doon nagsisimula, no? Okay. Kasi kung iba na yung takbo ng isip mo, hindi ka na interesado doon sa mga tao, mga kaibigan mo dati, di ba? Alam mo na, iba na ang trip nila, iba na rin ang trip mo ngayon. So, the fact na bumalik siya doon, ibig sabihin noon, meron pa siyang reservation about using drugs. Ano pa? Bukod sa pagbabalik doon sa mga barkada niyang gumagamit. Meron pa? Think of some signs. Ayun. No? Nag-a-absent sa mga session. No? Okay. Signs yon na iba na takbo ng isip niya na naman. Di ba? Bumababa yung motivation niya in attending the sessions, participating in the program. Nawawala na siyang motivasyon. Ano pa? Mag-overwork. Nako, huwag mo naman banggitin yung overwork. Hindi naman yun ang sana Hindi, ibig sabihin noon, no? Ang focus niya na iba. Di ba? Na ang pinagkakaabalahan niya, ibang bagay naman ngayon. Okay? Hindi yung bang pinagkakaabalahan niya yung recovery niya, attending the session, right? Making some changes in his lifestyle. Di ba? Yung implementing ano man ang plan, no? Aftercare plan. Iba na ngayon ang pinag-ukulan niya ng panahon. Okay, that could be also a sign. Okay, ano pa? Hindi na inaalagaan yung sarili niya. Poor hygiene. He doesn't care, no? Parang gano'n. Nawala. In other words, bumaba yung motivasyon niya, no? In taking care of himself, staying healthy, coming to the session. Kahit na yung niya, yung siguro, no? Pag-uusap nyo, parang wala siyang gana, no? Ganon. Di pa? Ano pa? So, walang interest masyado sa programa, missing some appointments, not taking care of his hygiene. Ano pa? Yun, hindi ginagawa yung mga homework, yung mga tasks, no? Sa ating mga residente, although nasa loob yan, nasa loob, hindi siya makagamit. May pwede bang mga signs na iba nga ang takbo ng isip niya? Anong mga napapansin mo? Exactly. Wala ng pride and quality, no? Basta lang makagawa. Hindi na talaga nag-uukol ng panahon doon sa ginagawa niya. Okay? Distracted thinking. Diba? Ganon. Tapos pati yung kilos niya, diba? Nag-iiba din yung kilos niya sa loob. No? Yung dating maayos, ngayon parang wala siyang pakialam. Okay? Ano pa? Mahalaga to kasi, babalik yan sa inyo pag actual working with clients na. Ano pa? Ano pang mga signs? Po? Yun, nagiging sakit sa ulo sa atin, no? Yung nagre-relapse ang behavior dito sa loob. Posible ba yung relapse in behavior is a sign? Yeah. No? Yeah. Sign yan, no? Nagiging matigas ang ulo, all of a sudden. Ano pa? Yung ugali, attitude, di ba? Ang attitude nagbago, no? Maramdaman mo yan in working with him. Hindi na siya interesado to explore things na relevant sa buhay niya. Ayaw niya na pag-usapan yun. Okay. So, yan. Yun ang mga warning signs or indicators of potential problems. So, dahil lang yan, no, mayroong time between the mind beginning to actually relapse in they relapse in their mind, di ba? In their heads before they actually pick up the drug, correct? So, when the changes in the mind begins, doon pwede na tayo mag-intervene doon, di ba? So, what might be a good approach to do that? How do you do that? May mga signs and symptoms. What would be how would you approach that? Ideas. How would you talk to a client? You know, nasususpetsa mo na mukhang okay, pabalik na naman siya doon. Okay, yung isip niya, mabalik. Di ba, nagre-relapse muna sa ulo, sa isip, bago actually mag-pick up. Okay, so can you make the person aware about your observation? Sabihin mo lang, you know, itong mga observation ko, help me understand. Ano kaya nangyayari? You know, help me understand what's going on with you. Ito yung mga observation ko. So, point out yung mga nakikita nyo, the observation, and then talk about that, no? Kasi posible hindi siya aware na, no, pa-relapse na pala siya. Posible yun, no? Okay, so talk about that. And then relate it to his drug use before. You know, di ba? Anong nasa labas pa siya. Ito ba ay signs and symptoms na, you know, you can possibly pick up drugs again. Okay, ito ba ay signs and symptoms na yung attitude mo at saka pag-iisip mo, pabalik ka na naman dun sa paggamit. Posible ba? Kasi sa nakikita natin. So, process that with a client. Right? So, maybe hindi siya aware. Diba? Kadalasan hindi sila aware ano yung mga signs and symptoms bago sila mag-pick up. Hindi sila aware doon, no? Okay, so you can point it out to him and it becomes like a subject in your counseling that you can explore with a client, okay? All right. Recovery is discovery. Diba? Discovering new things, no? We are a work in progress. No, recovery is a work in progress. Okay? It is. Okay, ito, mga start points. Posible ba na yung tao trying to actually work in his recovery get stuck in something, you know? Hindi siya para bang hindi niya matuloy-tuloy yung something there got him stuck. Okay? So this is what it is. Parang nawala na siya ng gana kasi napakahirap pa lang ito. No? Marami ka palang dapat gawin. Marami ka palang dapat na, you know, na ang tawag dito na matutunan para tumibay yung recovery mo. Nawawalan siya ng gana. Denial blocks awareness that something is wrong. Yun. Kina-counsel mo siya, sinasabi mo yung signs and symptoms, but he doesn't want to look at it, no? He's in denial. He denies that, hey, you know, something is wrong. Okay? So, posible din yun, no? So, di ba ang denial creates some kind of stress too? Okay, stress intensifies post-acute. Okay, so pagkatapos niya ng mag-withdraw sa drugs, mataas ang level of stress niyan. Okay? Posibleng symptoms of trauma niya mag-recur. Okay? Mag-recur. Kasi wala na yung medication niya, yung drug na ginagamit niya. That is his way of coping with symptoms of trauma in the past. Ngayon, wala sa magamit. Paano na lang? Stress talaga siya. So, yung level of stress in the early part of recovery is high. Okay? Employ old addictive behaviors to cope. Yun. Ang alam niya, no? Yung kung paano siya nagko-cope dati, yun din ang magiging coping mechanism niya. Usually, kung nasa labas siya, ayan, susceptible siya in using drugs kung na-stress siya, no? Okay. Escape means evade, deny stock points, stress, compulsive behavior, avoid others, problems caused by stress, compulsion and isolation, evade, deny new problems. Okay. Loss of control. Loss of control. Conscious awareness reactivates the recovery program. May continue to live in partial recovery. What does that mean? Partial recovery. Ibig sabihin nun, hilaw pa siya, no? So, hindi pa siya fully, how do you call that? Hindi siya talagang into it, ang tawag natin. He's not into the recovery process, no? Uminto lang siya ng pagdadrugs. Yung iba kasi, akala nila, ang recovery is hunto lang ng pagdadrugs. That's the notion of many people. Kaya sasabihin nila, 9 months na ako dito sa programa na hindi ako gumagamit. Yan ang pinakamatagal na drug-free ako. Okay? So many of them will interpret that recovered na ako. Yun nga, di ba? Ayaw nila mag-attend ng outpatient kasi akala nila 9 months na akong hindi gumagamit. Yan ang pinakamatagal na hindi ako gumamit. So, sa kanya, that's an achievement already, no? Hindi ko nakalakad ng outpatient. They really do not understand that recovery is a continuing development, no? Personal development. Hindi nila naintindihan yon, no? Di ba, isipin mo, kung dati, sila, yung mga residente natin, ang lifestyle nila, just think about their lifestyle. Di ba? Okay, so, ang lifestyle nila revolves around what? Getting high, right? Getting high. So, yun ang organizing principle nila nung nasa labas ng gagamot. Imagine mo kung nagamot sila ng mga 10-15 years, ang buhay nila for that period of time has been organized around getting high. Di ba? So, nakadevelop silang maraming dysfunctional thinking, coping, ang dami nun, di ba? Plus, not to mention yung mga relationship nilang nasira, di ba? Yung mga panahon nilang nasayang, di ba? Matagal silang unemployed. Kahit na nakatapos siya ng kolehiyo o may pinag-aralan, pero matagal din siyang regularly employed. Di ba? Paano siya babalik ngayon sa trabaho? Hindi lang naiisip yon na talaga pag para tuloy-tuloy yung recovery niya, marami siyang dapat i-reorganize sa buhay niya, di ba? Partially, we provide that dito, no? Bagong pananaw, bagong values, di ba? Di ba? Yun. Dito, at least we provide that in the program, no? But hindi sapat yun. Ano lang yun, parang he can build on what he learned from the program but doesn't mean that he learned everything already. Yun ang dapat i-emphasize natin sa kanila na ang recovery is not just to stop using drugs. Para bang i-rebuild mo talaga yung buhay mo, di ba? It's almost like building a new identity. Di ba? A new perception of yourself. No, discovering really yourself. Especially kung yung residente, naggamot, 15 years old lang siya. 15, no? Okay, hindi pa fully developed, di ba, ang sense of who he is. Hindi pa develop yun, no? Yung self-identity niya is not well-formed. Naggamot na siya. So ngayon, most of his identity in the last 15 years is all around drugs, no? The people he hanged out, yung value system niya, trying to get over, trying to manipulate, lying, and things of that. Yun ang napagkalakhan niya. So ngayon, magbabago siya, di ba? So, kailangan mabago niya ang perception ng sarili niya, di ba? Kung sino siya. Maano yan, mabigat yung trabaho yun, no? It will take years of therapy actually to achieve that. So, yung TC is a shortcut to actually long-term therapy if you really think about it. Di ba? Ang long-term therapy is rebuilding the person's identity, almost identity, no? Di ba? In a slow process. That's what psychotherapy is. We try to achieve what a psychotherapy, a long-term psychotherapy, right, which will take years, We're trying to achieve that in 12 months, or sometimes even less. That's so ambitious. Think about it. Diba? Naggamot yung tao, 15 years. He developed a sense of self around using drug. Kasi nagsimula sa bata pa eh. 15 years old, di ba? Tapos, for him to stay drug-free, we have to replace that old self. Practically, right? Old self. And then 12 months, 12 months mo lang gagawin yun? Realistic ba yun? Is that realistic? It's so unrealistic. Really unrealistic. Okay, so, kung iisipin lang, understandable yun, mag-relapse sila paulit-ulit eh. Kasi hindi pa talaga sila well-grounded on, number one, developing a new identity, who they are. Karamihan dyan, confused pa. Okay? Imagine, and then we are expected to produce a new individual out of the lives, broken lives that they had before. We're trying to recreate a new person out of that. My goodness. And then we are trying to do it in 12 months, let's say 12 months. Think about it. Is that really realistic? Is that really realistic? No, it's not realistic, right? So it's not surprising. It's not surprising that people will keep making mistake. Hindi pa nila, kadalasan, hindi pa nila naiintindihan talaga yung recovery. They are still confused. Okay? So, given that, sa akin ba, no, since we cannot keep them longer in residential, we compensate in an outpatient program. Okay? We compensate in outpatient program. So, ang task ng outpatient is not that simple. It's not that simple. It is actually building on what they have accomplished while in the residential program. Building on it. Okay? Building on it. And until they achieve really a more stable sense of person, who they are. Clear goals in life, right? New value system. Hindi lang yung natutunan nila, but they are practicing it sa buhay nila. Di ba? Being productive. Yeah? Okay? And a contributing member of society. Di ba? Nagbabayad ng taxes. Okay? So, that takes a lot of time to actually do that. Many of them are already parents, correct? Di ba? May mga anak sila. But are they ready to be parents? Many of them, nabuntis lang yung girlfriend nila, na naging asawa nila. But there was no thought in having a family. They were just having a good time. Unfortunately, no, nabuntis yung girlfriend niya. So ngayon, napilitan siya, pakasalan yung girlfriend niya. Alright, so here. You know what's gonna happen when they go out? Some of them will realize that relationship was not really meaningful. There was no love in it. Oh, there was no love. It was all lust, right? Just having a good time. Okay? Pero wala talagang feeling of love. Okay? Di ba? Isipin mo, are they really capable of loving when their first love is drugs? Are they really capable of loving? No, they're not capable of loving because their first love is the drug itself, right? Isn't it? Right? That's what it is. So now, they're in treatment, they realize, hindi talaga, walang love doon. Oh, may anak na sila. Paano yun? They're in a dilemma, right? Okay, that relationship is not gonna work. Eventually, they will split, right? Okay. So now, they're stuck with a child, correct? Kadalasan mangyayari noon, yung lola ang magpapalaki. Diba? Now, what if the parents are also using? Okay, so we repeat the pattern, right? We repeat the pattern. That's the sad thing about this. Okay, that's why we try to remedy that by actually having a parenting program in our past part of the program. Okay, helping them and even their parents, because very often yung parents na nila hindi marunong magpalaki. Siguro ganun din ang nangyari sa kanila, no? Oh, they just found themselves stuck in a relationship kasi nabuntis. But there was nothing much in there, okay? So, ngayon, mauulit na naman. So, we try to break the cycle, correct? All right. So, in other words, recovery is not a simple thing, okay? We have to tell them it's a long process, a long process of development. Radar, recognizing you're stuck, accepting that it is okay to be stuck. Detach to gain perspective, ask for help, respond with action. All right. So, the most important point in this is that relapse is a process. And within that time, before he actually picks up drugs, there's a possibility for us to intervene. Okay? All right. Next. Okay, so let's do this. Group of 3. Okay, triad. Okay, okay. Apat. A quad. 4 na tao. So, 4 kayo, that's your group, no? Yan ang topic. Discuss and list a variety of direct and indirect social pressures that can contribute to relapse. Ano yung mga direct and indirect social pressure sa ating society, no? That contributes to relapse. O, 4 kayo, 4 kayo. Ivan, dito ka. Ivan the Terrible. Dito ka. Okay, 4 kayo. Alright, organize yourself into 4. Yun ang topic, no? And then you're going to report very quickly. Just tell us what you come up with. Okay? 2 minutes. 2 more minutes. All right, time's up. Time's up. Stay where you are. Okay, stay where you are. All right, who wants to say what they come up with?
Mauna na. Ay, sige po. Oh, men. Ay, sorry. Natapon. So, yun. Ay, good afternoon, family. So, ito po yung nakam up ng group namin po sa direct and indirect social pressure. Sa both direct and indirect po, family. So, direct siya kasi pwede kasing sa family mismo may gumagamit. So, the influence, nakikita na role model. Pero kung wala namang gumagamit sa family, so inihulog namin sa indirect. Like let's say, conflict in the family sometimes compel the person to cope through using drugs. So, and friends or peers din po, nilagay namin siya both direct and indirect. Direct kasi let's say yung friends niya is gumagamit. So, nakikita niya or niyayaya siya. Indirect, kasi sometimes may mga taong longing for belongingness and nagkataon, the group of people who welcome him are those people na gumagamit. So, to be in with them, kailangan niya rin gumamit. So, naging indirect siya in a way. And then, the rest are indirect na, which are workload. May mga cases po kasi na dahil sa dami ng workload niya or kailangan niyang ganitong kind of, let's say, example na lang, truck driver, let's say, kailangan niyang bumiyahe ng 12 hours straight. So, para kaya niya yun, gagamit siya. Which is somehow leads to financial din as well, indirect pressure siya. Minsan, may mga cases na gusto nilang makarami sa trabaho nila, kailangan niyang gumamit. Just like, merong isang kaming case na gumagawa ng baril. So, nagpupuyat siya hanggang madaling araw para marami daw siyang magawang baril. So, mas maraming baril, mas maraming pera. And then, indirect as well is stigma. Stigma, may mga cases din na bumalik silang gumamit kasi ginajudge naman sila, ikaw, ganyan ka, adik ka kasi, ganyan. So, adik pala, o, sige, gamit na lang tayo ulit. So, ganon, in a way, naging indirect pressure siya. And lastly is social media. So, yung indirect influence ng social media, may nakikita tayo sometimes using alcohol, cigarettes, naging parang normal na siya na nakikita natin sa social media. So, ganun. Thank you po.
Very good. Sino naman? Susunod. Okay, dito sa mga psychologists.
Okay, so good afternoon po. Yung sa direct and indirect po namin. So dun sa direct is yung nayaya ka talaga ng mga friends or kung sino man. Okay, so example po, a friend offered you na gumamit. So biglaan kayo nagkita, so a friend offered you na gumamit ng substance or drugs. Pangalawa po, for example, no, sa barangay natin, for example, yung mga kamag-anak mo, nasa kanto sila nagiinuman or nasa labas ng bahay. So, sometimes, you feel pressured na uminom kapag niyaya ka nila. Oy, Philip, halika, shot, tagay tayo. Ganun. So, char lang. Okay. So, you feel pressured na uminom doon sa mga pagkakataon po na yan. Or, ito, example talaga nung sa mga nagre-report na patients natin. So, nagkakasabay-sabay sila nagre-report for aftercare program. And then, sa isang van, magkakasabay sila doon. So, merong usap-usapan, nagkakayayaan to use drugs. So, eventually, lahat sila napagamit, nagkaroon ng lapse or relapse. Doon naman sa indirect, sige. Yung indirect para sa amin, nagbigay kami ng example na kung saan hindi ka talagang niyaya pero you feel pressured na gumamit. For example, sa isang situation or sa isang occasion, everyone's drinking. Nakikita mo na everyone, parang lahat umiinom. Nobody asked you to drink. Pero you feel pressured kasi nandun ka sa sitwasyon na nakikita mo silang umiinom. So that is indirect for us. Tapos, working in a bar, for example. Tapos, or yung ibang work na parang yung nag-o-offer. Ano ba tawag doon? Yung mga nag-o-offer ng bahay, sales, oo, mga ganun. Tapos, merong client that would offer them na, ay, parang, para makapromote, parang ganun, na kinakailangan nila yung mga ganong bagay. And then, yung belongingness. So, for example, meron kang grupo na gusto mong mag-fit in doon sa group na yon or you want to belong doon sa group na yon and then nalaman mo that they are using. So, parang ikaw, sa kagustuhan mo na mabilong or mag-fit in doon sa group na yon, nape-pressure ka to join na gagamit para gano'n. Yun po, Doc. Thank you.
All right. Okay, that was different. Okay, sino pa? Ito naman sa likod. Yung apat. Sino yan? Sino? Okay, go ahead.
Naman po sa sinabi ni Ate Leng sa amin. Okay. Sa direct po, pag sa peer pressure, no, pag same lang din sa explanation niya, kapag inaya ka ng kaibigan mo na gumamit, yun yung direct sa akin. And then, kapag alam mo yung kaibigan mo is may pupuntahan para gumamit, nagigiyang ka din. So, yun yung indirect sa amin. And then, okay. Sa indirect din po, sa work pressure or workload po, no? So, kung feel mo na tired ka, minsan nagiging coping mechanism ng isang drug abusers is gumamit po ng drugs. Parang ganun po. And then, ano pa ba? Anong nilagay ni Ate Z? Death of loved ones. So, isa po siya sa nilagay naming indirect kasi magkakos siya ng emotional feelings na gumamit kami para ma-resolve namin yung loneliness namin. Parang ganun po. So, yun lang sa group namin.
Okay. All right. Anyone else? Okay.
Pwede po mang copy-paste. Hindi. Sa amin po, actually, medyo nahihirapan kami kasi, first of all, gusto i-define yung social pressure. So, pero yung social pressure daw is parang pressure coming from the society, whether that be the family, the workplace or the neighborhood. So, sa direct social pressure po, yun, merong yung direct na from the peer pressure. Yeah. Tapos meron din mga yung family of users. So very direct social pressure 'yon. Tapos meron din yung pakikisama sa colleagues or co-workers. Like yung sa yung mga kasamahan mong drivers, ganyan. Na gumagamit. So nakikisama din. Tapos dun sa indirect social pressure, meron yung social class niya kasi is like poverty or unemployment. Dahil sa yung siya ay mahirap, so parang kailangan niyang nalaman niya na tawag dito, may kita pala dito sa pagpupush ng droga. And then hindi niya napapansin is gumagamit na rin pala siya ng droga himself. Tapos meron din po kami sa indirect is yung stigma. Yung stigma na dahil yun yung tingin ng society sa'yo. So, why not na lang gagamit na lang din ako. So, yun lang po sa grupo namin.
Sino pa? Okay. Alright. Okay, Doc Nico.
Hi, Doc. Doc, for the direct, ang idea namin behind dun sa nangyaring discussion is those people or person who can directly influence you to go laps. For example, friends, family, parents, office mates, and also work kasi work can also give stress amongst sa mga yung mga bumabalik na dating clients, ganun. Yung pressure sa work and also breakups and loss of loved ones which can also cause pressure. Sa indirect naman, para sa amin, Doc, like alcohol, cigarette, unless you are not directly influenced by your peers to use them, if you get to see them, these are triggers which can cause indirect stimulation of your mind to go back to using those kinds of psychedelic substances. Ano pa ba? Last, parang na-discuss niya kanina yung last task, naalala ko lang, Doc. Pwede rin yun na cause ng trigger. Places like disco or mga bars. Also, movies can also influence yung mind ng mga person who uses drugs, and also music. At saka, negative emotions po. Yun po.
Okay. Diba? We're talking about social pressure, no? Yung iba parang nabanggit nyo yung mga triggers, di ba? This is specific to social pressure, no? Di ba? Okay, so what does that mean, social pressure? No? Things or cultural beliefs, di ba? Or conditioning. No, sa ating ba, ang conditioning nating makisama. Di ba? Makisama. Okay, part ng culture natin yan, di ba? Kailangan marunong ka makisama. Kaya lang, nangyayari, yung marunong ka makisama, kasama na yun pag-inom. Di ba? Okay. So, yung belief na kailangan marunong ka makisama, di na-apply doon sa alcohol, di ba? That's a very strong social pressure right there. So there are a lot of cultural things. Plus, how alcohol is viewed in our society, di ba? Okay. So if you go to Islamic countries, iba, because they do not drink. No? They do not drink or they do not use drugs. In our society, is very much part of our social life. Correct? Okay. So, para bang example, no? Yung it's hard to imagine having a party na walang alcohol. Di ba? Sa ating society. So, kasama na doon yung may paburol, mag-inom. Di ba? Birthday, painom. Almost yung mga friends ninyo, no? Expect na mayroon kayo offer. Okay, so ang lakas ng social pressure based only on our yung social ano natin. Parang naging norm na yun eh, social norms natin, di ba? Na walang enjoyment pag walang alcohol. Okay. So, ang lakas, because yung mga festivities natin, di ba? Ang pressure doon malakas, no? Festivities. Kasi again, alcohol is there. Okay, so, it's pervasive, right? Matindi talaga. Matindi, no? Ang social pressure. So, yung mga indirect yon, mga indirect, no? Yung mga practices natin, yung cultural beliefs natin, indirect pressure. Tingnan mo lang yung mga manood ka lang sa television, di ba? Nandun na kagad yun. No? Manood ka na sa sine, mga Filipino sine, no? Movies, di ba? Nandun yun. Even foreign movies, nandun yun. Okay? So, ang lakas talaga ng social pressure, no? Pagdating sa alcohol, especially sa alcohol. Okay, so, may natutunan ba tayo doon? Okay, so let's start this. Okay, helping clients understand and deal with social pressures to use substances. You can cover that, no? Talk about it. Bless you. Okay, so you can discuss this with your client. Hey, talagang mahirap you have to be aware because our society is so alcohol-oriented. Okay? It's not just us, actually. Okay? Most of Asian countries is so alcohol-oriented. Okay? All right. I was working in Vietnam, right? So alam nila na I was trying to help them set up a community-based program. So I was going from north to south, and all these officials, they have one unit there na it belongs to the Department of Social Evil Prevention. Can you believe that? It's a Department of Social Evil Prevention. So yung drug abuse prevention nila, listen, yung drug abuse prevention nila is under that, okay? Under that. Department of Social Evil Prevention. Okay. Kasama namin doon sa social evil prevention ay yung prostitution. Yeah. They consider prostitution as social evil. They consider drug abuse social evil, except alcohol. Okay. Alcohol, they do not. So, itong mga tinuturuan ko, malakas uminom. Okay, talking about social pressure. Alright? And I don't really drink. But to get along with these people and really push my agenda, I end up drinking. I'm telling you. Okay, so not only I ended up drinking, kung uminom sila, talagang inom. Talagang inom. Okay? So, in order for me to work with them, talking about direct social pressure, I had to actually go out for parties. No? Pag sinabi nila, okay, Doc, may dinner tayo mamayang gabi. You know what that means. Dinner plus the drinking. Ang highlight noon yung drinking. It seems like they cannot have fun unless, they drink. So I was drinking like a fish doon sa training na yun. So my friend, luckily, I can drink, but I never lose my mind. Yeah, one thing that my body would be like, you have to carry me, but my mind is still intact. I know exactly what I'm saying and what I'm doing. Because imagine, if I lose that, I'll embarrass myself, no? Ako pa naman ang a consultant to develop a community-based program. Kasi ang major drug nila is heroin. Heroin. And so a major problem on heroin and HIV at that time when I was helping them. So this is what I did, no? Just to cope with that. So I talked to my translator who was actually a Vietnamese physician. So lumilibot kasi yan eh. Okay, yung baso, kakain, tapos mamaya, okay. Mamaya, your turn. Okay? Toast. Okay. Tapos ng toast, kain na naman, tapos susunod naman yan. So, pagdating ko sa turn ko, sinabi ko sa translator ko, just discreetly pour the alcohol. You know, i-ano ba niya? Okay, oh, itapon niya because sabi ko after 3 rounds, I said I don't wanna drink anymore. So just protect me. So he was very good in protecting me actually doing that. You know, so he was actually pouring it somewhere when when it was my turn to drink. And I went in for a long time. So I was on the phone with my wife. I go, you know, I think when I get back to New York, you need to put me in a detox. Because, you know, because the people here, the way they drink, it's just like amazing, you know. And the thing with these people, I have the boss, the assistant director, who is always with me. He's a small guy, smaller than me, shorter than me, right? Okay, not big guy. But he can drink. I mean, this guy, I watch him, and he never loses it. No, he doesn't sway around like that. No, but he has been drinking. And you know what? The next day, he'll come to work on time. He was like up and like nothing happened last night. No hangover. So I was telling him, I said, listen, ang pangalan niya, Mr. Chung. Mr. Chung. Sabi ko, Mr. Chung, how is it that you can drink so much and I didn't see you getting drunk? Natawa na lang siya sa akin. Sabi niya, practice. Practice. Okay, so yeah. Right? That's one culture. Thailand, the same thing. I worked there and I spent a lot of time there. It is the same thing. The same thing in Thailand. Alcohol is part of a social event. Okay, so pag lumalabas kami, lagi meron yan. Bibihira na wala. But later on, you know, I told them, I said, I cannot really drink. Okay, so they respected that. So I know them better, you know, in Thailand. But the Vietnamese, that was a whole different thing because I did not know them. That was my first time to get in there. I was the UN consultant, right? And I really have to make this work with them. So I tried my best to really get along with them. I did get along with them because, you know, I went along with that drinking. But that's horrible, right? You know, to be able to work, I have to drink with them. Korea is another country also that drinking is so common, no? You know the word suju? Suju? You want some suju? This is how it looks. Similar to this cloudy thing, right? So, yeah, the soju that they have, parang lambanog. Di ba? May different grades. Meron silang grade na hindi pa matapang masyado. And you know who drink those? You know, mga colleges. Around the colleges, they have like eating places, maliliit na cafe, and they serve soju for the students. Those are not, but there are sojus na more refined. Parang yung balambanog na talaga natin. Di ba? Yun yung matapang. They love sojus. That's another thing with them, no? So, the Japanese, they like sake. So, it's China, the same thing. Okay? It's almost like in Southeast Asia, especially Southeast Asia, alcohol is pretty rampant. The only Southeast Asian countries is Indonesia and Malaysia because they're Muslim. Okay? Yeah. So, talking about social pressure, akala ko sa Pilipinas lang yun. Pagpunta ka sa ibang bansa, ganun din pala eh. You know, it's all over. In the US, it's a little different. No? Walang ganon. You know, walang ganon. I mean, alcohol is widely available too. You know, and a lot of different kinds. But they handle, it's all different. Not all parties are like heavy with alcohol. They give you a choice. Order ka. Okay? Or, you know, there is a party and then they have like drinks are included. You choose. You choose to drink. A whole different setup. Sa ating ginawa natin parang ano mo tawag dito? Talagang ang pressure, grabe. Grabe, kailangan you have to get along with it. No? Go along with it. Okay, sa US, different. It's your individual choice. If you wanna drink, go drink. If not, it's your choice. Meron lang silang bar doon. No? You can order as much as you want. Okay? That's the way they handle it. But we are unique, in that sense. But it is horrible for people who are trying to recover from alcohol or drugs. Okay? So, yeah, that's very important to explain to our clients that our culture is, it's alcohol is very much part of it. So, it's gonna be a challenge really going out there and refraining from alcohol. Okay, so helping clients understand and deal with social pressure to use substances. Identify high risk relationships. Okay, kasi social pressure, di ba? Social pressure relationships na dysfunctional or the partner is using drugs. That is a very powerful influence, no, in recovery. Imagine, you're in treatment and girlfriend mo likes to drink. How are you gonna handle that when you go out, right? And you're still, dating her. Tough. Okay? Or it could be in your family, your brothers, or even your parents. Some parents that just love to drink. Okay? That is tough. If you go home for Christmas and there's gonna be alcohol there. Man, fiesta, forget about it, right? Oh my God, that's terrible, right? And our clients exposed to that, many of them, right? Because alcohol has been part of their household. Identify high-risk situations. Of course, that's high-risk situation right there. Identify and assess effects of those social pressure on the thoughts, feelings, and behavior of clients. Of course, tremendous influence on feelings, on thoughts, and your behavior. Okay? Okay, planning, practicing and implementing coping strategies, avoidance. You can only avoid so much, you know that, right? So where do you go? Fiesta, saan ka pupunta? Di ba? Wala ka pupunta. Short of actually locking yourself in your room. Di ba? Otherwise, you go out, everybody's drinking. Yung friends, yung drinking, oh, that is so common. It's almost like, di ba? Most of us grew up, especially the guys, grew up like that, right? You have friends who love to drink. Okay? And I live where I live, it's just almost like every night they will be drinking there. Every weekend, they'll be drinking there. Like they'll be like playing some sports, but they're drinking. Or sometimes they just sit around and drink. Common yun. So, paano ka? Uuwi ka, galing ka sa university, right? And say, hey, daan ka muna dito. Isa lang. You know that isa lang. It's not gonna stop there, right? Oh, and then you want to get along with them. So, tough, right? Yeah, tough not to drink. So, yeah, been there. Okay. And then, pag nag-aaral ka, may test ako bukas, hindi, makakatulong yun sa pag-review mo. Yeah, right. Okay, verbal, cognitive, and behavioral skills. Okay, verbal, saying no. Okay. Cognitive is, what would be a cognitive coping in that situation? Social pressure. Think of that. Cognitive, social pressure, and what would be a cognitive strategy to really cope with cognitive strategy to cope with social pressure? What would you do? Can you think of any cognitive? Tough, right? Short of rationalizing. You cannot rationalize that. Okay, walang cognitive, no? Anong cognitive coping natin yan? The social pressure. I can't think of any. But behavioral, just get out of there. Avoid the situation. Okay? All right. The use of role play to rehearse refusal skills is a practical and easy to use intervention. Okay, so we know that. Finally, teach clients to evaluate the results of a given coping strategy and modify as needed. Okay, so we review, change. Okay, the key point here, dun sa role play, is they're comfortable exactly what they will do. Okay, not coming from us, but from them. Kaya mahalaga yung i-role play nila right? And then we give them feedback, but they have to do it their own style. Okay? Yan ang point yan. Okay, so, yan, social pressure. Identify social pressures, direct and indirect, events and activities. Sa atin, marami. All events, practically all social events in the Philippines has alcohol in it, right? I can't think of any social events that walang alcohol, right? And then, who are the people? Friends, mga friends, no? And then effects of social pressure, thoughts, a lot, no? There's there's a lot of effects on our thinking, our feelings, and behavior. Plan and implement coping strategies. Practice coping strategies. Okay? Oh, yeah. And then evaluate results and modify strategies as needed. So this is parang yung plan, no? On how to actually teach it to our client when they develop their coping skills strategy. It could be a role play, you know, how do you avoid, what do you say? It's tough, no? Coming up with a good excuse to get out of that situation. Okay, we finished that, right? Okay, next. Okay, it looks like we might be able to cover the 13 teams, right? We're rolling with it. Okay, next. Yung hindi pa. So, yeah, lifestyle, balanced lifestyle. Okay. All right. So, yeah, I mean, if you look at our lifestyle, right? Even us, hindi tayo gumagamit ng gamot. Very likely, sometimes we overemphasize certain things, aspect of our lives, right? Minsan yung overemphasis on our social activities, right? For example, some of us are crazy about going to the gym. Sino yon? Sino yung mahilig magpunta sa gym? Wala? Wala? Okay, I know some people, no? Back in the States, I know some people, they spend a lot of time going to the gym. Wala? Okay. So, some people, yeah. Okay. Just a regular exercise, you know, you spend at least an hour and a half. Okay? Some people will go for a walk for 30 minutes, and the rest would be just doing the weights and the whole thing. That's an hour and a half. That's very minimum. I know people who live in the gym. Seriously. Right? And they spend a lot of time there. Okay? So, okay, I know some people who spend a lot of time biking. That is, yeah. Bicycle, biking, right? Okay. Shh. Yeah. Okay. So you spend so much time in a sport. Gym, running, biking, right? At the expense of other activities in your life. Yeah. Imagine those people who spend like 3 hours in the gym. Wow. That's practically half of the day already. So what do they do the rest of the day? Look at their muscles. Go to the mirror. Go to the mirror. All right. It's almost like that's all he does. Is that a balanced life? No, that's not a balanced life. Okay? All right, so exercise is good, right? Exercise is good. All these things are good. Your social life, I consider it as social, right? Your health, no? Okay, so, but there are other things you need to pay attention to besides that, right? Okay, so that's one extreme, right? Okay, the other extreme is you are too much into what? Hobbies is another one. You know how people are also spending so much time and money on hobbies? Video games. Video games, they invest a lot of money. May tinamaan ba doon? Yung iba, my goodness, Ha? High-tech. High-tech. Ha? Mayroon pa siyang sariling room for that games. And they spend so much time in a game. Sino yung guilty doon? Taas ang kamay. Doc Franco. Oh! All right. I know it's fun, right? It's very entertaining. It's almost like, wow, I can sit here all night. Right? And forget about the job the next day. Okay. No, some people actually, okay, right? So they spend like the week, most of the time, besides working, spending in that room playing the games. Okay? It can be any hobbies, that it can get very addicting, right? Okay. So even work can be really cause imbalance in your life. I mean, it's productive, right? But at the same time, you kind of take a look at what are other things that I can get excited about. All right. So the whole idea is living a balanced life, right? And that's our clients, ang life nila when they were getting high, it's all about getting high. Hanging out with their friends, looking for money to buy drugs, right? Getting high, going to parties. Practically, that's all they do. And then go home, sleep. The next day, the same thing again, right? In and out, in and out. That's why they never finish school. They never held down a good job. And sometimes they don't even have meaningful relationship. All they have are friends with benefits. And a lot of those are also using drugs, right? And then sometimes the drug is parts of that bargain, right? Exactly, right? That's not a normal life. That's not balance at all. That's a very unhealthy life. Not just imbalance, it's unhealthy life. Okay, so now they are here, right? We give them a more balanced, hopefully, more balanced schedule. Okay, so there is time for work, there is time for therapy, there's time for play, di ba? Dapat ganon, no? We're trying to train them to live a more balanced life. Okay? Because we would like for them to replicate that when they leave. Now, remember what I said? When you work with clients in outpatient, the first thing you do is look at their structure, daily structure. You're looking for balance. Okay? Productive activities and balanced life outside. Okay? So, that is the meaning of that, towards a balanced lifestyle. They're not used to a balanced lifestyle. The other thing they are used to is actually their a day and night is reverse. They sleep during the day and they're up at night. You know that, right? Okay, so that's just the way it is. Now we want to normalize their schedule. Okay? Sleep when it's time to sleep and be up when time to get up. So sometimes they struggle when they first get here because they're so used to spending. Going to bed very late. No, that's not healthy. So same thing with us. No, we look at yung time to go to bed, and time for work, time for play. Okay, balance lahat dapat yun. So, okay. What is a balanced lifestyle? A balanced lifestyle is the extent to which a client is able to balance between the stressors in his or her life with pleasurable life events. Ano yung mga stressors? Kadalasan yung work can be a stressor, right? All right, yeah. Because there are demands, deadlines, working with clients sometimes is not the most pleasant thing, di ba? Okay. So the stressors usually related to our task, our work. Okay? But you balance that with things that are actually pleasurable in life, right? Going out with friends, watching a movie, okay? Going to a concert, going to a party, and things like that, no? Or going to the gym, exercising. Okay, so you should have that. Okay, time to read also, for mental stimulation. Okay, that's a good thing too, right? Okay. So our clients, that's very strange and foreign to them, no? Balanced lifestyle. How does this compare and differ from life of an addict alcoholic? Very different. Okay, Gorski's personality type. This is interesting. Okay, so sabi niya, extreme independence, 4 types of personalities. Those who belong to this, extreme independence, open rejection of help. Para bang I'm an island, I can survive, you know, I don't want any help, okay? Leave me alone. Parang ganun ang message niya. I'm a complete person. Okay, I don't need anyone to help me. I am in control. Okay, you have this type of personality, no? Yeah. Okay. The other one is extreme dependence, unable to recognize personal strengths and achievements, delegates responsibility for sobriety to someone else, take care of me or I will drink. Highly dependent. Okay? That's what we call extreme dependence. Okay? We have some clients like that, no? Ang tawag natin dyan, what? Big babies. Big babies in the program. Okay? All right. Okay, next, counter dependence. Appearing independent but feeling insecure. Okay? Having an illusion of strength and competence but dependent on others for recovery. Evades the real issues to be faced. Okay, that's the counter dependence. They like to be treated like an independent person, but then on the other hand, right, they have to rely on other people. Okay? We have some kids and say, Mom, leave me alone. I'm a grown up, blah, blah, blah. But then he cannot be on his own. Okay? He wants to be treated to be like an independent person, but still he cannot support himself. He's dependent to his parents for support and things like that. That's the counter dependence. Then you have the functionally independent. Functionally independent people has a positive attitude about recovery and the roles of others in his recovery. So a balance between being able to do things on his own and also knowing when to ask for help. Okay? Another is he's open. Open for help. Okay? Recognizes strengths and weaknesses. He knows his limitation. He knows, his strength. And knows when to ask for help while taking responsibility for his or her own recovery. That's the ideal person, no? Functionally independent. And that's what we would like to help our clients to achieve, to become functionally independent. Okay? And many of us are functionally independent, right? A well-adjusted person is functionally independent. Okay? All right. The client must be able to identify the stressors in his life, which can come from work, family, social, and financial life. Okay? So, balance the social stressors from things that are enjoyable for you. That's how you keep your mental health, right? That's how we keep our mental health, by living a balanced life. Okay? This must be followed by work plan to deal effectively with the stressors. Examples, how to avoid argument with an ex-wife or stepmother, how to deal with anger towards a loved one, how to deal with work-related conflicts such as conflict with a supervisor or co-worker. Can avoid it, right? Sometimes you will always have conflict, right? But how do you handle that conflict? That's the most important thing. Okay, the client needs to know the wants and shoulds in his life. What are your wants and what are your shoulds? Anyone? Shoulds. What are the shoulds in your life? These are like I should be. Arian, doctor. What? I should exercise more. Is that a should or a want? Should. Okay. How about here? What are your shoulds? I should what? You should pay your bills. You should pay your utang. On time. With interest. Okay. You should what? I'm sorry? Oh, I should get that degree. Okay, I should get that promotion. Ah. Okay, how about the wants? You want to what? I want to win the lottery. Okay, what else? I want to have my own place. I want to have my car. I want to have my own house. What? What else? What do you want? Okay, so let's look at the shoulds and wants. Example, I should have a good job. I should get married. Uh-oh. I should get along with my family. Yeah? I should get along with my family. Right? Okay, those are the shoulds, right? Wants, I want a good job. I want to find a life partner. I want to be able to get along with all my family members. Okay. Diba? Yung shoulds are expectations. Yung want is coming from you. That's what it is. Shoulds are expectations from people around us, from our families. Shoulds. Ang want is more you. Okay, you want what you want. Okay? When clients internalize the expectations of significant persons in their lives or themselves as shoulds, then they set themselves for failure when they are unable to actualize their shoulds, right? Diba? Minsan, expectations sa atin, you should have a job. You should have a good degree. Okay, so shoulds. Ano yung want mo? Diba? What do you want? Okay? Alright, so magkaiba yun, no? Help clients to identify situations and areas in their lives before onset of substance abuse, before they started using, that brought good feeling and help them pursue those activities again. Okay? So, ano yung masaya talaga sila bago sila naggamot? What are those things, no? Maybe they can go back to it. Many of them are really skillful in some things like sports. Some of them excelled in sports. And then, because they started using drugs, they just gave it up. They can pursue this again. Pursue those things again. Help clients develop some relaxation exercises or activities, stress management, and time management skill. Okay, time management skill. If you can teach your client to do that, how to manage the time better, that's a big deal, right? They can use that to, in finding a job or working, and also schooling, going to school. So time management is important. It's time management for all of us is actually important, right? A lot of times that's why we are not able to pursue other things that really we like to do, is because we do not manage our time very well. It's as simple as that. No? So be good in time management, and you will live a more productive and efficient life, right? Efficiency. You cannot be efficient unless you are very good in time management. Right? Yeah. Meditation, yoga, sports, hobbies. When clients achieve a balanced lifestyle, their self-efficacy increases, thereby giving them more confidence and motivation to maintain a sober lifestyle. So, you live more efficiently with a balanced lifestyle. Okay? All right. Okay, so we take a break here. Yeah? All right, let's take a break here. It's 2:30. I'm not sure if they're ready, but let's take a break and be back at how about 3 o'clock? Yeah. All right. Let's come back at 3 o'clock. Thank you. Okay, what happened to the psychologist here? Where are they? Please. Hmm? Lumpia yan? Oh. Ano yan? What is it? Peanuts? Okay, I'll try it. Okay. They're here. They are here. All right, come on in. Gilbert, where are you going? Thank you, Sister Joanne. Once a sister, always a sister. You know that. Okay. So this time, we're going to break into 6 people in a group. Oh, malaki-laki na ngayon. 6 people now. Okay. Okay, 6 people. Form 6 people. 6 people in a group. Yan. Alright, King, diyan ka na. Kayo, split, okay, doon. Baka dito kulang din. Kulang kayo? Okay. Oh. Yes. Saan, anong grupo mo? Dito, oh. Okay, good. Floro, saan ka? Dyan. Okay, good. Good. Alright. Now, you can have 7 if you want, no? Kung walang iba. Okay. Okay, with your group now. Okay, hello. Hi. All right, that's the topic. Discuss some of the issues faced by clients after they discharge from a residential or a hospital-based treatment. Well, we're residential treatment. Participants break into a smaller group, form into groups, and set up chairs. It's okay, never mind about that. So, ang topic is, ano yung mga challenges na naharap nila, no? So, lahat. Let's cover that, okay? Okay, yung mga challenges na yun could be also a cause for them to go back. Di ba? Alright. So, that's the task. Now, select a group leader, facilitator. No, not leader. Facilitator. And a reporter. Okay, reporter, okay? Alright. Let's do it. Let's do it. All right, let's work. Let's go to work. 3 more minutes. 3 minutes. All right, time's up. Time's up. You want to report out? Uh, okay, you're next. Okay, let's hold on. Let's pay attention. Okay? All right.
Good
Please.
afternoon, family.
Good afternoon.
For the organizing question, discuss some of the issues faced by clients after their discharge from a residential or hospital-based treatment program. So our group actually discussed, first of all, yung employment po nila. As we all know, ayun, obvious naman po yung reason. Syempre, paglabas nila, malaking problem talaga po yon, and it goes, kasama na rin doon is their actually yung finances nila. Yung stigma, connected din naman doon, as we all know. Parang 100%, ganun yung nangyayari talaga. Next is their education. Dahil karamihan din, syempre, mahinto talaga sila sa pag-aaral po nila. Next is the peer pressure. Most of our clients actually, upon discharge, nagkakaroon po sila ng welcome party. Ganun, do. Mga inuman, ganon, especially yung mga barkada na nag-aabang sa labas. So, after graduation, yon, inuman po, usually. Next po, yung mga follow-up problems nila, yung pag magpa-follow up po sila dito, Doc, syempre kasama po dyan, hindi sila makakapag-follow up due to their may financial constraints, yung time din po nila, yung distance po, yung layo nila dito. Evident din po yung motivation nila. Yung iba po kasi talagang tinatamad lang din po magpa-follow up. What else? Their support system from yung family nila sa LGU mismo is also a big problem. Yung iba naman po, another problem that we actually talked about po is yung iba pong patients na may sineserve pa pong sentence, yung remaining sentence po. Paglabas nila dito, Doc. So, i-continue pa po nila yon. Next po is for the environment, mag-iiba dito po kasi controlled po yung environment nila dito. As to compare when upon discharge, meron na po silang freedom, yung exposure nila sa triggers, exposure po nila sa temptations. Kumbaga, yung accessibility po nila sa lahat ng mga pwedeng makatrigger po sila is mawawala na. Parang ganun po yung environment nila. Next is poor social skills. Papasok po dito yung difficulty in forming new relationships. So, ang mangyayari po, may tendency po na babalik sila sa old group of friends nila or yung mga dati nilang kasama na nag-influence sa kanila to use illicit drugs po or substances. Next po is yung comorbidities like example po psychiatric or medical. Let's say example po kung may depression yung isang client or patient, may difficulty in sleeping po sila. So, ang mangyayari po dahil wala na nga po silang funds or budget to buy their maintenance medications, they tend to mag-self-medicate or iinom na lang ulit sila ng alak ulit. So, babalik lang po ulit sa dati. Next is possibility din po ng recruitment from their previous drug syndicates, yung mga dati pong na-involved dito. Usually, inaabangan po sila paglabas. So, dahil wala nga ulit po silang pera, may tendency po na bumalik ulit sila doon. And paulit lang po. Cycle. Yan lang po.
Thank you. Thank you, Dr. Joey. All right, sino susunod?
Pasa. As a group naman namin, Doc, the organizing question is, wow. Discuss some of the issues faced by clients after their discharge from a residential or hospital-based treatment program. So these are, according to our groups, these are the, yeah. Kasi nakinig tayo sa kabila. Naka-mic pala ako. Anyways, ito po. So, ang first bullet, may pa-bullet pa kami. Work po, minsan nagiging busy na sila sa work. And also, minsan, dahil kagagaling nila ng rehab, mahirap silang makahanap ng work. Kasi may stigma na, oh, addict yan, ganito, ganyan. Or kung lalo na kapag known user siya dun sa lugar nila. So, yun yung parang may stigma na, ay, huwag na natin kunin, baka ganito pa. So, sa paghahanap po ng work, ganyan. And, financial constraint, minsan po, provided nga lahat dito sa rehab, pero paglabas niya, mawawalan na siya ng means. So, magkakaroon siya ng dahil mahirap din siyang maghanap ng trabaho, hirap na siyang makapag-attend ng mga aftercare sessions niya because of lack of finances. And then also peer pressure, bumabalik yung mga dati niyang kaibigan. So, hirap siyang, of course, lalo na kapag nakababata mo yung mga yon, hirap ka talagang i-let go, although you're trying your best, but then still it's a pressure kasi nga lalo na pagkapit bahay mo pa yung mga kaibigan mo. Also their responsibilities sa kanilang parole and probation duties, may mga parole and probation penalty po kasi sila. So underlying factor din po yun. Then pwede din na exposure to triggers like lust, old vices, yun nga kanina, friends, pwede po yun. So, yung exposure nila sa triggers, lalong-lalo na kapag yung bahay nila tapat lang ng bar, mga ganun po. Tapat ng inuman, mga ganyan. Or tapat ng bakanteng lote na doon sila madalas gumagamit noon. And dysfunctional family, meron yung mga iba, pag uwi nila is wala na yung asawa, may ibang asawa na, mga ganon. May mga ganon po. So, or biglang, kala ko may pamilya pa akong dadatnan, wala na pala, mga ganon po. So, yun din po. And health reasons also, because some of our patients here have health problems. Ngayon, na-follow up pa sila kasi may mga doctors, but then, pag lumabas na po sila, wala na silang pampagamot, wala na silang and then medyo lumalala yung sakit, kaya minsan di na sila nakaka-attend ng aftercare sessions nila kasi di na kaya ng katawan. Mga ganun po. Then, sa cravings din nila, lalong-lalo na sa diet. Kung nada-diet sila dito noon, paglabas, all out na sa pagkain, and then ng pansit, mga ganon, or rice, something like that. Tapos nagkakaroon na din ng parang cravings sa paggamit. Yun po. And next page. Wala na po. Yun na po pala.
Okay. Alright, King. Yung IT natin, participan na rin ngayon.
Hello, let's go. Hello. So, hindi ko na po sasabihin yung mga nabanggit nila kasi magiging redundant lang. So, I will, ano na lang po yung mga hindi nila nabanggit sa sinulat namin. Like yung lack of structure. Kasi yung mga resident natin usually is, anong nasa resident sila, structured yung ginagawa nila everyday. Then, bigla silang pupunta, lalabas, then wala silang structure that leads sa transition. Yun, may stress na sila sa transition. Yung transitioning pace nila masyadong mabilis kaya nai-stress sila, and that result kaya nape-pressure sila, nai-stress sila, kaya that leads sa lapse din. Then andun din yung housing stability. Nahihirapan silang maghanap ng yung tanggap sila nung kanilang family. Andun kasama na rin yung stigma and discrimination doon. Tama? Siyempre, tama. Next is yung, dahil doon, usually, dahil sa nangyayari yun, once na lumabas na kasing client, ang usually nakikita dyan, sobrang hype, then, madi-disappoint, that leads to loneliness and isolation. Yun yung usually na pag nasa labas ako, nakikipagkwentuhan ako, kamusta na kuya? Malungkot kuya kasi parang wala na yung mga dati kong nakakasama, iba yung tao noon doon sa ngayon, tapos kaya parang nagiging madilim yung mind nila. So, kaya minsan pag yung iba talagang interesadong pumunta dito kasi dito sa ating region, sobrang konti talaga ng supportive group na sumusupport sa aftercare. Either kahit yung LGU is hindi ganoon ka-supportive yung LGU. Tsaka lang sila gagalaw actually pag nag-letter tayo. So, yun talaga yung mga nakikita nating problema pag lumabas na yung residente natin. Thank you po.
Alright, thank you, King. Okay, go ahead.
Okay. Gaya ng in-explain na po ni Sir Raymond yung bale bullet by bullet na lang ako yung explanation galing na kay Sir Raymond. Okay, yung sa group naman po namin, financial constraint which result to miss session po. May factor rin po kasi yung distance po nitong rehab po. And then positive RDT, unemployment which result to boredom, work to sustain daily needs, hence could hardly attend session po. Conflict of schedule of work with ACP session. Lack of support from family members. Simultaneous schedule with probation. Going back to vices and peers. Schedule with school. Bali yung conflict po ang dito. Then resistance to peers. And then stigma since people from community view TRC as a center of mental institution. So, sa labas po kasi, yung ito naman po kasi is based po sa experience po mismo nung residente po natin dito. So yung community kasi mismo nila is, ang alam nila sa rehab is for mental rehab po. And then, going back to livelihood, which is yung ano na yung trigger niya dito is money. Same true na naman po dun sa bumalik na naman po dito kasi bali kumikita kasi siya. Kaya ayun nga, bumalik na naman po yung vices. And then lack of resources to sustain maintenance medicine, dysfunctional community, cravings, serve sentence in jail, and tolerating behavior from peers and family. Yun lamang po. Thank you.
Very good. Okay, please.
Hello po, family. Sa psych naman po, sa group namin, para mas maging organized, we actually divided into 4 major domains po. First, family issues. Next, employment status. Third, peer pressure. And last po is yung medical or psychiatric concerns. Under family issues, first po na identify namin is lack of family support. Of course, so doc kasi nung dito po sa inpatient, no, we treat each other as a family po. No? And then, after ng inpatient rehab po nila, paglabas nila, kapag walang support yung mismong family nila, no, isa po yun sa pwedeng mag-urge or magtulak sa kanila na bumalik ulit sa paling paggamit. Next, separation of parents or even yung partner po nila. So paglabas, wala nang babalikan na asawa, mga ganun po. Pwede rin po yun na mag-trigger sa kanila. The next po is codependent. Kapag ang family member ay nagtotolerate, na alam na po for example, ng parent, no, kapatid na gumagamit yung patient, just because ayaw niyang ma-rehab or makulong yung kaanak nila, pwedeng itolerate nila yun. So, isa po yun sa nakita natin. And worst po is kapag may gumagamit na family member din po. Fourth po is a loss of loved one, especially if yung loved one na yun, yung tao na yun, is kino-consider ni patient as his support system po. So, mahirap tanggapin for him. Actually, meron po tayong isang patient dito, Doc. Matagal siyang hindi gumamit, pero napagamit ulit siya dahil nawala yung father niya. Hindi niya matanggap. Sobrang lungkot niya. So, yun po yung naging way niya to cope. So, yung 4 po na yun under family issues could actually lead to relapse as means of coping. And then, sa employment status naman, Doc, lack of employment due to stigma associated with substance use disorder, no? And even lack of necessary skills. So, dinivide din po namin ito pwedeng sa internal, kapag it leads to frustration. It leads to frustration, no? Especially kapag ikaw po yung parang inaasahan ng family, ikaw yung breadwinner, and then hindi ka natatanggap sa work dahil merong stigma na na-addict yan, hanggang dyan lang siya, wala siyang magagawa. Ganun, pwede po yun na mag-lead to frustration. And it actually leads to pressure din po. No? So kapag sinasabi ng family member na dapat ganito, may trabaho ka na, no, ang dami na naming nagastos para sa'yo, kaya't wala ka pa ring trabaho. So, yung pressure po na yun, no, pwede rin po siyang mag-lead doon po sa paggamit niya ulit. Next po, another one sa employment is yung financial constraint. No, dahil walang trabaho, syempre wala rin pong income, so mag-resort siya na magbenta ulit ng drugs just to compensate lang po doon sa mga failure niya na makapasok sa work. Under peer pressure naman po, so yung dito sa peer pressure, yung lungkot na kaya ng isa, hindi kaya niyang i-deal kasi kailangan niyang lumayo doon sa dati niyang circle of friends. So syempre po, paglabas niya, kailangan niyang humiwalay doon sa circle of friends niya. So makakaramdam siya ng feeling of isolation. Dahil once before, parang bilong siya doon eh. Paglabas niya, kailangan niya ulit maghanap ng circle of friends. So, pwede po din, and pwede siyang makonsider as peer pressure. Last po is kapag may mga medical concern or psychiatric concern na may comorbidity po na. So, dito po kasi sa inpatient, we make sure na controlled po no, yung mga status ng patients natin medically and sa psychiatric status din po nila. And tendency paglabas nila, syempre dahil may mga times po na walang pera for maintenance, ganun hindi po nabibigay yung mga needs nila doon sa mga medical concerns and even sa psychiatric concerns po. Yun lang po sa psych. Thank you po.
Well organized, well organized. Okay, sige. Sino? Si Ruby? Okay, Ruby, take it away.
Sorry. Ignorante sa microphone. So from unorganized to Transformers. Okay, so tama kayong lahat. Charot. Nagdagan na lang namin. Okay, so from our group, first na na-note natin no, yung sa ating mga patients is that ang family members are also mga drinkers, no? If for example, yung tatay, and then some members of the family are also abusing substances. So not good for them. Not supportive family, for example, lalo na pagka supposed to be habang nasa loob pa, may mga family sessions tayo. However, nag-a-act as if lang pala. So paglabas, may dysfunctional family pala sila. So not very supportive with their recovery. So hindi na nasusuportahan, madidisrupt din yung education nila. And then of course, may natutunan sila dito sa loob ng spiritual activities inside. However, paglabas, dahil nga hindi supportive yung family, so hindi natutuloy. And of course, yung isang maganda sa TRC lagi yung mga vocational skills. So paano kung hindi masuportahan na naman ng family niyan kasi mahirapan din yung ating mga pasyente, so masasayang yung skills nila pag hindi tuloy-tuloy. And of course, yung stigma pa din, no, yung discrimination, galing kasi sa rehab yan, so mahirapan siya maghanap ng trabaho. So no means of income. So mangyayari niyan, pag kailangan niya mag-aftercare for reporting, pare-pareha tayo ng struggles, malayo yung ating center. So yun, pag lalo na wala na nga silang employment, so walang income, mahirapan papunta dito, pamasahe. We are just lucky kung may mga LGUs na ibang supportive, like yung missionary ko sa group namin, na isang province like South Cotabato, they have their own barangay patrol cars talaga. So pag alam nila na merong for reporting, yun, nagpo-provide sila. So yun isang problem din talaga. And then, we also noted yung other patients, no, yung adjustment period. So, syempre, dito sila galing sa loob, na control environment, din yung alakas nun, yung expectation na, uy, galing ka sa rehab, dapat ganito, ganito, ganito. So, may struggles din yung ating mga pasyente na pag nandito na sa labas, ang dami ng mga external factors that can affect their, yung napag-aralan nila sa loob. And then, of course, legal issues. Yung nabanggit kanina, some our other client or patients, meron pa pong kailangang i-answer pa sa court na mga obligations. Then, yun, conflicts sa schedules, pag-report nila dito po, syempre yung iba, may trabaho na or ipagpatuloy yung school. Then, ang kagandahan din ng TRC Ilagan, no, kasi you cater also during weekends. So, that's a good practice. So, at least na-answer po yun. But some of our other clients, nahihirapan po talaga sila dahil nga sa trabaho nila and sa schooling. So, ang isa naman po namin na note sa ating mga patients na pagkalabas nila dito yung takot. Yung fear na baka nandyan yung makita ako nung ganito. So, meron sila, ang tendency is tatago na lang sila, doon na lang sila sa loob ng bahay nila. So, maganda din na turuan din natin sila ng skills din na pwede yung nasa loob lang, para maka-income din sila kahit nasa loob lang sila ng bahay. And then, of course, no, yung external triggers, no, dyan, pag nakakita sila uli ng mga paraphernalias, and then, of course, yung friends, yung peers, yung mga dating nilang dragging friends, mga classmates nila dati sa makikita sila sa aftercare ng mga dating dragging friends. So, isa yun sa mga possible no, na mahirapan yung patients natin. So, nung nasa loob pa ako dati, nasa residential inpatient ako noon na doctor, I always tell the patients na pagbutihan nyo yung dito sa loob, pag-aralan nyo talaga, intindihin yung tinuturo. Kasi dito sa loob, kumbaga sa exam, written examination ito. Ang tunay na practical exam, paglabas nyo. So, yun yung parati kong sinasabi sa mga inpatients na dapat mahasa sila dito sa loob habang wala pa. Kasi ang tunay na laban, nasa labas. Yun lang po. Thank you. Iboto sa susunod, October 30. Thank you.
Hindi ko alam, politika ka pala. Okay, pakain muna ha, pakain muna. Alright. Sino?
Good afternoon po, family. After our brainstorming, halos lahat naman ng na-come up namin na idea is pare-pareho lang. So, idadagdag lang din po namin yung sa legal domain, fear of unjustified apprehension. I'm not sure if lahat aware dun sa sistema, sa uniform personnel na accomplishment sa drug-related policies po nila, Doc. So, fear po nila na baka since nakalabas na sila, targeted na sila before, na baka po mahuli ulit sila since nakasama na sila sa drug disorder. Yun lang po, Doc. Thank you.
Meron pa ba tayong nakalimutan? Oh, okay. Everybody did. Okay, so highlights, no? Nung mga reports. Alright, so yung no? Lack of social or family support, no? Paulit-ulit yun, no? Yung, especially yung mga residente na pag-uwi nila, no? Wala na yung asawa nila. That's, okay. Well, okay. There's a bad side to that and there is a good side to that. Okay? Kasi, ibig sabihin noon, yung relasyon nila mababaw, right? Di ba? Okay, kasi, di ba, yung nangyari yun, nagdagamot siya, di ba? Okay, so, very likely, there was really not much in that relationship to begin with. Correct? Di ba? So, mabuti siguro nangyari na yun kaysa dumami pa anak nila. Dumami pa anak nila, maghihiwalay din pala. Di ba? So, really, now he can restart his life. Right? I know, he has to process that first, yung loss. Di ba? And then, if he gets over that, he has a better chance of rebuilding his life. Di ba? A better one. Okay. So, maybe highlight, what's the silver lining in this? Tapos, exploring, malalim ba talaga yung relasyon nyo? Di ba? Kasi, kung malalim yun, your wife will wait for you, will stay there, no? So, maybe wala masyado kasi nga, nagagamot ka noon. No? Okay. So, kumbaga, convenience lang yung relationship na yan, di ba? Okay. So, yeah, but again, that's also a support system na nawala, di ba? So, but he can always rebuild yung buhay niya to find another person, probably more, not enabling, more responsible, something like that. It struck me, I think, another thing that probably we should be good at is grief counseling. No? Okay, grief counseling. So, we did not talk about that. But I think, ang grief, hindi lang yung losing somebody because of death. Nakuha mo? Yung somebody, like, if you're abandoned by your wife, there is grief there. Kahit pa paano, di ba? Okay, there's grief there. So, process that. The other grief that we don't talk about is when you actually decide to stop using drugs, there is grief in it as well. But think about it, right? Yung drugs is your companion before. That's your friend before, right? In fact, some residents would say that, my drug was my companion. Before, whenever I am in trouble, I feel bad, I get high. Now, I miss that. I don't have anything else there, right, to fall back to. So there is grief over the fact that he cannot actually use substances. Or while you are in the program, losing somebody. Meron ba kayong ganun residente na somebody in the family dies while they are in the program? Process that. There is grief in there. Okay? So, especially, if that person is close to that person who passed away, make that part of your counseling. Help the person process the grief. Because if that grief is not actually processed, that could be also a trigger for him later on. You follow? Okay? So, grief counseling. Work with the client. Process it with him. Just like any other subject, no? So losing someone, deciding to stop using drugs, being clean, and losing a wife, no? Because the wife decided to marry somebody or just leave, there's a sense of loss there. Okay? So add that in your list of skills. No? Use a just a regular topic in counseling. Just as we handle certain things, basta matulungan lang ba siya to give, get in touch with the feeling, the sense of loss. Let the client experience that and feel that. And if he cries in that session, that is good because that's part of grieving. If he gets depressed over it, that is part of grieving. There's nothing to worry about. Just follow up the client. Yeah, he has to get depressed. That's part of grieving. And once he goes through that, he is likely to bounce back better. The worst is not to talk about it and suppress it. Okay? Because that grief never leaves you. It can stay there for years. Okay? And the worst thing that can happen later on is because he cannot handle the loneliness, the grief, he's going to use again. Okay, that's a high risk. That's an emotional trigger right there. All right, so pay attention to that. Okay, the other thing, a theme that keeps repeating is clients who do not have the means to continue their medication when they leave the program. Okay, so mahalaga yun, no? Kasi if that medication, we're talking about clients who are, on medication because they have depression, they are bipolar. You follow? Okay. Yung mga yun, dapat meron contingency plan tayo na paano kaya magpatuloy siya, no? Let's explore that. Kasi pag tinanggal yung medication na yun, let's say nakatulong yun dito, no? To stabilize him in the program. So because of medication, he's able to respond to the program. He was able to function. Paglabas niya, kailangan ituloy pa rin niya yun. Kasi pag tinanggal yun, nawala yun ang could be a cause for to use drugs. Because sa labas, gagamitin niya yung medication na alam niya. Drugs. You follow? So that's something to look at because that is a major cause for people to go back to using drugs. But I know that that means resources. I don't know. Maybe the LGU can help out in that. I don't know. Maybe a local clinic can begin to continue to follow up. Local, Department of Health clinics or something like that. Okay, maybe make an agreement with them that these are people who are in treatment and they have been identified to have a dual diagnosis, and the chances of them going back to drugs is very high unless there's a continuing follow up with them. So make that part of your follow up and aftercare. Okay? So ano pa yung repeatedly narinig natin na challenges? Trabaho. Okay, trabaho. So, what we did before, I don't know if Manila is a bigger place. There are more companies and industries there. I don't know how possible it is there. We have a list of companies that we develop relationship with. Okay? And then, we kind of refer people whom we know are doing very well in the program. May education naman, or very skillful kahit na hindi nakatapos yan ng college, pero very bright, naturally intelligent. Okay, so we can refer them. Parang ginawa namin friends of there. You understand? Friends of there. You can have friends of TRC, Ilagan TRC, and then we have a list of companies. So we used to invite them when we have celebration. You know, we would send invitation to remind them about us, to remind them about us. Okay, so they become part of our list of friends, and then they become a good resource also when we, you know, refer people there and see if they would take them. Okay, so that's an idea that I thought about. We used to do that. That's not really a new idea. We have those, and they love our client, our residents. You know, they because they're disciplined. You know, they never miss a day of work, right? Uh, you know, attitude wise at work is very good. Okay, because we train them very well. So I'm sure, you know, if we're able to produce those kind of residents, we should be able to refer them to those agencies too. So have a list of friends of Ilagan, you know, and sometimes they would just give us donation. Yeah, we had a lot of our furnishings in our TC before are all donations. All donations. Okay. We even have transportation donated by them. Okay. All right. So what else? What else? I heard. So that the job is a challenge. Okay. Targeted. No, not tina-target sila. You know. Okay. I don't know how we can actually fix that, but we're hoping that we begin to have very good reputation in our program. So the word will spread now. Anybody who comes out from Ilagan TRC, they're good. That's what we would like the society to look at us. Okay? So back in the day, mayroon kaming reputation, positive reputation. You understand? We built a very positive reputation in the community. So many people know about there. Okay? And in a positive way. You know how we did that? We have a Sunday Mass, televised. And our Father Bob, you know, our founder, would actually say Mass televised through one of the television channels in Manila. We were on television, so very good promotion, right? And you know who were in the Mass residence? At that time, we were not very particular about confidentiality and all of that. Okay, but you can still do that now by them signing a release that it's okay to appear on television. You know, there's a way around that. Anyway, so we have that. So yeah, we built a very good reputation in the community. Okay, little, you know, those kind of little things. So we were big on promotion, promoting our community, promoting our program in the community. So, you know, so we have better resources. So a lot of people donate us. Sometimes, you know, we don't even know where it comes from. They say, oh, we heard about you in the television during the Mass. And they're sending us something, food. We even had a piano donated by Yamaha. Yeah, we have that. We have that. Yeah, you know, I know because I was actually in the admission office, so they usually end up to me asking. So they would call, and then I picked up the phone, or my assistant picked up the phone, and then somebody wants to donate something. What else? What else I heard? Challenges, no? Difficulties. I guess that's it. Okay.
Those with unfinished sentence, they need to go back to the jail again. So how are we going to?
Now, in our case, you know, once they complete the program, we represent them. You know, I usually did that because eventually, before I left there, I became actually the court liaison. So what I would go is I'll present the case in the court, and you know, we would tell them that he completed their sentence. They're on probation. Okay, and then they would just close the case. So we have those, no? They are actually on probation on the condition that they will complete the program, and when they complete the program, actually their cases is sponged, though tanggal talaga completely, para as if nothing happened. Okay, but they have to complete the program. Okay, karamihan sa kanila, just like your residents, no? Young adults, first offender. Merong iba, we also have those na had quite a few records. We have those as well, but we have a lot of first offenders. Okay, so here is the thing. Use that with your residents and say, listen, first offense mo to, it better be the last. Because if you offend it again, you get high and you get sent in, and that's your second time. Okay, it's not good for you. Your chances, the more you actually accumulate offenses, it's not good for you, because your chances of getting a job later on gets less and less and less. Okay, so tell them that, no, that let there be your last, because if you get arrested again, that's not good for your record. Okay. Anything else that I missed or we missed? Okay. Aftercare. Let me tell you a little bit about aftercare. Okay. Aftercare was a new thing for, I would say, the first program who actually did aftercare are the therapeutic communities. Okay, so here is the story about aftercare. The original TC did not have aftercare. All right, so clients complete the program and they are released. Then they found out that those clients who are released to the society after spending 2 years, because that was the average length of time before, 2 years in a highly structured environment, then released outside, it was a culture shock for many. So many, had difficulty adjusting out there, just like the challenges that we talk about. They encountered those, right? And then those they ended up using. All right, so they figured that maybe there is something wrong with our programming. So they figured out that maybe it's too soon and it's too fast to actually release these residents after 2 years of confinement. Okay, so the aftercare was born. We even have a aftercare, preparation for aftercare, and then we have the aftercare. So once the residents reach a certain time in the program, or level in the program, they are prepared to go out. So it's a gradual process. Okay, how do we do that? We give them passes. Okay, when in the pre they are allowed to go home and back on the same day, and then with an escort. With an escort. Who are the escorts? Senior residents who are about ready to go. Yeah, ready to leave. Okay, the program. So they have escort just for our whole day, and then they write down ano yung plan nila when they go. Okay, we want to go to the movies. We want to eat. All right, and then when they come back, we process it. They say, how was the experience? Okay, how did it feel to be out there? All right. Okay, so the caseload counselor will do that. We call that the post something, okay, we call it post something counseling. Anyway, the idea is when they come back after their exposure outside, we process that experience. How did it go? How did you feel? The whole thing. Okay, so it will go on for a little bit, maybe a month of pre-reentry. We call that pre-reentry, by the way, pre-reentry. Okay, so if he is consistent and he is good, consistent in the program and does quite well, then we allow him to go by himself. Now he is about ready for entry. You understand? So gradual, no? And then when he's in re-entry, towards the end of re-entry, he's allowed to overnight at home. Overnight, okay? And in the US, sometimes they give them like an escort. but that's very impractical here in the Philippines. So, we send them alone. You can send them alone after they have been, been allowed little by little. So overnight, okay, only overnight, and then they come back. And then we process again. We use urine samples. We take the urine, okay, and then if he is able to do that, stick to the plan, he continues to be consistent in the program, then he is moved to reentry. And then the entry is practically almost living home. He still reports in the program. Oftentimes they report on weekend. They come and sleep in the program, okay, and the rest of the week they're either in school, working, or outside. Okay, and he's in the program, right? Reentry. That's our reentry program, which you call aftercare. We call it reentry. Okay, aftercare the word aftercare in our program means that the client has been discharged from the program. He is not in the program legally, okay, but he comes and visits. That's aftercare. All right, so there is some a slight change in the way we structured our what you call aftercare. So we call it pre-reentry, reentry, and aftercare. Got it? Okay. Some of them spend a lot of time in reentry because they cannot find a job, right? They have still some issues that need to work on. Okay, so and other issues, maybe behavioral, discipline issue. Okay, we keep them in reentry. Okay, so see, that was an addition to the TC. TC did not have reentry before or aftercare before. I would say that was actually incorporated in the 80s. In the 80s. Okay? So in the 70s, there is no such thing as reentry and aftercare. Got it? Okay, so that model also was adopted by other therapeutic community. They had a pre-reentry, reentry, and aftercare when we started the program. Right away, we have that. Okay, so that model was copied by other agencies also. Okay, so that's a little bit of history on reentry and aftercare. A good idea, by the way. It's great that we have that. All right. Okay, so let's move on with this. All right. Okay, drug-free residential treatment provide a gradual transition period for aftercare and self-care. Teach relapse prevention skills prior to aftercare and self-care. All right, look. These are the phases, no? A model for reintegration and aftercare. Develop a pre-reintegration program prior to completing residential treatment. Phase A, pre-reintegration, live-in, work-in. Okay? Is still in the program. Okay? And then phase B, reintegration, live-in, work-out. Okay? He lives in the community, but he works or go to school and come back. Right? That's what that means. Phase C, aftercare, live out, work out. He's practically almost outside the program anymore already. Okay, maybe he reports twice a month, or once a month. We just wanted to see how they actually function, and then they have to spend at least a year outside before we graduate them from the program. In other words, they're already on their own. Okay, and if they did not go back to drugs, they continue to be productive, then they are recommended for graduation. Okay? So we don't just graduate somebody unless they can prove themselves capable of staying drug-free outside and able to be productive during that period of time. Provide pre-discharge planning, initial appointment and appointment. Yeah. Use of phone calls, mailing, use of motivational therapy. So this is pre-discharge planning. Okay. Outpatient clinic. Provide assessment and treatment planning. provide structured program, use of one-on-one counseling program, use of groups, of course, to monitor urine, use of 12-step support group. The 12-step is outside our program, no? It's community-based, and referrals if necessary. The referrals are those people with occurring disorder that needed actually psychiatric follow-up. So we refer them because we didn't have the ability to actually provide that in our program. Okay, so we refer them in the community. In the US, that's very easy. You know, there are a lot of outpatient program, and if they don't have resources, the government help them out. Okay, so you don't have that here, so we just have to think of other different ways. Okay, let's finish that thing. We have one more, right? Okay, question with that. Yeah? Anything, the challenges of reentry? It's very challenging, right? Yeah. There's so much needs. Our clients, a lot of needs, no? That you continue to try to respond to. Okay? Question?
Since majority of our patients are plea bargainers, Doc, maybe it would be quite difficult on our part to do the three phases, Doc. Probably the pre-reentry and the aftercare, okay po. Pero yung pong lalabas and then babalik din, I think that's the problem.
You know how we handle that? Because we want to isolate our residential from outpatient and aftercare. We do it outside. We have a satellite office. That's where we do it. Okay, it's not safe to actually open your center to outpatient where clients can actually have access to resident clients. It's not safe. Okay, so you have to isolate your outpatient. Actually, that's the ideal thing. All right, where they have no chance of actually communicating. Believe me, they have very resourceful. They are very resourceful. You have to watch out. Okay, if you're doing it in here.
Doc, in that case po kasi, ang magiging problem if ever na gagawa ng mga satellite, budget. So, can we ask po yung help ng mga communities since meron tayo yung mga halfway houses and yung mga balay silangan para doon sila uuwi just in case po.
Okay, so that one can work already for people who are in the aftercare. No, you are not providing services for them. The problem with using other agency is the consistency in programming. They have different expectations from yours. So, okay, so that's gonna create some conflict, because residents say, "Oh, who do I follow?" This agency has one set of rules, and we have another set of rules. It can get very confusing. Okay, so that's the disadvantage of using other agency. But when the resident is already out, and they can provide a place for them, right? Then you can do that. But as long as you continue to do programming, provide services for them, you've got to do it by yourself. Yeah. Okay. Questions, comments? No questions? Are you still with me or what? Yeah? Okay, good. Remember, we're not done. All right. One more. Helping clients develop methods of coping with negative emotional states. All right. All right. Depression and anxiety, right? Do you have bipolar residents? Doc? EMS? Okay. And different degrees, right? All right. So you have that, no? Clients with a lot of anger? Okay, so you have an anger management module? You do? Okay, yeah. Yeah, that would be helpful for some, okay? Fear is another one. To me, and phobias. People have been traumatized. Yeah, they have irrational fears, intense irrational fears. Okay, loneliness is a common problem with our residents. They'll tell you that it gets very lonely outside. Imagine, these people, we are telling them, you drop your friends, don't, all right? Drop your friends, build a new person. Oh my God, right? And all they know outside before coming in are the drug dealers, the negative friends. So they leave and go out there. There's nobody there that they can go back to. How lonely is that? No? Okay, and guilt and shame. They're full of that guilt and shame from their past history. Okay, and boredom. They're very sensitive to boredom. They easily get bored. Okay, so really they have to develop alternative activities. Okay, because that's gonna kill them. Boredom. Okay, hold. Don't get too hungry, too angry, too lonely, or too tired. All right, right. That's a trigger, doc. That's a trigger. Yeah, right. Okay. Do you experience that? Halt. Too hungry, too angry, too lonely, or too tired. Okay, for them, that can be a trigger. Okay, so what we say, balanced lifestyle, right? Balanced lifestyle. Depression associated with substance use. Chaotic lifestyle. Okay, walang sistema sa bahay, very chaotic, right? It's not a pleasant place for you go home, it's very disorganized. Whereas here, their lives are very organized here, right? And then they go home, it's like all chaos going on. That will drive them nuts, right? That'll drive them nuts. Okay, and then sanay na sila maglinis eh. Di ba? Ang dumi ng bahay, kailangan ayusin. So maglilinis na lang daw siya. Maglilinis, mag-organize. Okay? Kasi natutunan niya sa programa, di ba? Organize your environment. No? Okay. All right. But that's the kind of life that they go back to, right? It's terrible. Okay. Losses. So they lost a lot. No? Probably before they started using drugs, they have good relationship, they have friends, right? Probably they did well in school, or sometimes they have a good job, and all of those they lost, and not counting the people they lost, in the family. So losses, conflicts, ongoing conflicts with families, right? Nagbabago na nga siya, pero yung parents niya, hindi makalimutan yung mga ginawa niya. May ganun, di ba? May ganun, no? And then the conflict is ongoing, and, it's not a good thing. Okay? So we try to actually fix it through family counseling, don't we? Yeah? You have actually, we have this thing, family dialogue. Do you have that family dialogue? We have that family dialogue. But we prepare the clients for that. And we always tell them, listen, get some sobriety, some clean time before we do a family dialogue. Okay? All right. So, we prepare them for that. So, kasi yung parents, maraming sama ng loob yan eh. Parang encounter group ba? No? So, okay. So, your residents should be really ready for that. Because after that, he can get very depressed. Because he gets reminded, I got reminded with all the things I did before. So process that, with the client. Okay, self-esteem issue, yes. There is nothing really that they can be very proud of, right? So their self-esteem is very low. And we try to rebuild that self-esteem. by at least, improving in the program, right? Umaangat siya sa programa. So then he gains his confidence, right? You can tell that they're very proud when they become like officers. So, so pag may bisita, may papasok, they introduce themselves. Good morning, I'm the coordinator of the house. And of course, the people outside, they have no idea what that means. But they're proud to say, I'm the coordinator. You see how they value that, no? They value that. So, nakakatulong sa kanila yan. It's moral boosting sa kanila yan. Kaya self-esteem na umaangat. So, mahalaga din yun. Direction in life. Many of them, they don't even know what they want. Right? Okay, so we say that a person who doesn't know what he wants is a person who doesn't know himself. Di ba? Ano yung sabi ni Socrates? A very fundamental things in life. You remember Socrates? You don't remember Socrates? Kapitbahay namin si Socrates eh. Ibang Socrates yun, ha? Okay, Socrates was a Greek philosopher. Okay, Socrates was the mentor of Plato. Big time, huh? Plato. And Plato's famous disciple is who? Aristotle. Kapitbahay din namin yun sa Aristotle. Kaya lang, ibang Aristotle yun. Okay? Yung si Plato, pangalan ng aso namin yun. Kompleto, no? Socrates, Aristotle, Plato. Okay, anyway, seriously. So, ano sabi ni Socrates? Know thyself. Very powerful, di ba? Wow. One-liner si Socrates, pero malalim. Know thyself. Okay, so that's the key. That's the key to happiness. That's the key to the meaning of life. Right? Kasi you cannot have a meaning of your life, a meaning in life, unless you know yourself, right? Yeah. You cannot have a sense of who you are unless you know yourself. Okay, our residents, many of them, they don't even know themselves. Okay, so we're trying to help them understand who you are. Okay, get an insight who you are. Then, you get a sense of direction in life. So, usually it comes in towards the end of treatment, they begin to ask, ano kaya ang pwede kong gawin? Yan, naghahanap na siya ng meaning of life. Ano kaya, pwede siguro ako bumalik sa eskwela. Magaling ako sa ganitong bagay, siguro balik ako sa eskwela, itong gagawin ko. Okay? So, sa simula, walang sense of direction yan. But if we stay with them, and they stay with us, they really make the program work, they'll find that. Okay? They'll get a sense of direction. Okay? And then psychobiology. What does that mean? Some people are sensitive to certain substances, no? Their body just predisposed to abusing certain substances. Okay? All right. That's what it means. So some people's depression, mental health issues could be because of how their brain works, okay? Their psychobiology. Okay, ano yung anxiety associated with substance abuse? Keeping the secret. Okay, so in one of our groups that we don't do anymore, no? We call it marathon. You never heard of marathon? It's a continuous group process for about 24 hours, and in some cases more than that. Continuous, no? All right. So in that marathon, the purpose of that is really find out, be able to talk about their secrets. Many of your residents have very, very deep secrets. Okay? Probably some of them have killed people. You understand? The lucky thing is they were never caught. And they keep that secret. That's the last thing that they'll talk about. But I know some people have killed somebody, Okay. And done something really, really serious outside. That's a secret. Okay, things like taboos or you know, not normal things that they have done, and they keep that a secret. From sexual dysfunction to criminal behavior, many of them have done that, and that's the deeper secret that they cannot talk about. Okay, so we believe that unless they're able to actually talk about those secrets, those are hindrances for them to actually move forward in their lives. Because there's a lot of shame and guilt over that. Okay? All right. So that was the purpose of that therapy. I don't know if we are capable of doing that, bring it out to the open and then being able to just come to terms with it and, accept that that has happened and that's past because some people are still stuck in that or stuck with that. Okay? So that is a deep treatment issue. Fears, unfounded fears. Okay, they have a lot of that, and again, some of them are susceptible to anxiety disorder because of some dysfunction in the neurotransmitters in the brain, how it works. Managing negative emotional states, identifying chronic emotional conditions, psychosocial, we can find out it through psychosocial assessment, psychiatric evaluations, observation of clients' responses to stressors. Okay, how they handle stress, how they respond to stress. Yes, Cons.
I just have a question, Doc. Regarding po dun sa previous slide, dun sa anxiety. Particularly yung sa keeping secrets. Before po kasi we conduct static groups before, and there was an instance wherein a certain patient confided to the group that he na ano siya, ba yun? Ano ba yung term? Hitman siya, parang gano'n. Gunman, parang gano'n. So, and meron din po, may mga iba pa na nagsasabi during the group sessions. How do we process that po?
Okay.
Thank you, Doc.
Well, you process just like any other issues that they have. Yeah. So, explore ano yung feeling. What was ano naramdaman nila? Okay, and very often it's guilt. Guilt over that. So they're stuck with that. They killed somebody. And for the first time, they feel really, really guilty about what happened. So, yeah. The thing that I would say is really affirm them for sharing it in the group. And then, make sure that the group, it doesn't get out of the group. I would not ask for details. Okay? Leave it there. And focus more on how they feel and how they can move forward with their lives. Yeah. So, because they're stuck with that, no? Okay. Especially after they are not using drugs anymore. So, very strong feeling yung guilt nila. Malakas yan. No? Yeah. Wow. So, I'm telling you, so you got that from static group, right? Why do you drop the static group? You're getting a lot. Where else can you really get those kind of information? Tell me. Right? But
Hindi, actually po, Doc, nagkaroon, even before interpret po, nagkaroon na po kasi ng restructuring dahil dun sa pandemic. So, hindi na kami nagkakaroon ng, nabawasan yung frequency of our sessions. And then eventually natanggal na siya dahil doon sa interpret session.
So that was very helpful, right? Yeah. So if it is not fixed, if it's not broken, don't fix it. That's the philosophy, right? So keep what works. And I know that works all the time because you don't have any other means of talking about this very traumatic experiences in life. Only that. Okay, and if we run that very well, that can also become like a trauma session. We just have to train our facilitators to to be trauma oriented or trauma informed in planning the group. Okay, so it can serve a lot of those really. I know it's common. I told you what I told you because even back home. Let me tell you, we have more leeway here, than in the U.S. Because in the U.S., when we screen our clients, if somebody killed somebody, that person is not admitted. Yep, yep. So I had a kid, right? And I'm angry and sad about what happened. This kid was just 15 years old. All right, 15 years old. He just came in. Right, he was referred to our facility. Okay, I was the, I told you I worked there. I was the assistant director there. I was responsible for developing the treatment plan. So in the course of developing the treatment plan, I was able to develop very good relationship with this kid, 15 years old. And he told me, the biggest thing that he is keeping, not telling anyone, is the fact that he shot somebody in the train. And nobody knew, and he got away with it. Okay? So because we have a protocol, right? A protocol that I have to follow, I have to report, I have to write a memo to the legal office, and they kick out this guy after he said that. Talk about, so the guy never got any treatment. The guy was punished for being honest. Right? Okay, so at least you don't have that. And that was like, meron din kayo?
Before admission, one of the requirements is a certificate of no pending case. The problem here in the Philippines is walang communications yung mga courts. So may case siya doon sa ibang court, may case dito drugs, dito homicide, dito blank yung utak ng mga judges as to the case sa other courts. So pag pumunta sa amin, tas nalaman ng ibang courts na nandito, supposed to be hindi na lumalabas for appearance muna. Pero wala kayong magawa. Philippines.
So we still follow the protocol, right? Okay. So in this case, listen. So we still So in this case, right? If we report it to me, so we assess: is this an antisocial person? Is it okay? Is he like a psychopathic personality? We still screen for that. Okay. So if we determine that the person has several and is prone to violence, okay, we will find out, in the interview, he's prone to violence. He had a lot of gang fights outside. He has uncontrollable anger and all of that. We do not accept them. Okay? So we still screen. But this guy never had a chance. He just got in. And I just wrote a memo. It's not like, okay, let's observe the guy. And let him finish the diagnostic unit because he was in a diagnostic unit. Right? So never gave me a chance to finish my assessment with the guy. I reported that thing because that's our protocol. Once you find out, you have to write a memo. But the stupid legal person, he's really stupid. He's really stupid, that guy. All right? Gusto lang po magpapapil. Gusto lang magbida-bida. Imagine that. Gusto lang magbida-bida. Oh, I kick out a guy because he reported. Oh my God. And I was so upset and angry because of that. Right? You have to continue the assessment. Obviously, this guy, because he's already in static group, he has been in the program for a while, right? Yeah. And did he show any violent predisposition? Was he violent in the program? Obviously not. So, if we just rule out, hey, he killed somebody, just kick him out. Many of our clients have those encounters, or somebody hurt somebody. Luckily, that person did not die. They have been into all kinds of situations like that. Okay, so yeah, because it comes with the territory. It comes with the territory. He was probably doing that because he gets paid. That was his main source of income, and probably that was his main source of drugs. So it came with his lifestyle out there. Okay, so I mean, you still have to continue to assess. Is he a threat in our environment? And we have resources to find out, how he responds to the program, Huh? Okay, we don't we discharge him from the program. Yeah, even though he hasn't killed anybody, we don't have to wait, no? Okay, if that person has predisposition for violence, we don't, because it's a danger in the community. Okay, so he continues to present as a problem in the community, then it's a big court. You send him back to court and say we don't have the resources to provide services for this person because we found this person, blah blah blah. Blah. Okay. Anyway, all right. So back to what I was saying, right? But that's true. That story is not unique. You will encounter residents, and probably some of them are not telling you because they're afraid that they will be reported. Okay? But once you achieve a high level of trust and they mature in the program, they'll feel, and they feel safe in the program, they'll talk about it. All right? All right. Identifying high risk factors, relationship issues, we already talked about that. No? Family dynamics, big time, and responses to normal demands. Okay, so how do they respond to just the normal demands of being in the community, following rules, following discipline? Okay, how does he respond to that? Okay. All right. Our treatment modalities, this is structure. Okay. Individual counseling, encounter group again. This is where you actually, a good way to assess their ability to control anger, encounter group. Also, it is a good way of training them to have better control of their anger, no? Okay. And then those who really cannot handle anger, then put them in the anger management group, okay, and see if that helps. All right. Okay. And work groups, seminars. We can have different seminars to address some of those issues by our clients, right? Okay. Questions? Yes.
Regarding the assessment of the patients, Doc, for trauma, ACE po ang tools. Hindi po, assessment po. Kasi, diba, para sa trauma, we have the ACE. And for psychiatric comorbidities, we can use the SRQ and the MMSE. How about for what tool can you suggest, Doc, for assessing the criminal behavior of these patients?
Actually, there are tools. We call that criminogenic. Okay, so there are tools. In fact, if you Google it, you'll probably be able to get some tools to assess criminality. It's criminal behavior. Okay, criminogenic personality, no? Okay, so you can find a lot of assessment. There's actually a training specific. It's designed for prison. Yeah, it's designed for prison. We have PC in prison, and then we have specific curriculum designed for prisoners to address criminogenic personality. No. Okay, so there are tools you can use, right? Okay. All right. Questions, comments? Questions, comments? Sa likod, walang tanong? Are you still with me or you were somewhere else? No questions? Comments?
Hello, Doc. Good afternoon, Doc. Ayan po. Doc,
Okay.
since we still don't have a proper or uniform structure in aftercare po, can we, with your permission, Doc, can we use also your slides so that we can incorporate also in our aftercare?
Yeah, sure.
Thank you, Doc.
Okay. Yeah. Yeah, definitely. Okay. And you can put a spin to it, no? You can tweak it, no? Make it more like adapted to your particular reality. The whole idea there is to do it gradually. Okay. Yeah, that's the key. All right. Questions, comments? Okay, hold on.
Doc, may case po kasi dun sa aftercare client po namin. Kasi yung in connection po dun sa sinasabi po ni Attorney Romel na mas madami siyang iba't ibang ano kasi yung parang kaso po niya. May aftercare client po ako na halos hindi, tapos na po niya yung aftercare sessions. Pero nasa jail po siya nung kinontinue po niya yung opo. Yes po. Ngayon po, meron pong parang order sa kanya, witness order po, na pupunta siya ng NBP, New Bilibid Prison. Yes po. Tas parang iniisip po namin kasi parang hindi po niya kasi naipasa yung isang indicator po dun sa anim na indicator ng DDB, yung assumption to social responsibility. So parang magkakaroon siya ng low self-esteem kasi natapos na po niya yung program. Tapos parang 4 years pa po na babayaran po niya yung sentence niya sa jail.
Ano ang original sentence niya? How long? So, did they count the time he was in treatment?
Doc, kasi ano yun, parang sinabi ko kanina, different case.
Oh.
So, hindi ko alam kung illegal possession of firearms na yun. Different case from the drug case.
Okay.
So,
wow.
Dahil sa mga ganyan po, Doc, nag-ano kami sa legal na pagka ganyan, sinususpend namin yung aftercare para after nilang ma-serve yung other cases nila, other sentences, babalik sila to continue the aftercare here.
Wow.
Ayun yung naging ano namin. Kasi marami po kasing nag-aftercare. Tapos na yung aftercare, tapos bila ikukulong na naman. Yung ano namin, magiging useless yung rehab. Kasi
exactly.
mare-reacquire nila yung
yung
prison habits nila, prison mentality nila. So, suspend.
Is there a way to actually get the whole thing lumpy together? And then come up
Yun
with...
nga po yung problema, Doc. Kasi iba-ibang courts ang ano. Kasi pag drug case, RTC. Pag yung case, mga less than 6 years ang penalty, MTC. So, iba-ibang courts po yan.
Oh. Wow. Okay.
Tapos, depende po kung yung criminal case, mai-raffle sa ibang judge. Tapos, o kaya nangyari sa ibang jurisdiction, iba rin yung court.
Ano ko lang, suggestion ko lang. Siguro maayos natin yan. Idagdag natin sa requirements natin NBI clearance. Kasi at least yun, may data bank sila ng lahat ng crime na na-commit ng isa. Oo. Ganun.
Yeah. It's counterproductive, no? Na i-rehabilitate that. Para bang we cure him from cancer and then we put him in a firing squad? Parang gano'n.
Actually, Doc, ang mas nakikita kong solution diyan is sa loob, sa residential. Especially since nasa loob naman sila, nakakausap ng caseload, why not interview them na kung meron ka pa bang ibang kaso?
Okay. Maybe that's...
Kaya napakasimple nun eh. Meron ka ba ibang kaso? Ganun lang.
Sa admission ba, hindi sila honest? They will
On
not...
admission, hindi talaga sila honest po. Talagang magsisinungaling sila, ano.
Because they prefer to be here rather than in prison.
No, because they prefer to be outside. So, nagiging honest na lang siya mga 2 months na into the program, ganyan. Saka lang unti-unting ano. Pero, tinuruan kasi sila ng lawyer nila na magsinungaling. So, or tinuruan ng mga kasama nila na magsinungaling sila. So, matagal-tagal bago sila mag-open up.
Okay.
So, ang nakikita ho namin dyan talaga is, baka pwedeng ma-interview ng caseload habang nasa loob pa para...
Yeah, the sooner we find out, the better. Okay, so that's our dilemma. No? Okay. Okay, anything else? Comments? Questions? Walang tanong? Wala? Oh. Ano yan? Okay, another lecture. Okay, no questions. All right, that's where we end our relapse prevention. Okay. Okay, so tomorrow we have 2 topics. One is integrating evidence-based practices into the TC, and then I'm gonna go over yung encounter group. Okay? Yeah. Okay. So I'll go over the encounter group, and then hopefully you can begin to actually practice it. So when I return, right? Hopefully when I return in a few months, I'm gonna go over and see how you did. How's that? That sounds good? Yeah? Oh, sa likod, hindi enthusiastic eh. Yeah, right. Hindi ko naramdaman yun. Okay. Sige. So that's the topic for tomorrow. Encounter group and then integration of evidence-based practice. Good night.
Hello, Doc. Doc, i-off na namin yung online. Thank you po.
Mm-hmm.